Comme il est 11h02, la Chambre abordera maintenant.
It is 11:02, and we will now go to private members' business, according to the today's order paper.
Orders of the day, private members' business. Resuming debate at second reading of Bill C-237, National Framework for Diabetes Act, in the name of Ms. Sidhu, Brampton South.
The Honourable Parliamentary Secretary to the Government House Leader.
Yes, thank you very much, Mr. Speaker, and what a pleasure it is to be able to address the Commons this morning. Here in Winnipeg, it's a beautiful sunny day, and I wouldn't want to be anywhere else, quite frankly. Mr. Speaker, Bill C-237 is an important piece of legislation, and I just wanted to recognize the member from Brampton South who has just put in such a spirited effort, not only in the forms of this bill, in the previous legislature. There's absolutely no doubt whatsoever in my mind that her heart and mind is with this issue. I have heard her speak on it on several occasions, both inside the House of Commons and outside the House of Commons. She is no doubt one of the most persistent, tenacious lady that I know of wanting to address what is a critically important issue in healthcare, no matter what province or territory one lives in. And I can tell you, as a former health critic, trying to understand the issues of healthcare on the broader sense, diabetes is one of those that really needs to get a whole lot more attention. We need to see different governments, levels of government working together. And it's not just the federal government working with the provinces and territories. We need to incorporate Indigenous community leaders to be able to deal with even municipal levels of governments. Even, I would suggest to you, school trustees or our school divisions. Education is so vitally important on the issue of diabetes, Mr. Speaker. And that's why when I look, it's not it's not like it's a complicated bill, but if passed, this bill would have a profound positive impact for all Canadians in all regions of our country. We're not talking about dozens or thousands, hundreds of thousands. You're talking about millions of Canadians that are impacted directly from diabetes, Mr. Speaker. Not to mention the indirects of family and friends. Suffice to say that this particular disease affects all of us in one way or another, directly or indirectly, Mr. Speaker. When you think of the costs of ignoring the issue of diabetes, is astronomical. You can talk about heart disease, stroke, kidney diseases, eye issues with eyes, dental disease, diseases related to nerves, legs and foots. One of the first real experiences I had with diabetes in terms of the severity of it from a personal point of view was when a good friend of mine had to get his leg amputated, which came as a bit of a shock to me, Mr. Speaker. But what was even more of a shock is that a couple of years later, he had passed away. And it all was attributed to diabetes, from what I understand, Mr. Speaker. It is life-saving. It is profound in the way in which we could have an impact. So that's why I think it's important that all members of the House recognize the true value of Bill 237. And to the member from Brampton South, obviously I will be supporting this important piece of legislation. And I would be shocked and disappointed if there was any member inside the House that would not support this legislation. What it in essence is asking for is the development of a national framework. Think about that, to design, to support, if you like, improved access for all Canadians to issues such as diabetes prevention and treatment. How can one not support that? If you truly understand the issue of healthcare, and you look at mobility of people today, I think it's a no-brainer that we need something like this legislation to move us forward, Mr. Speaker. I understand within the legislation that there is even some time frames from when this legislation is actually passed or receiving a royal assent after 12 months, in essence, of coming into force, that there would in fact be a report setting out that national framework, which would be obligated to be prepared and ultimately presented to Parliament. There's a sense of accountability from the Minister of Health in a time frame where the minister must report on just the effectiveness of that strategy. These are things that I believe would have a very strong impact, Mr. Speaker, on all of our communities. And one of the reasons why I think it's something in which we should get behind. Establishing a national framework will provide the Government of Canada the opportunity to work closely with the many different diabetes stakeholders that are out there. And there are some fantastic groups. I suspect one only needs to talk to the member from Brampton South, and she could cite some of those stakeholders that she herself has met with. Whether it's stakeholders or individuals or constituents in addressing this particular issue. And often when I make reference to stakeholders, I will often make reference to the different levels of government. But we have some advocates, very strong advocates with the Canadian Diabetes Association and the many other organizations that are out there to support people and advocate on this particular disease, Madam Speaker. Bringing those organizations together, bringing the different levels of government, Indigenous communities, as I consider a level of government that's equal to the national government, bringing everyone together to have that important dialogue on diabetes, understanding the very basics. Back in the mid-90s, Madam Speaker, the general education, I see my time is quickly expiring, but the general education was in great need. Even with Google today, it's still, the need is there. We need to see this legislation pass, Madam Speaker, and I look forward to it going to committee and hopefully getting through the House. Thank you, Madam Speaker.
Before I go to the next speaker, I see that the honourable member for Winnipeg Centre has her hand up. Is it for a point of order? Because there's no questions during private members' business. Oh, okay. So the honourable member for Calgary-Shepherd.
Thank you, Madam Speaker. So I'm pleased to be continuing debate here on Bill C-237, which was brought forward by the member for Brampton South. I was attentively listening to the previous member, and I agree. I don't see much to disagree with in this particular private members bill. It was, in the format of a motion in the previous parliament, and I know that the member for Brampton South is well-meaning in the work that she's attempting to have the House pass onto the committee and to study this issue some more. I mean, the contents basically create more reports to Parliament, so Parliament and parliamentarians will get further information, hopefully from government sources that we'll be able to track. It asks for very specific timetables and very specific details in the content of this report, which I am all for. Generally speaking, in government legislation, what you will find is there'll be simply an ask for a report to be made to Parliament, and often there's not much details. This one has 5 points it would like, including an explanation of what is diabetes, what is pre-diabetes. It asks for things like data on the promotion of research, for prevention and treatment. So there's a lot of good things that this private members bill attempts to do. I think what it could have also done is ask the Canada Revenue Agency to provide more information on the disability tax credit, which we know that a lot of diabetics would like to make use of. And we know that back in, I think it was 2017 or 2018, the Liberal government actually made changes to, and thousands of diabetics with type 2 diabetes were removed from their ability to obtain the DTC. And we also know that the DTC and the RDSP, which is the Registered Disability Savings Plan, are two very, very important programs that a lot of people with serious disabilities make use of. And the DTC maximum payable tax benefit back in 2019 was $8,416. So it's a substantial amount of money to help people with a disability. And in some cases, and I know many constituents, for them, their type 2 and type 1 diabetes is a very serious disability. I had a mom come to one of my town halls, and actually she also came to one of my annual general meetings of my local association at a later point, and she explained how difficult it was to live with a daughter who had diabetes, waking up in the middle of the night, because an alarm had gone off on their diabetic pump. So it's a serious, serious condition that I don't think many Canadians really understand the depth of how bad it can go. And like the member from Winnipeg had said, he kind of was sensitized to how serious this condition can be because of the complications that arise from being a diabetic and trying to take care of your condition, making sure you have enough insulin after eating especially, where one of his friends had his leg amputated. Same case for me. I have a friend of mine who had half of his foot amputated because of his diabetes that was diagnosed later in his life. So we know it is a very serious condition, and Diabetes Canada and JDRF, the Juvenile Diabetes Research Foundation, has done extensive, profound work to try and sensitize Canadians and governments across Canada about how serious this condition is, but also the weight it then places on our healthcare systems all across Canada to try and deal with this. It's one of the fastest rising chronic conditions in our healthcare systems. It's a big driver of costs in Canada for healthcare, is exactly this particular condition. And if you look at Diabetes 360, I think the Diabetes Canada has put forward an excellent plan on it. And this framework actually could be used to further those types of private sector projects that are trying to gather more support for themselves, gather more support both from government and from private sources, funding to ensure that we deal with this rising tide of diabetes diagnoses all across our country. There's a Yiddish proverb that goes, "Spare us what we can learn to endure." And diabetes is a difficult condition to endure. It's a chronic condition. I have kids who have a chronic kidney condition, so I have an inkling of what goes into trying to manage a condition like this. And a framework to Parliament, I think it's a simple ask from a member from our backbenches, from the backbenches in this Parliament, to ask the government to build information, report it back to Parliament so we can have good, solid evidence for decisions to be made into the future. And then again, to go back again to the disability tax credit, it's one of the key tools being used by those with a disability all across Canada. Many members will know I proposed C-399 in the last Parliament. I never got to a vote because I drew too high of a ballot count to make changes to the DTC specific to diabetics. And this is where it ties it in with this national framework that this member's asking the House to pass on to committee. Things like that, making an easier access to the disability tax credit or any type of disability program that the federal government could run should be in the framework. It should be addressed directly in the framework. I would hope that the reports provided to Parliament at a future point would specifically address the disability tax credit, how it functions, how it addresses issues and conditions like diabetes. I think an important factor, an important piece of evidence that it should track is the cost per person across all of Canada's healthcare systems to deal with a diabetic's condition as it worsens later in their years, the annual cost it is to the healthcare system, because I think that would lead to better decision making at the front end, where you're considering different types of insulin, where you're considering different types of technology, and then whether there is a government role or support that could be provided in order to bridge the gap for those who can't afford it. I note that the pre-budget report from the Finance Committee in this Parliament actually has one of the recommendation is to make the disability tax credit, a refundable tax credit. Those types of decisions would be obviously easier to make if a national framework and the report that comes from a national framework specifically on diabetes would be able to provide information and evidence from the DTC, for example, program and tax credit being run and administered by the Canada Revenue Agency on exactly, what are, say, the top 10 doctors in Canada who are approving these, the 6-page form for the DTC, and if they're approving them specifically on diabetes. And then that would offer an excellent opportunity for parliamentarians to reach out to those doctors proactively and ask them, what has your experience been filling out these applications? How serious is this condition? What are the extra downsides? What can it lead to? That would be an interesting data point, and we can't get that information, easily at least, without having something like a national framework to then produce the evidence. And I would like to see, like I said, the Canada Revenue Agency being compelled through a report tabled in Parliament through this national framework to provide such information. I'd also like to see, what are the provinces in which it's being applied for the most specifically to diabetes, specific to this one condition. These are all things that in the past, either JDRF or Diabetes Canada and other stakeholder groups have asked for more information provided to us so that we can make better decisions. Oftentimes I find the Canada Revenue Agency is kind of a black box. It doesn't like to reveal any type of information. I know a few years ago, the Auditor General had made a report on the DTC and the performance of the program, the administration of the program. And it wasn't very good. It wasn't up to, I think, what us parliamentarians would expect to see in the administration of such an important tax credit for Canadians. A report like this, I think, is important. I think it's beneficial. I applaud the member for bringing it forward, but I'm hoping at the committee stage, I have no doubts that we'll be able to pass it to that place, to the committee. But I'm hoping at that stage there'll be further consideration given to perhaps including a specific mention to the disability tax credit and other federal government programs specific to diabetics, that we could actually address that specific lack of information in the framework. So when it returns here to the House for having our final say before it heads to the Senate, that we could add in that important piece of information, because the changes that were made a few years ago by the Canada Revenue Agency, as directed by the government, I think really hurt the case for many, many diabetics, thousands of diabetics across the country who were removed from the disability tax credit. And it'd be good for us all to have that type of information available. Madam Speaker, I noticed you gave me the signal that my time is almost up. So I just want to say, I'll be voting for this private member's bill. I think it's a good bill. It provides the foundations for better work to be done at the committee to add in, like I said, that disability tax credit angle. And again, spare us not what we can endure to learn. Diabetes is a very serious medical condition, a chronic condition, and it's about time we have a framework in this country to deal with it. Thank you.
Reprise de débat.
Resuming debate. The Honourable Member for Abitibi-Témiscamingue. Thank you, Madam Speaker. Well, it's important for me to speak on this issue this morning, and I'd like to thank the member for giving us the opportunity to have that debate. Despite many efforts made to fight diabetes in Quebec and Canada, this chronic disease is unfortunately still with us. The number of people who have the disease continues to climb. Nearly 8% of Canadians live with diabetes, generally type 1 or 2. That's over 880,000 Quebecers and 4 million Canadians living with diabetes. Today, the treatment and management of this disease leads to an estimated economic burden of $3 billion per year. That's direct and indirect costs. People with diabetes need a range of health services to treat and manage the disease, but they also need services to help diagnose and treat complications from the disease. So the direct costs are those that come from public or private health insurance plans or by individuals and their families. Indirect costs include those that are not related to health costs, but that have an impact on the economy when there's a loss of productivity, for example, when people stay home because they're sick or when they die prematurely. Madam Speaker, the history of diabetes in Canada is long. In 1999, around 4% of Canadians had diabetes. So you can see the contrast. That number has nearly doubled in the last 20 years. Authorities wanted to take the bull by the horns, and so they set up a Canadian strategy for diabetes that aimed to have better information sharing and to mobilize various stakeholders. In 2009, 10 years later, fundraising and awareness campaigns were added to that fight against diabetes. Since 2019, organizations have required the Canadian government to have a strategic framework and a national strategy. So that's where we are today. Today we're dealing with C237, which would develop a national pan-Canadian framework on diabetes. The goal would be to improve access to treatment for diabetes and also to work on prevention. This is a good thing, and we need to act quickly because the percentage of Canadians with diabetes is continuing to grow in an alarming manner. The goal of the bill is to have the Government of Canada recognize the need to be proactive in the fight against diabetes and to develop and implement a national framework. The bill says that this should be done in consultation with the provincial governments, as well as organizations, and which would determine the broad strokes of this framework. For example, they would help provide explanations about diabetes, determine needs, promote research, promote information sharing, and analyze what has already been done in terms of having health equality. The bill gives the government 1 year to develop the strategy and then 5 years to evaluate how effective it's been. This is all a good thing. The Bloc Québécois agrees with this bill, provided that the national framework wouldn't trample on Quebec's health rights. Before the bill goes forward, our party would like to ensure that the national strategy really does reflect Quebec's needs and respects its jurisdiction. In Quebec's opinion, the federal government should really just be focusing on prevention and research. I'd like to underline the efforts made by our colleague from Brampton South. Our colleague has worked for over 15 years and even dedicated part of their career to this important cause. I know she participated in the Diabetes Canada Forum in 2018, and she also tabled 3 motions concerning diabetes in the goal of raising awareness about the disease. She even drafted a report called Defeating Diabetes, which covers some of the different aspects of the question. We believe that she's sincere in wanting to forward this cause and that she knows what she's talking about. And we do think it's important to finance research, to have better prevention, and to ensure that we have good medical advances. We need more money for research if we want to join the worldwide effort in fighting diabetes. Research is making a lot of progress in terms of how insulin can be administered, and how insulin pumps can be improved. There's even research concerning transplanting cells that produce insulin. Researchers can transform these cells into beta cells, which are safe and can be transplanted. So together, we can work on these medical advances and make progress. Now, this is all promising, but we can't neglect the important aspects and consequences that diabetes can have. Research is focused on the mechanisms of diabetes, pharmaceutical research, screening for diabetes, nutrition, weight-related issues, and appropriate physical exercise for people living with diabetes. Let's talk a little bit about obesity and diabetes. They are deeply interrelated. That is why the governments of Quebec and Canada are working on strategies to raise awareness among people about healthy lifestyle habits. Governments need to continue to raise awareness. That's not always easy when multinational organizations bombard us with advertisements for unhealthy foods that can lead to obesity and diabetes. Governments need to continue to promote physical exercise through public awareness campaigns, and they also need to strengthen tax credits for sport and recreational activities. It's important to get children moving and get them exercise because the rate of type 2 diabetes among children is very concerning. We need to continue to promote healthy eating, and it's essential that people adopt these healthy lifestyles. Governments also need to better financially support organizations like Diabetes Quebec and Diabetes Canada. In conclusion, I would remind the federal government that it really needs to do everything in its power to help populations such as Indigenous communities where diabetes exists at a much higher rate than in other communities. And I'd also like to talk about the COVID-19 vaccine. Like COVID-19, if we could focus on diabetes, we would see a lot of progress. At the Bloc Québécois, Madam Speaker, we are in favor of developing a strategy for fighting diabetes, as long as the national framework does not hurt the rights of the provinces and the sharing of jurisdiction. Thank you, Madam Speaker. And I just want to take this opportunity to add that all of the work that's being done in local and regional work is really, really important. I want to thank Anne-Marie Trépanier, a friend of mine who's been living with type 1 diabetes almost from birth. And she and many other people in my community are fighting diabetes and really improving living conditions for people who have the disease. There's a whole amount of physical and psychological support that is required for people with diabetes, and these people and organizations really play a key role in providing that support. So I think that local institutions are really important on that front. I would also mention that diabetes can affect anyone at any time. So we do need to look at the link between cardiovascular diseases and diabetes. My father died 10 years ago, and we suspected that diabetes was something that he was dealing with near the end of his life, and that probably was actually something that exacerbated his health once it started to decline. And he ultimately died of a heart attack, but we did feel that diabetes did play a role in that. So I think it's really important to invest in research and also support for people with diabetes, because that might have allowed my father to have, a longer life or at least a healthier life at the end. Thank you very much, Madam Speaker.
Resuming debate, the honourable member for Windsor West, and I'll take a minute to wish him and his wife a happy anniversary.
Thank you, Madam Speaker. It's very gracious of you, and I appreciate that because it's a special day. And to Terry, I thank her for 24 years of putting up with this. So I'll take these glasses off because they'll fog up as I talk about our the debate today. And it's a great debate. It's something that I think the House will support, but it's also something that I'm hoping, with my 18 years here in the chamber, can actually get some action. How many times do we have to talk about diabetes and issues like this and not having any real action? What's waiting? What will change from now till 10 years from now? Nothing. We know that it has a significant consequence on our population. We know it has a significant consequence on our economy. It has a significant consequence on what we do every single day. And we still don't have a national strategy, or we don't support it either through provincial or federal plans. I don't see this through a jurisdictional issue, whether it's Quebec, British Columbia, Ontario, Saskatchewan, or Newfoundland. I see this through an issue that kind of brought me to politics. As a employment specialist for persons with disabilities at PSW, I saw people with diabetes have extra complications in their life. And why we wouldn't actually provide the support for medications and proactive engagement in their treatment is beyond me as a legislator in this House, in this chamber. And why we're having to discuss this and spend time on it is kind of incomprehensible in many respects, because we know that if we actually do the right things, we can actually support people, and the modest things that are necessary gives them extra life, gives them extra employment, inclusion, and most importantly, fullness that we should actually enjoy as all of us. So we know diabetes is rising in this percentage in terms of the population. We know that there are solutions for that. And then here we are still today debating a motion, which is fine, and well, bill, but we're not acting. And so that's where kind of I have an issue with this situation right now, is that we need to move forward. We all have a unified vision of that this is a serious issue for all Canadians. We have a House and Chamber here that acknowledges that, but we're still going through a process that's very draconian with regards to getting results for people that are suffering from diabetes. So I'm really happy to actually discuss it, because it still raises the issue and it still brings us another step forward, but I'm hoping that we can actually go farther than that. And Madam Speaker, when you look at the issue of diabetes, it's one of those things that is, you know, we're affected by the consumer element with regards to what products and foods and elements that are pushed out on people, and then at the same time expecting people to manage that with medication, and then also having to deal with the facts that some people that don't have the choices. Some of us can actually drive in a car and go to a grocery store or go somewhere else and get food and other supplements that are like better in choices versus that in their own neighborhoods. Other people can't, because they have to take the bus, they have to rely on other people, or they don't have the experience or the support to do that, to actually even look at all the labels, all the ingredients, and all the different things that are in food and other types of materials that you have to deal with. So we're stuck with a situation here where diabetes is no different for those that actually have been very well privileged to have an income that can actually deal with it through a logical and a planning process and having the supports to do those things and make those choices. Then you have other people that have to deal with it because they can't get out of their apartment, or they're stuck, or they have limited choices. They don't have the choices that other people can have to actually even help themselves. And they know that. They know that, Madam Speaker. They know that. And so they have to do the things that are necessary just to manage the situation. So what I'm hoping through this motion is that it will actually propel the government to actually do something for it. We can have lots of slogans, we can have lots of different motions, we can have committee studies, all those different things. But we know diabetes affects people right now as I'm speaking. And we have solutions for that. Insulin, which is a proud point for our country in terms of its development and then also the use in our society. But we don't do that without cost. We don't do that without effect on populations. And we actually have young people that are actually organizing, and this is a sad thing. Our young people, when it looks like juvenile diabetes, are organizing and spending their time and their youth to fight for changes for us politically here. How wrong is that? How wrong is that we are actually asking our young people to spend their time and their youth to advocate for a public policy we know is true and just? And that, Madam Speaker, is what gives me difficulty in this whole situation and with what's going on here, is that we have all those tools. And we look at COVID-19 and we see what things that were impossible before COVID-19 now are simply possible. As we bail out the banks, and I talk about, you know, a good example is Bell. Bell, with $112 million of government assistance, laid off people and made $5 billion in profits. And then at the same time, we can't afford strategies for diabetes. Those are good examples of what was impossible before this and now possible now. So I'm hoping we can actually see the light here, and that with regards to diabetes and the legislation before us, 237, and other ones that come before this House, that we actually start to act. And that's important, Madam Speaker, because none of the debate here really matters in the sense that it doesn't affect an individual at the end of the day unless it actually reaches the goal line. So hopefully here today, we can see some of the actual discussion translate to real results. And that's unfortunate because when you look at this administration with the Trudeau pardon, Madam Speaker, with the Liberal administration we've had here, we've had a supermajority in the past Parliament, and now we have a Parliament that's actually in a minority. We can push things like this forward. And I'm hoping the government does that. And I don't think we need a study for 5 years to tell us the effects of diabetes. I don't think we need more research and development to understand its connection to our human bodies and how it affects us as citizens in our communities. I think we need action. And so this discussion here today really should be about whether or not we're going to act or not. That should be the kind of the benchmark. The benchmark should be whether we're going to act or not. And I think, Madam Speaker, we really should act on this right now, but with the expectations, it shouldn't be 5 years. It should be 5 weeks. It should be an initiative to actually help support what we need to have done. And the research is there, the population is there, and the inequity is certainly shown through the demographics and the research is that you can deal with this issue better if you have money versus that if you don't have money. And so that gives a greater onus on the expectations of the population. And to conclude, Madam Speaker, I just want to say that it gives us even greater importance to act now than ever before because of COVID-19. We know what we can do to prevent health issues. We can do that with pharmacare, dental care, a series of different things. But if we don't act, it doesn't mean anything. And that's the reality you have here. Why do we need another study to understand diabetes? I don't understand that. I'll support this. The NDP will support this. We'll be behind it, and we'll be pushing it really hard for it to get real results. But the action is necessary now. It'll save us money. It'll save us an opportunity to save lives. And I think that this is coming forward.
Resuming debate, the Honourable Parliamentary Secretary to the Minister of Indigenous Services.
Thank you, Madam Speaker. And I'd like to begin by acknowledging that I'm speaking to you today on the traditional territory of the Mississaugas of the Credit First Nation. As someone who lives and works on the traditional territories of Indigenous peoples, I recognize my responsibility to acknowledge and listen to their perspectives and interests. I want to thank you as well for the opportunity to speak in favor of the member from Brampton South's private members bill to establish a framework for diabetes. I also want to commend her, she has been tireless since she was elected in 2015 to raise awareness about diabetes and advocate as chair of the Diabetes Caucus to ensure the issue receives the attention it deserves. On this International Women's Day, I am so proud to serve in this parliament with her. Diabetes is an important public health issue that affects millions of Canadians from coast to coast to coast. Diabetes happens when the body loses its ability to produce or properly use insulin, a hormone that controls blood glucose levels. When it goes undetected or if action is not taken to keep it in check, serious complications can develop, and in some cases, premature death. As we know, there are 3 types of diabetes. Type 1 diabetes is an autoimmune disease in which the body is unable to produce enough insulin. It is usually diagnosed in children and young adults and is not preventable. My cousin Adam Fraser and my friend Dave Miller live with type 1 diabetes, and I've seen the challenges they face to manage their disease. Type 2 diabetes generally develops in adulthood and accounts for 90% of all individuals living with diabetes. It is caused by several factors, including obesity, ethnic background, a family history of type 2 diabetes, and other environmental factors. Gestational diabetes is diabetes that is first diagnosed during pregnancy and usually disappears after delivery. Many Canadians live with the impacts of this disease. Diabetes or prediabetes affects 1 in 3 Canadians. 1 in 2 young adults will develop the disease in their remaining lifetime. Research has shown that some Indigenous peoples and Canadians are more susceptible to diabetes than others in the general population. First Nations and Métis people, Black Canadians, and South Asian Canadians have significantly higher rates of type 2 diabetes than other Canadians. The increased risk for type 2 diabetes in these groups is often a result of inequities in social determinants of health related to income, education, and the social and physical environment. These inequities can limit the ability of individuals to access nutritious foods and be physically active, and can increase the risk of obesity, diabetes, and other major chronic health conditions. Higher rates of diabetes among First Nations and Métis people reflects the long-standing effects of colonization that disrupted the transmission of culture across generations and resulted in physical changes to the environments of their communities. Among other negative impacts, these factors limit the availability of and accessibility to important sources of nutritious foods, as well as the ability to engage in traditional active lifestyles. The COVID-19 pandemic has exacerbated and unmasked the challenges faced by people living with diabetes. We now know that people living with diabetes are at increased risk of developing severe symptoms and dying from this infectious disease. We also know that people living with diabetes can face significant challenges to participate fully in the economic and social life of Canada. This debilitating disease exacts a significant toll on our nation's economy and healthcare system. I've had the privilege to work with Kimberly Handsome from Diabetes Canada and Mike Schwartz from my riding to advance their Diabetes 360 initiative. Both Kim and Mike live with diabetes and have advocated for the need for our government to do more. I agree. I sincerely hope our government provides funding to implement Diabetes 360 in our next budget. A recent study estimated that new cases of diabetes between 2011 and 2021 account for $15.36 billion in healthcare costs. Beyond the immeasurable human costs of this disease, if prevalence grows by 40% in the next decade as projected, the healthcare costs associated with treating people with diabetes in Canada will top $39 billion by 2028. To reduce the risk of developing type 2 diabetes, the most common and preventable form of the disease, it is important to help Canadians in every way to develop healthier lifestyles. Canadians of all backgrounds and in all regions must have the opportunity to find ways to sit less, move more, eat healthier, and stop smoking. During the pandemic, at a time when we encouraged people to stay home, we can find ways to be active safely, such as going skating, skiing, or snowshoeing, or bundling up for a hike. Being active and promoting healthier weights are fundamental in helping to prevent type 2 diabetes. Canada was the first country to develop a 24-hour movement guideline for the early years children and youth. Through additional guidelines released last year, Canada now has a complete set of recommendations for physical activity, sedentary behavior, and sleep across all age groups. These guidelines are important in helping Canadians integrate healthy behaviors into their everyday lives and reduce the risk of major chronic diseases, including type 2 diabetes. Healthy eating is also a key factor in preventing diabetes. The Government of Canada is taking action to help Canadians eat better and access nutritious food. Through our healthy eating strategy led by Health Canada, we have strengthened nutrition labeling on food products, eliminated industrial-produced trans fats in foods, and are working towards restrictions on the marketing of unhealthy foods to children. And in 2019, we updated and published a new Canada Food Guide based on the best evidence available to promote healthy eating. Further, to help Canadians consume less sodium, last fall we released revised sodium targets for processed food. The Government of Canada is also working with its partners to promote healthy living and prevent chronic diseases such as diabetes. Being aware of one's risk for diabetes is also key to helping people take action to prevent the disease. The Public Health Agency of Canada, in collaboration with its partners, developed and promotes a diabetes risk questionnaire called CanRisk to help Canadians understand their level of risk in developing prediabetes and type 2 diabetes. The Government of Canada is investing in innovative community-based program and public education to test and scale up projects that help to prevent chronic diseases such as diabetes and encourage healthy living choices. The government is providing extensive support for diabetes research. From 2014 to 2019, the Government of Canada, through the Canadian Institutes of Health Research, invested approximately $229 million in diabetes research. This year marks the 100th anniversary of the discovery of insulin. I grew up in London, Ontario, the home of Sir Frederick Banting. In fact, one of my high school's rivals was Banting Secondary School. Canadians should indeed be proud of the work of Banting and Best when they discovered insulin. The Government of Canada is working with partners to commemorate this monumental Canadian innovation that has saved millions of lives worldwide. But while this milestone is indeed worthy of celebration and a source of pride, we have more to do. As Diabetes Canada says, quote, "When the world looks to Canada in 2021 to see how we are faring at treating diabetes 100 years later, Canadians will have less to feel proud of. Double the number of Canadians lives with diabetes than they did 15 years ago, and Canada is in the worst third of developed countries for both prevalence and costs of treating the disease. The problem of diabetes is very bad and rapidly getting worse. We need to do something bold to address this problem and mark this important anniversary in 2021, end quote. 11 million Canadians are living with diabetes or pre-diabetes. Chances are the disease affects you or someone you know. In closing, Madam Speaker, I am pleased to support Bill C-237 as the government continues to undertake meaningful efforts towards preventing and reducing the impact of diabetes and other chronic diseases on Canadians. This bill reminds us that we need to increase our efforts and work together alongside individuals living with diabetes to reduce the burden of this devastating disease and improve health outcomes for Canadians and Indigenous peoples. And finally, I would like to thank again the member for Brampton South for bringing this bill before the House of Commons and her tireless advocacy. Thank you, Madam Speaker.
Resuming debate, the honourable member for Provencher.
Good morning, Madam Speaker, and thank you for this opportunity to speak to this bill. Mitch Boucheman was a lifelong resident of Ile-des-Chênes, Manitoba, in my riding of Provencher. His family and friends described him as a quiet, gentle, and generous individual, always ready to lend a helping hand, yet never needing recognition. Well, I'm going to give him a little recognition this morning. Mitch was a member of the Ile-des-Chênes Knights of Columbus Council and an advocate for Diabetes Manitoba. He was passionate about supporting those living with diabetes, and he actively lobbied the government on behalf of those with the disease. Mitch just wasn't an advocate. He lived with type 1 diabetes for 40 years. Then, early last year, Mitch was able to receive a kidney and pancreas transplant, effectively closing the chapter on decades of managing his diabetes. Sadly, he passed away this past September, but not without leaving his mark. In 2016, I was invited to be one of several guest speakers at a fundraiser Mitch organized called Let's Get Pumped, with proceeds going to the Canadian Diabetes Association. It had all the trappings: a luncheon, live music, speakers, and a silent auction, and a 50-50 draw. He was quoted in the Niverville Citizen at the time saying he wanted to do this event not only because of his own experience, but for all diabetics in the province. Beyond this event, my office heard from Mitch from time to time, always making sure diabetes was top of mind for decision makers. Though I know many, including his wife Kathy, are missing him dearly, his memory lives on. It's a pleasure to have this opportunity to speak to Bill C-237 this morning, the National Framework for Diabetes Act. I would like to think that Mitch would be pleased to see this conversation taking place today in this House of Parliament. I want to thank my colleague, the member for Brampton South, for bringing forward this legislation. Her advocacy has been generating general awareness about diabetes for several years now. As Diabetes Canada so succinctly puts it, diabetes is a disease in which your body either can't produce insulin or can't properly use the insulin that it produces. Some 11 million Canadians are living with diabetes or pre-diabetes. If we consider an average 24-hour period, about 20 Canadians will die as a result of diabetes complications. 620 will receive a diabetes diagnosis. 14 of them will have their lower limbs amputated. These numbers represent real people, family members, friends, neighbors, whose lives have been lost or dramatically changed as a result of this disease. The National Framework for Diabetes Act seeks to develop a national framework designed to support improved access to diabetes prevention and treatment to ensure better health. It looks to include measures to explain what diabetes and prediabetes are, to identify training and education needs of healthcare professionals related to the prevention and treatment of diabetes, to promote research and knowledge sharing, and to improve data collection. Bill C-237 would also require the Minister of Health to hold at least one conference with relevant stakeholders to develop this framework. And within 1 year from when this act comes into force, the Minister must report to the House on this framework. This is an important accountability mechanism that ensures the Minister will do the work necessary to build this framework. Although we must also be wary that this has no guarantee that the Minister would meaningfully address issues that face diabetics here in Canada. Canadians should have stable and reasonable access to the healthcare and treatments that they need. By working with stakeholders like Diabetes Canada, we can take concrete steps forward to develop a plan for the prevention and management of diabetes in Canada through a national strategy. When the Health Committee studied this subject in 2019, it made important recommendations which bear mentioning. First one was that the Government of Canada, in partnership with provinces and territories and in collaboration with stakeholders such as Diabetes Canada, plan and implement an approach to the prevention and management of diabetics in Canada through a national diabetes strategy. And secondly, that as a part of a national diabetes strategy, the Government of Canada, in partnership with the province and territories and in collaboration with stakeholders such as Diabetes Canada, explore options for establishing a national diabetes registry for people living with both type 1 and type 2 diabetes, explore options to reduce diabetes-related stigma, and finally, explore options to improve public health awareness and education on diabetes, particularly through community programming, including public awareness of the relationship between nutrition and diabetes. The bill serves to answer the call on these 2019 recommendations, but it is worth noting that programming already exists to address common risk factors of diabetes within the integrated strategy on healthy living and chronic disease. In going forward with this bill, there must be clarity about how the national strategy would tie in with existing programming. A number of previous governments had taken important steps forward on diabetes as well. In 1999, the federal government created the Canadian Diabetes Strategy to further the prevention, early detection, and self-management of diabetes and its complications and national surveillance. They committed $115 million over 5 years for that strategy. In 2005, the Canadian Diabetes Strategy became part of the Integral Strategy on Healthy Living and Chronic Disease. Funding for the Canadian Diabetes Strategy was renewed in 2005, and $18 million yearly was introduced for the Public Health Agency of Canada's diabetes programming. Funding for diabetes research is also dispersed through the Canadian Institute for Health Research. In 2010 and 11, under the previous Conservative government, the Canadian Institutes for Health Research funded approximately $44 million in diabetes research. As I reviewed this history, I was struck by the gap between the previous Conservative government's funding and where we find ourselves today. When the Health Committee recommendations I highlighted earlier were laid out, the committee had a Liberal majority. They were supported by Canadian Conservative members of the Health Committee, and it was understood that the government needed to act. Unfortunately, we just haven't seen much action from this current Liberal government. As a government during these recent years, they could have introduced a government bill, but no such bill was introduced, not when they had a majority and not now in current Parliament. Had they chosen to introduce a government bill, Parliament could have already had work underway to develop this framework. Bill C-237 is important, but Canadians with diabetes also know it's late. It's also troubling that this Liberal government's most memorable connection to diabetes is when they oversaw a Canada Revenue Agency crackdown on access to the disability tax credit, a non-refundable tax credit that helps persons with diabetes reduce the amount of income tax they may have to pay. In 2017, the CRA began restricting access to this disability tax credit that affected hundreds of Canadians living with diabetes and other rare diseases. This happened because officials changed the interpretation of the rules around life-sustaining therapy and associated requirements for those diseases. Our Conservative opposition sounded the alarm and stood with organizations demanding that Canadians continue to receive the benefits they ought to have access to. Given this history, I think there would be value in including an amendment to ensure that the Canada Revenue Agency is administering the disability tax credit fairly, and that the disability tax credit is designed to help as many persons with diabetes as possible. I think this is something that would give the committee can look at when this bill is referred. I think we can all see how this would give greater certainty to those folks who rely on the disability tax credit. But now it's my duty as an opposition member to constructively critique the proposal. I've highlighted where I think it could be bettered, but I don't want to dwell there. I appreciate that the member for Brampton South is stepping up. In the absence of action from her government, she is using the opportunity, thank you, that she has been afforded through the private members bill lottery to move the dial forward on this issue. I commend her for that. And at a time when so much attention has been dedicated to COVID-19, it can be easy to forget that the daily challenges faced by individuals with diabetes have continued without receiving much media attention and without widely publicized diagnosis. The final word is this: there is merit to committed and coordinated federal leadership to tackle diabetes in Canada. We have an opportunity to move the ball forward in a strategy that can help support those living with diabetes and help prevent millions of potential cases like this. Like I said before, we're talking about real people. This can better the lives of millions of Canadians today and in the future. I encourage all members of this House to move this bill forward to committee so that we can take a long overdue step. Thank you, Madam Speaker.
Resuming debate, the right of reply for the honourable member for Brampton South, 5 minutes at the most.
Thank you, Madam Speaker. I would like to thank all the members who spoke to this bill. The member from South Okanagan West Kootenay, Winnipeg North, Calgary Shepherd, Abitibi Timiskaming, Windsor West, Oakville North Burlington, Provencher, and the member who spoke during the first hour of debate. The member from West Nova, who I serve with on the Health Committee, spoke about his son's diagnosis. The member from Shepherd who told us about her relative's diagnosis. My friend from Brampton North who told us about her grandmother and her childhood friend who would later pass from complications related to diabetes. Madam Speaker, there are too many heartbreaking stories like this. Almost 11 million Canadians live with diabetes or pre-diabetes. The number of diagnoses has doubled in the past 20 years. And every 3 minutes, another Canadian is added to the list. In my city of Brampton, every 6th Bramptonian lives with this disease. For 18 years working in healthcare, I saw how diabetes impacts Canadians. Often I would see patients with cardiovascular disease, kidney disease, amputation, or high blood pressure. And diabetes was often an underlying and complicating condition. Diabetes also disproportionately impacts Canada's Indigenous and racialized communities due to socio-economic factors. From the last term, I met with Canadians through my cross-country consultation and with world-leading experts through international conferences. If we rededicate our efforts to reducing the number of cases and improving treatment and care for those living with this disease, then we make progress in the battle against diabetes. I would like to take a moment to thank the individuals who have supported this bill and helped it come together. I also want to say thank you to Mayor of City Brampton, Mayor Brown, City Council members, including Councillor Medeiros and Field Medical Officers of Health, Dr. Lawrence Lowe. Great advocates Laura Siren, Russell Williams, and Kim Hansen at Diabetes Canada. Organizations like JDRF, CNIB, and Canadian Nurses Association, and of course, my colleagues in the All-Party Diabetes Caucus and the JDF Caucus, and many more. As someone who has served on the Standing Committee on Health since 2016, I was proud when we brought forward our report calling for a strategy such as a Diabetes 360 to fight diabetes. It was concluded that diabetes would cost Canadians almost $40 billion a year by 2080. We need to work with provinces and territories, Indigenous groups, medical professionals, and community organizations so that we can best serve the patients living with diabetes. And the research who will end it. Bill C-237 calls on the government to do that, to create a national framework for diabetes. As parliamentarian, let's recommit to helping everyone battling this chronic disease, whether they are patients, or doctors, or researchers, or loved ones, and continue fighting it so that more Canadians can lead a healthy life. This year, we commemorate the 100th anniversary of discovery of insulin by Frederick Banting, an event that is recognized as one of the most important medical discovery of the 20th century. Since then, we have continued to lead the way with stem cell research, which could one day lead to a cure. Madam Speaker, Canada gave insulin to the world. Why we cannot lead the way in defeating diabetes? I hope all members will join me in supporting my bill C-237. Thank you.
Thank you. And I do want to remind members just to maybe before they start, if they know that they're coming up to speak, that to make sure that their mics are selected correctly to ensure that the interpreters are able to interpret what they're saying in both official languages. But we do appreciate the fact that the documentation is being provided ahead of time, and then that way if there's an issue, the interpreters are still able to continue to interpret. The question is as follows. Ms. Sidhu, Brampton South, seconded by Mr. Lamour, move that Bill C-237, an act to establish a national framework for diabetes, be now read a second time and referred to the Standing Committee on Health. Si un député d'un parti reconnu présent.
If a party of a recognized party in the House wants to express their dissidence, I invite them to rise and to indicate it to the Speaker.
Thank you very much, Madam Speaker. I would request a recorded division.
L'ordre adopté le lundi, le 20.
Order adopted. The recorded deferred division is deferred to Wednesday, March 10th, 2021, at the end of the time provided for question period.
Orders of the day. Ordre du jour. On a un point d'ordre. L'honorable député de Salaberry-sur-Roi.
Merci, Madame la.
Thank you, Madam Speaker. I am invoking a point of privilege further to the point of order that was invoked regarding the use of masks during speeches in the House. This is a basic question that we would ask you, Madam Speaker, to rule on. We must allow the interpretation services of the House of Commons to do their work properly while respecting the Official Languages Act in respect of both official languages. It is clear that the wearing of certain masks undermines the interpretation in the House, and we can confirm this due to the events of February 25th. On Thursday, the Liberal member for Kingston and the Islands made remarks that challenged the rights of members in this House to follow this debate. He said this is the second time over the past weeks that the Bloc Québécois has underscored that wearing masks undermines the ability of interpreters to do their job. I don't know whether it is up to us to decide what is effective or not. I do not believe that anyone in this House is qualified to decide whether the mask is the main source of the problem. Madam Speaker, the Bloc Québécois believes, indeed, that the wearing of certain types of masks undermines the interpreter's ability to do their job. As my colleague from Rivière-des-Mille said, and I quote, masks create an obstruction. Thicker masks create even more obstruction, and remarks are not audible for the interpreters. At this time, it is as simple as that, end of quote. Madam Speaker, unlike what the member for Kingston, I believe that you are properly positioned to indicate to the members the proper balance between the wearing of masks and the ability of interpreters to interpret. I might remind the House that interpretation services are essential services. In 1958, the House gave its agreement to the installation in this place of simultaneous interpretive booths for both official languages. The Official Languages Act confirms that both English and French are the official languages of Parliament and protect the rights of members to use either one of these languages in all debates and other parliamentary proceedings. But the Act goes further. Part 1 of this act, guarantees the right to simultaneous interpretation in the House and for other parliamentary proceedings. Section 4 provides for the holding of debates in Parliament. French and English are the official languages of Parliament, and each and every member has the right to use either language during these debates and parliamentary proceedings. Number 2, the simultaneous interpretation must be provided during these proceedings. The idea is to allow all MPs to understand the speeches of their colleagues. Minor technical problems happen often in the House, and usually the proceedings are suspended momentarily so that the interpreters can continue their work. However, it also does occur that the Speaker puts in new procedures in interpretation services to adapt the practices to the new requirements of the House. In a decision, June 20th, 2017, by Speaker Regan, on a point of order that was raised by a member of Winnipeg South concerning the rights of members to express themselves in Indigenous languages in the House, the Speaker said regarding the interpretation services, this essential service was created by an order of the House further to the adoption of unanimous consent on a ministerial motion in that regard in 1958, and still today this is an indispensable tool because it allows members to understand parliamentary deliberations and to participate therein. Today, members must be able to speak freely, and they must also have the right to be understood. Let's be clear, the basic right of members to express themselves is essential. This question concerns the right of members to be understood immediately when they speak in a language other than the official languages. The second aspect of interpretation services is to ensure that members can express themselves freely and be understood. The PROC committee said in its report in June 2018, the use of Indigenous languages in the House of Commons. And in this report, the members expressed the opinion that the ability of all members in this House to do their duties is undermined when they cannot immediately understand one of their colleagues who is expressing himself in a language other than French or English. The committee also emphasized the very fundamental work of the interpreters. Quote, the simultaneous interpreters who work between French and English in the Parliament must receive a master's from a recognized university program. They must be accredited by the Canadian Council of Interpreters and Translators. This is necessary because an error made by an interpreter can bring about unintended and harmful consequences because these people must work in a split second without the ability to revise what they say afterward. The third aspect is to allow interpreters to do their job properly. in the context of the pandemic, the Parliament had to adapt its practices in the form of a hybrid Parliament while still allowing for remote simultaneous interpretation and interpretation in the House, as well as the dissemination of the proceedings in both official languages. Madam Speaker, I would like to point out all the progress that has been made over the past year, and I would also like to point out the fifth report from the PROC Committee in May 2020, which talks about parliamentary functions during the COVID-19 pandemic. And these were the recommendations: to respect the Official Languages Act as part of the COVID-19 pandemic, to foster the maintenance of the simultaneous interpretation in Indigenous languages during the pandemic, to ensure the respect for interpreters, members, and witnesses according to the basic requirements established by the Translation Bureau. For example, the obligation to wear a headset and to use a microphone. Now, most of the burden of simultaneous interpretation has fallen upon the Francophone interpreters. And so we need to make sure that that burden is eased. We need to take measures to protect the health and well-being of parliamentary employees, including the interpreters. Now, since a new issue has come up in the House, the wearing of masks and its impact on interpreters has made it difficult for the interpreters. On Thursday, the member for Kingston and the Islands made unfortunate remarks which challenges the fundamental rights of members in this House to follow the debates. He said, "This is the second time over the past 2 weeks that the Bloc Québécois has said that wearing masks undermines the ability of interpreters to do their job. I don't know if it is up to us to decide what is effective or not. I don't think that anyone in this House is qualified to decide whether the masks are the source of the problem." Madam Speaker, unlike the member for Kingston and the Islands, I believe that you are perfectly well positioned to tell all members what the right balance is to be struck between interpretation services and the wearing of the mask. And I believe that the wearing of the surgical blue masks is a good compromise for those who wish to wear a mask while they are speaking in the House. I would like to thank the member for Orleans, who understood the arguments of the Bloc Québécois in terms of how important interpretation is for these debates of the House, by agreeing to change her mask and to wear the blue surgical masks. Thank you, Madam Speaker.
The honourable member for Kingston and the Islands.
Thank you very much, Madam Speaker. On this point of order, I would just raise two quick points, and then I'd ask that perhaps you would hold off on your ruling until I've had more time to digest what the member from the bloc has said and then respond in due course. But I would just say, for starters, my comment about how much time that how many times the bloc had intervened on this point was with respect to the fact that a couple weeks ago, they had made issue with the fact that the member from Ottawa West Nepean was wearing a mask when she was speaking, and then again the last time from the member from Orleans. On this side of the House, we're very concerned about the fact that there are more variants that are out there with respect to COVID-19, Madam Speaker. The fact that when I'm standing here and speaking, there are staff people. When this member stood up to speak, there is a staff person 2 meters in front of her. And my understanding of the way that the virus is spread, and of course it's just my understanding, is that it's when I'm speaking and I'm projecting, I'm possibly putting other people at risk who are in front of me, namely the folks that are making this operation work for us, the people at the table, the individual that's sitting right in front of this member who was just speaking. Therefore, we've taken the position that until such time that it is deemed safe, it's probably in the best interest of members to be wearing a mask while they're speaking. I respect the fact that other members of the House might feel differently, and that's entirely fair, because none of us are experts, and we do have to get through this in a way that we see best fit. So I would leave it at that for now, Madam Speaker, but I would ask that before making a ruling on this, you would let me consider in more detail the comments made by the bloc so that I can respond perhaps more appropriately. Thank you.
L'honorable député de Saint-Jean.
The honourable member for Saint-Jean. Madam Speaker, just to ensure that the speeches were well understood, The Bloc Québécois has never said that the solution should be to ban masks. The alternative that was suggested, to you, was to wear a blue surgical mask. So I would just like to ensure that that was clearly understood, that the Bloc Québécois has never asked members not to wear masks while they were speaking. Thank you.
Merci. J'apprécie les interventions.
Thank you. I appreciate these interventions. For the member for Kingston and the Islands, I just want to make sure that you know that you're free to report other points, but the response to the question is up to the Speaker of the House. So I must advise you that I appreciate all the interventions that have been made today, that have been submitted to me. We will look at this. Clearly, this is a very important issue, and we will come back as soon as possible with the decision by the Speaker to address this issue.
Ordre du jour.
Ordre du jour, ordre aménagement du gouvernement.
Government orders. Commencement of second debate of C-19, an act to amend the Canada Elections Act, COVID-19 response.
Monsieur Leblanc, appuyé par Madame.
Mr. Leblanc, seconded by Ms. Anand, moves that Bill C-19, an act to amend the Canada Elections Act of COVID-19 response, be now read a second time and referred to the Standing Committee on Procedure and House Affairs. The Honourable President of the Privy Council Office of the Queen for Canada and the Minister of Intergovernmental Affairs. Thank you. Thank you very much, Madam Speaker.
Pleased to begin the debate at second reading of Bill C-19, an act to amend the Canada Elections Act COVID-19 response. Across Canada, the ongoing COVID-19 pandemic has forced us to change the way we live and interact to protect the health and safety of our fellow Canadians. Elections, Madam Speaker, have been no exception. Since the beginning of the pandemic, Canada has experienced 2 federal by-elections, 4 provincial general elections, and 7 local elections. These elections were delivered in a way that aligned with public health guidelines and sought to provide electors, particularly those who are most at risk of infection, with a variety of ways to safely exercise their right to vote. With lessons learned from other jurisdictions and building on the recommendations of Canada's Chief Electoral Officer, we have an opportunity to take action to ensure that should an election be required, a federal election held during the current pandemic can be even more safe and more secure. This is why on December 10th, 2020, the government introduced Bill C-19, which, if passed, would temporarily supplement provisions of the Canada Elections Act in support of a safe, secure, and accessible election during the pandemic, again, should one be required. Le projet de loi.
Bill C-19 would reassure voters, election workers, and all other participants in the election that despite the pandemic, the federal election process would remain safe and accessible. To this end, it would provide voters with unprecedented options for voting during a pandemic. They would be able to vote in person or from the comfort of their own homes. This bill is based on the recommendations of the Chief Electoral Officer, which were made in October 2020, concerning having a vote during a pandemic. And it's also based on the essential work of our colleagues who conducted a study on conditions for voting during a pandemic. Bill C-19 contains 4 elements, which I will explain in further detail. First of all, a polling period of 3 days. A safe polling period for residents of long-term care homes. Also, increased powers for the Chief Electoral Officer to adapt to the pandemic, and the strengthening of other measures to have mail-in voting.
To go to vote in person are as safe as possible. This legislation proposes spreading the polling period, in other words, the voting day, effectively over 3 days. Instead of one 12-hour voting day, Bill C-19 would establish a 3-day polling period with 8 hours of voting on both Saturday and Sunday and the traditional 12 hours of voting on Monday. Extending the voting period over 3 days will prevent overcrowding at polls and support electors and poll workers in maintaining physical distancing protocols. Maintaining the Monday would also ensure access to some individuals that may not be able to vote on a Saturday or Sunday. For instance, it recognizes that electors and candidates alike might have religious obligations that inhibit them from voting or campaigning over a weekend. In addition, maintaining the Monday recognizes that public transit may offer reduced schedules over the weekend, and child care options may also be less over the weekend. With Bill C-19, we are working to reduce barriers for electors with disabilities and electors with young children who may be facing particular challenges during the pandemic. As the Chief Electoral Officer indicated in his recent report, a pandemic election could complicate efforts to find polling places and recruit election workers. In light of this, a 3-day polling period would provide Elections Canada with more opportunities to identify polling places. As the Chief Electoral Officer has stated, Elections Canada may also seek out non-traditional polling places, such as arenas or hotels. In advance of every general election, Elections Canada recruits more than 230,000 Canadians to work at the polls across the country. However, as the Chief Electoral Officer highlighted in his recommendations report, recruiting that many election workers during an ongoing pandemic could possibly provide some challenge. During the 2019 general election, close to half of those workers were 60 years of age or older. Given that this age cohort is at an elevated risk if they contracted COVID-19, they may be less inclined to work the polls during a pandemic election. Importantly, at least one legislative change made through the 2018 Elections Modernization Act may help mitigate potential recruitment issues. As colleagues will remember, specifically, that bill allowed Elections Canada to hire 16 and 17-year-olds as election workers, opening up an entirely new contingent that may be open to working at the polls. And finally, Madam Speaker, a variety of other in-person voting opportunities will be maintained under these proposed changes. This includes 4 days of advanced polling with 12 hours offered on all 4 days as well. To account for the 3-day polling period, advanced polls would then be shifted to the Thursday through Sunday in advance of the first day of the polling period. Madam Speaker, as we all know too well, long-term care facilities have borne the brunt of COVID-19. Many deaths associated with the pandemic have been linked to long-term care facilities, and many facilities, sadly, continue to endure outbreaks. In an effort to curb infections, many facilities limited access to outside visitors. This has been hard on families and friends because they have been unable to visit a loved one in person. Lockdowns at these facilities and differing public health orders in effect across the country make it necessary for us to ensure that these residents can still cast a ballot should an election be held during a pandemic. Accordingly, Bill C-19 takes a number of steps to ensure these electors can safely exercise their right to vote. Firstly, this legislation proposes a 13-day period prior to the beginning of the 3-day polling period that would better facilitate the administration of votes in these facilities. Rather than administer the vote in these facilities exclusively on election day, which is now how residents would have been able to vote in past federal elections, this legislation proposes establishing a lengthier period which the vote could be delivered, for example, by mobile polls. As COVID-19 conditions vary across provinces and territories and from region to region, this period enables Elections Canada to better plan according to the unique context of each long-term care facility. Bill C-19 would also allow returning officers to establish a polling division comprised of a single long-term care facility or of a particular part of a long-term care facility. This amendment recognizes the existence of dedicated quarantine zones in some long-term care facilities and ensures that a positive COVID-19 test will not impede a resident of these facilities from being able to vote. Taken together, these amendments aim to ensure that our senior citizens and those living with disabilities in long-term care facilities, citizens who are amongst the most vulnerable populations in this pandemic, have safe and reliable opportunities to exercise their right to vote. Actuellement, Madame la Présidente.
Currently, Madam Speaker, Section 17 of the Canada Elections Act allows the Chief Electoral Officer to adapt certain provisions of the Act simply to ensure that voters can exercise their right to vote or to ensure that the counting of the vote can happen if there is an emergency situation, if there are exceptional or unforeseen circumstances, or if there has been an error. In past elections, the Chief Electoral Officer has exercised this authority, for example, to allow workers who were temporarily living outside of their voting riding to vote. However, the pandemic has created a huge amount of uncertainty, and so this has created new reasons for which we might need to adapt the provisions of the Act. So, as part of Bill C-19, the Chief Electoral Officer would have the authority to adapt the Act's provisions in order to protect the health and safety of both voters and election workers. This modification is particularly important not only to protect voters, but also to protect the election workers and volunteers who ensure that our democratic process can unfold. As I said earlier, Canadian election workers are often older individuals, and if some older individuals choose to work during a general election, we will need to ensure that they are able to do so without compromising their safety.
Elections in Canada and abroad that have had an election during the pandemic period have witnessed a significant increase in the use of mail-in ballots. For example, in British Columbia's October 2020 election, or during the United States November 2020 presidential election, and obviously, as we've all noticed most recently, in the election in Newfoundland and Labrador. In response, Bill C-19 includes measures designed to improve access to mail-in voting. Mail-in voting, which is safe and secure, has been instrumental in providing opportunities to older electors, electors with disabilities, immunocompromised electors, and to those who are unable to vote in person due to the pandemic. While electors in Canada have long been able to vote by mail, and Elections Canada has significant experience safely administering the federal vote-by-mail system, Bill C-19 proposes specific amendments in anticipation of a sharp increase of mail-in voting. Firstly, Bill C-19 would allow electors to apply to register to vote by mail online, rather than through the mail or in person, as is currently the case. I should note that providing this option would not inhibit those without access to the internet to register to vote by mail or in person. But by allowing online registration, we're simply giving Canadians one more option to register to vote by mail. And finally, in an effort to further simplify the registration process, Bill C-19 would provide electors with the ability to use an identification number, like a driver's license, for example, to establish their identity and residence when registering to vote by mail. Presently, electors are required to provide a copy of their ID when registering to vote by mail, which may inhibit individuals without access to printers or scanners or photocopiers, for example, at home from voting. More precisely, it would allow Elections Canada to use information already in its possession to confirm an elector's identity and residence. In recognition of any potential privacy implications, electors would need to explicitly consent to Elections Canada using this identification number to facilitate their vote by mail registration. Some electors may choose to register to vote by mail, but with circumstances changing regularly across the country, they may not actually be able to return their ballot kit by mail in time. In anticipation of this, Bill C-19 proposes the installation of secure mail reception boxes at every polling station across the country. Bill C-19 would also allow for electors that initially chose to vote by mail to change their mind and vote in person. However, to do so, such an elector would need to either return the mail-in vote kit they receive from Elections Canada when they go to vote in person, or sign a declaration that they have obviously not yet voted. Elections Canada has a robust series of measures to deter electoral fraud. Returning the mail-in vote kit or attesting in writing that they have not yet voted would act as a deterrent to any malicious actor who would support obviously the integrity of the vote. These measures would also help create the appropriate paper trail for auditing and enforcement processes. Madam Speaker, it's important to remember that we are not proposing permanent changes to Canada's electoral law. All of the proposed legislative amendments that we've outlined are temporary. They would only apply to an election that's called 90 days after this legislation receives royal assent, or earlier if the Chief Electoral Officer has indicated that all the necessary preparations have been completed. And moreover, these legislative changes would cease to be in effect 6 months after a general election is administered during the pandemic, or earlier as determined by the Chief Electoral Officer after consultation with Canada's Chief Public Health Officer. Madame la Présidente.
Madam Speaker, with Bill C-19, we are maximizing the number of ways that voters can exercise their right to vote. If the bill passes, voters would have 4 days of advance voting, 3 days of regular voting, and better access to mail-in voting. Bill C-19 would also give Elections Canada greater legislative authority and greater legislative leeway in order to organize elections without compromising safety. To conclude, I'd like to invite all members to study Bill C-19 so that it can be sent to the Standing Committee and amended if necessary, of course. We want to work with all parliamentarians to ensure that all Canadian voters can have a safe and accessible election. Thank you, Madam Speaker.
Questions and comments? The honourable member for Lanark, Frontenac, Kingston.
Thank you, Madam Speaker, and I want to say to the Minister through you how good it is to see him looking as robust as he does. It's a real pleasure to have him back in full fighting form. The Parliament as a whole and the government can certainly use the services of, I believe it's the longest serving parliamentarian in Cabinet. I wanted to ask this question. On the issue of non-traditional voting locations, it is an issue that the best accessibility for accessible voting requirements is frequently long-term care facilities. In some small villages, it's the only accessible location. The Human Rights Commission is required that certain accessibility criteria be met in order to allow voting to take place. Is it the case that it will be possible to have slightly less accessible locations in some cases for voting under this legislation? And would the government contemplate allowing such a thing in order to make sure that, especially in smaller locations, it's possible to vote?
President of the Queen's Privy Council.
Madam Speaker, through you, I want to thank my colleague for his kind words. He and I have served on a number of committees together and have served in Canada's House of Commons, and I very much, at a personal level, appreciate his kind remarks, and I thank him for that. Obviously, Madam Speaker, and our colleague from Lanark, Frontenac, Kingston, has a lot of experience in terms of Canada's Elections Act. He has been a steady and effective voice on these issues for a long time. I served on the Procedure and House Affairs Committee with him in that context. So obviously, Madam Speaker, the government would not seek to reduce accessibility in terms of polling stations, but we would have faith in Elections Canada by increasing their authority and their ability to adapt to an election in a pandemic. We have every confidence that they would find the right way to have people vote, but while obviously not limiting accessibility to Canadians living with disabilities.
Questions and comments? The Honourable Member for Beauport-Limoilou. Thank you, Madam Speaker. My question is as follows. So, mail-in voting, I understand, but where I have a problem is when you say, well, people might change their mind and then decide to vote in person instead. And all they would have to do is sign a declaration to that effect. Now, I want to believe that people are honest, but it's possible here that people would mail in a ballot and then would go to vote in person and just sign a declaration saying, no, I didn't vote twice. I'm just not sure how we're going to avoid that. The Honourable Member, the Honourable Member. Thank you, Madam Speaker. And I want to thank my colleague, the member for Beauport-Limoilou, for the question. This is an example of an adaptation that we want to move forward with. Now, I'm sure we all want to eliminate any possibility of electoral fraud or having people cheat the system. That's certainly not what anyone in the House wants to see. We believe that having them sign a declaration should discourage people from voting twice, because it would be fairly simple for Elections Canada to notice afterwards that the person voted twice. And of course, there would be quasi-criminal consequences for that. Now, if the bill goes to committee and the committee the bloc members on the committee want to amend that aspect, I think we would be willing to work with that. We're willing to work with all colleagues. And I think that I share the same objective as my colleague.
Member for Edmonton Strathcona.
Thank you very much. And Elmwood Transcona, Madam Speaker. I wanted to ask the minister, I thank him very much for his speech and for bringing this legislation forward, as I do think it's an important issue that we need to address. I am wondering about his openness to considering amendments at committee. I think there are some important extant issues, some of which may need to be addressed in legislation, others perhaps not. But I think if the idea here, and I hope it is to collaborate so that all parties in the House can be agreed on the ground rules for a possible pandemic election, then there are some things I wonder if you might consider. Particularly, I think, we've seen a lot of online applications for some things throughout the pandemic. We know it's a barrier to many people who don't have the technology or don't know how to use it. I wonder if he's open to having the in-person registration for special ballots occur at Canada Post outlets and maintaining the Campus Vote program in a pandemic election as well.
The Honourable President of the Queen's Privy Council.
Madam Speaker, I want to thank our colleague from Elmwood Transcona. He, I know, has offered very constructive suggestions in the past with respect to the Elections Act. It's obviously the government's intention to work with all parties and all colleagues in the House to find the appropriate temporary amendments to the Elections Act that would make it more accessible and safer for Canadians should an election be required. So are we open to amendments and working with other parliamentarians? The answer is obviously yes. Voting on campus is certainly a priority for us. We think it's something that's important, and I know my colleague has spoken publicly about that. We would welcome an opportunity to work with him to ensure that that's reflected in the legislation. And I very much like his suggestion of allowing people to register at post offices to be able to vote in person. It's something that would make it more accessible in small communities like mine. In my riding, the post office is a site where people could safely do this, and I would welcome that kind of suggestion.
And comments, the honourable member for Guelph.
Thank you, Madam Speaker, and thank you to the President of the Queen's Privy Council for Canada for his not only intervention today, but bringing forward this legislation. In Guelph, as he'll remember, we had robocalls a few elections back where Conservatives were calling people in my community saying that election locations had changed and also went on campus to try and take one of the polling boxes from our campus. So looking at consistency of having elections locations on the pre-elections or the pre-votes and the day of the vote, having consistent polling locations would be important. And also the changes we made in C-76 to modernize the Canadian Election Act to have the Elections Canada Commissioner be able to communicate to Canadians what the best way to vote is in their community and locations of polling stations, and that they have now got some means to promote the vote within our communities. Could the President comment on, first of all, how we can maintain consistency of polling locations, if that's possible, and also how Elections Canada can communicate those to our communities?
The Honourable President of the Queen's Privy Council.
Thank you, Madam Speaker, and thank you to our colleague from Guelph for his intervention. I do remember Frank Valeriot was then a member of Parliament from Guelph. I remember some of the controversy surrounding robocalls and some attempts to suppress the vote in that election. And Madam Speaker, obviously, I share our colleague's view that the consistency of polling locations is something that increases the reliability and accessibility for voters. But any enhancements that would allow Elections Canada to properly communicate polling locations to voters would obviously be something that we would support. And this is precisely, Madam Speaker, why we think it would be helpful if this legislation could be sent to the Procedures Committee, where colleagues could offer constructive amendments, suggestions that would improve the bill, but also hear from electors and from Canadians their experience and ensure that the legislation, in fact, reflects the security and safety of elections, but ensures they're accessible in the context of a pandemic, should one be required.
Brief question, the honourable member for Saanich Gulf Islands.
Thank you, Madam Speaker, and to my friend and colleague, the Honourable President of the Queen's Privy Council and for Canada, I want to join other friends in saying how very pleased and grateful we all are to see him back among us so well. I'm pleased to see Bill C-19, but disappointed, and he will know I'm disappointed that there's nothing in this bill that addresses an issue that is of concern to many of us who have endured in politics, lies and being spread, approved by the official agent for other parties, things that are completely untrue, that would not pass in the marketplace for consumer products, for instance. So he will remember that I've pressed for the notion, the Green Party has pressed for the notion of truth in advertising legislation, such that there's always going to be opinion that's unpleasant. There's going to be attack ads that can be unpleasant. Those are freedom of speech issues. But
I did ask for a brief question. There's only 20 seconds left for the minister to respond. So the Honourable President of the Queen's Privy Council. A brief answer, please.
Madam Speaker, thank you. And I want to thank my colleague from Saanich Gulf Islands, as always, for her kindness and her generosity towards me personally. I share her concern. We've discussed this in the past around the increase of disinformation, of attempts to hack elections, election processes. And again, the Prime Minister has asked me to work with other colleagues in Parliament around the issue of disinformation in the electoral context to ensure, as she said, obviously freedom of speech is an important value in an election context, but there is a point where disinformation and malicious actors can attempt to influence the outcome, and I would welcome an opportunity to work with her and other colleagues on the appropriate way to address those issues as well. Thank you, Madam Speaker.
Just before I go to questions and comments, I do want to let members know that there is a lot of interest for participation during questions and comments. So I would ask individuals to make sure that they go directly to their question and comments as quickly as possible within the minute mark, because I will have to unfortunately cut off to allow everybody to, as many people as that want to participate. And when we mention that a quick answer, if you can get to the question, a quick question, if you can get to that question quick enough, because unfortunately I would have to cut you off as well. So resuming debate, the honourable member for Mission Matski Fraser Canyon.
Thank you, Madam Speaker. I want to begin my comments on this important piece of legislation by sharing some anecdotes from recent federal elections. The names of two people I'm about to talk to about are not their real names, but they are familiar to anyone involved in past elections. My mind goes first to Sue. She is the loving grandmother who spent her years tending to her family and household, volunteering for charitable causes in her community, and enrolling as a poll worker when general elections were called. Her knowledge of the community and its members is derived from decades of friendship and service. Her institutional knowledge of the electoral process is the kind that is acquired from working multiple elections at all levels over a lifetime. She is the kind of person that poll workers, scrutineers, and volunteers flock to with their questions in search of answers and insights. Without people like Sue, elections in Canada would be a shamble. Her dedication is a credit to our country and is essential to the functioning of our democracy. Also coming to mind is someone like Gurpreet. He's a new Canadian, having arrived in his new homeland from abroad about a decade ago. As a poll clerk in his first Canadian election of any kind, he is proud of his role in promoting democracy, for standing up for democracy, and ensuring a fair and transparent process of ballot counting and voting. This is an exciting new experience for Gurpreet, giving him an inside view of how the Canadian election system works. He has the added benefit of serving as a poll clerk alongside Sue, the seasoned DRO and loving grandmother whose intimate knowledge of Canadian elections puts him at ease and allows him to participate and work in the electoral process with comfort, confidence, and pride. Colleagues, these anecdotes are not exceptional. This type of interconnectedness, community members coming together, coming from disparate backgrounds and various life experiences like students, seniors, new Canadians, and stay-at-home moms, to serve the rest of us by upholding the integrity in our democratic process is what happens in every federal election in polling places nationwide. This coming together of the community is important for fostering trust in Canadian elections. The adage that all politics are local is especially salient here. People are more likely to trust their neighbors and friends. That trust is especially important when it comes to counting our ballots and having faith in the outcome of that count. But let me be clear, Madam Speaker. Canadians do not want an election during the COVID-19 pandemic. Despite the actions taken by opportunistic incumbent provincial governments over the last year, 80% of those surveys are against forcing Canadians to polling stations at this time. And yet, here we have Government Bill C-19, an act to amend the Canadian Elections Act COVID-19 response. A bill introduced in December 2020 before the Standing Committee on Procedure and House Affairs, I might add, had even issued their recommendation after studying the matter in depth. Putting aside the misplaced hubris of the Liberal knows best approach, there are changes in this proposed legislation which do meet the threshold of common sense, but sadly this does not extend to all of them, and there are a number of issues with C-19 which have been overlooked. If an election is held in a pandemic, the protection of poll workers, voters, and our tried and true Canadian democratic process is essential. Point 1. From the outset, I'm especially concerned about the provision or lack thereof for voting in long-term care facilities and other institutions home to immune-compromised Canadians, where we've seen the worst COVID-19 outbreaks in this country. We do not need the grave mistakes of this past year repeated by increasing the time our vulnerable citizens are exposed to the avoidable risk of external transmission. Everyone must be given the opportunity to vote, and clarifications are needed to ensure those in long-term care facilities have the ability to vote safely. In these instances, polling stations should be open for the minimum amount of time it takes for residents to vote, although at multiple periods of time during the 13-day provision mentioned by the President of the Privy Council. Point 2. There is glaring issues in the absence of a built-in sunset clause to remove what must remain temporary changes. What we have instead is the following, and I quote, "The enactment also provides for the repeal of the new part 6 months after the publication of a notice confirming the temporary rules in that part are no longer required to ensure the safe administration of an election in the context of the COVID-19 pandemic." Well, Madam Speaker, we've been told to self-isolate for weeks upon weeks by this government and other governments in this country. We're not falling for that again. The addition of a sunset clause containing a fixed date that these provisions cease to be enforced is required. Thirdly, we need clarity when it comes to proposed powers for the CEO to withdraw the writs of election. It must be made clear to us now, while we debate this bill, how any decision to withdraw the writs would be made. Ending an election midway through is a decision with major ramifications that cannot be made arbitrarily. Common sense can foresee that any decision to end the election before voters have had their say would sow chaos, confusion, and distrust that would last for generations. With great power comes a great responsibility to explain its use. If we cannot explain to Canadians why the CEO would pull the plug on an election, perhaps we should do likewise to pull the plug on this clause in the bill. Another significant area of concern are the mail-in ballot provisions proposed by the legislation. Bill C-19, as it is presently written, states that an elector who requests a special ballot, and I quote, shall ensure that the special ballot is sent before the close of polling stations on the last day of the polling period and is received by the special voting rules administrator in the National Capital Region no later than 6 p.m. on the Tuesday following the last day of the polling period. This would mean that Elections Canada would count a hypothetical vote received as much as 23 hours after the general election polls had closed. Now, I have heard of ballots being dispersed and cast prior to a general election having been called. This scenario was central to the case of Mitchell versus Jackman, which made its way to the Supreme Court of Newfoundland and Labrador. The main argument in that case was whether it was constitutional for special ballots to be issued to voters in Newfoundland and Labrador prior to a provincial election. It was decided in 2017 that such a rule was an infringement of voters' charter rights under Section 3, the Democratic Rights Clause. On the other hand, I am at a loss when it comes to finding an example of an election in Canada where ballots were accepted after the close of general election polls. Notwithstanding the present electoral calamity that has befallen Newfoundlanders and Labradorians, who are mired in an election that should have wrapped up almost a month ago. Counting ballots after polls have closed is one thing, and it's very normal. It happens in every election. Accepting ballots after the general election polls have closed is another. It's abnormal because it does not happen. If this bill passes in its present form, who knows how long the tallying process will take for millions of mail-in ballots received by Ottawa and under the current bill, counted in Ottawa. Valid ballots accepted for the count should be received prior to the close of voting. That's why we have an election day. Even in British Columbia, whose recent provincial election garnered notoriety for the 13-day lag time between the close of the polls and the counting of the mail-in ballots, it was only those votes received by the close of the polls which were counted. I agree with the provision for the Chief Electoral Officer to increase the number of elections officers. Arguably, this is something that should have been done in previous elections. It is going to take a coordinated, collaborative civic effort to ensure the proper execution of an election during a pandemic. This is especially true when it comes to special ballots. Once the writs are issued, there should be a large and well-advertised window of opportunities for voters to request a special ballot online within the context of this new extended writ period. To streamline the process from the beginning, when applying for special ballots electronically, voters should be required to provide evidence that they are Canadian citizens over the age of 18, and it must be verified that this person is indeed living. There are those on the other side of this place who vilify my party for expecting voters to provide identification, which I do not understand. We must strive to provide as many options for voting as possible. We cannot infringe on the sacred right of citizens to vote. But quite simply, voters do have to be verified citizens. Elections Canada's current ID verification options are many, so I'll belabor that point no more. So it is a safe assumption that demand for mail-in ballots will be high in the next federal election, likely the highest ever seen. And there is a clear precedent in Canada for giving people a window of opportunity contained within the writ period to vote by special ballot. We all want the next federal election to be conducted with the utmost integrity, as for every election, but allowing the receipt and counting of ballots after Election Day opens our process up to the speculation of electoral fraud and uncertainty. Special ballots should be postmarked 1 week before the election period commences in order to be counted on Election Day. Otherwise, if mail-in is not an option because of time, special ballots should be accepted at returning offices and polling places in a designated drop box up to the close of polls on Election Day, as previously discussed. Moreover, people trust their friends and neighbors. The folks like Sue and Gurpreet that I mentioned earlier, sending special ballots to riding offices to be counted by local officials will enhance Canadians' trust in election outcomes, especially when we are anticipating that the next federal election will see an astronomical number of votes by mail. We cannot have an extended period of uncertainty between the close of polls and the ballot count. During a pandemic and in a minority parliament situation especially, now is not the time to fundamentally change the way we do elections in Canada. During these unsure times, our institutions must perform at the highest standards. Again, as we saw in British Columbia's election, mail-in ballots will compromise a significant portion of the total vote count. Of 30% of all votes cast in BC were by special mail-in ballots. Virtually all votes cast in Newfoundland and Labrador provincial election currently underway will be by special mail-in ballot. On the federal scale, this could mean 10 million ballots in the mail and possibly more. Banking on sending millions of special ballots directly to Ottawa for processing is a recipe for disaster and delay. Mail-in ballots, although they may be sent from anywhere, should be received and counted in the ridings in which they are meant to be cast. If Elections Canada feels they need more personnel on the ground in constituencies, then have them send more staff as needed, or better yet, train up the local staff to perform these tasks as they have always done. You know, Madam Speaker, it's an honor and a privilege to stand in this House. Having run in 2 federal elections, I fully grasp the importance of local returning officers as administrators and arbiters. In my riding, our returning officer has the ability to bring candidates from across the political spectrum together so that everyone is on the same page when it comes to the rules of the electoral game. I think for myself and all of the candidates in the last election, we felt more assured when she brought all the candidates together to sit at a table, hash it out, so we were all on the same page. that needs to happen, and that's a good thing. I have the utmost confidence in my local returning officer, and I would place a friendly bet that most of my colleagues here feel the same way in their ridings. I trust my local returning officer to oversee the election in my riding. I have faith that they can also oversee the counting of special ballots cast by the voters I represent. If more special ballots are anticipated than voters on advanced or regular polling days, why not have Elections Canada and its returning officer redeploy that staff to handle the special ballot count in each riding? Local elections must remain local. We don't elect Ottawa representatives for our communities. We elect community representatives to fight for our interests in Ottawa. The importance of Elections Canada workers and scrutineers from the community cannot be overstated. This ensures trust in the local electoral process, and their involvement in it nurtures the Canadian values of inclusion and diversity. I believe local elections and the participations of Canadians within their own communities builds confidence in our institution. Scrutineers have been a fixture of Canadian elections since our earliest days. They cast a watchful eye on the proceedings of Election Day, the counting of the votes, and on the behavior of other scrutineers. They report this information back to the candidates they represent. Outsourcing the counting of special ballots to Ottawa is wrong and sets a dangerous precedent. For starters, local scrutineers, my opponent's scrutineers, will not be able to observe the counting of special ballots that will impact the outcome of the election in any given riding. While national leaders secure much of the spotlight, we must remember that in our Westminster parliamentary tradition, we do not elect a prime minister and a deputy prime minister as is done in republics with the president and vice president. We elect members of parliament from unique constituencies across the nation. Every member of this House is accountable to their electorate. We have 338 elections. This raises the question of how transparent and accountable the vote counting will be in my riding when we are anticipating that a significant chunk of the votes in Mission Matsqui Fraser Canyon will be cast by mail and will be counted by unfamiliar strangers situated several thousand kilometers away in the National Capital Region. Madam Speaker, as my speech comes to a close, I will readily acknowledge that the changes to the Elections Canada Act, as proposed by the government, are not meant to be malicious and were made with good intentions. But we all know where that road leads. The implications of the changes in Bill C-19 are great and wide-reaching. These changes, if adopted, will change the way Canadian voters conduct elections. If this Liberal government proceeds to make these changes unilaterally, then they would be undermining Canadian democracy, and I'm assured to hear from the previous speaker that that will not be the case. And I don't say these words hyperbolically or inflammatorily. Amending the rules that govern elections in Canada require buy-in from all parties in this House. We on this side are open to Elections Act amendments to account for the realities of the COVID-19 pandemic. Our system works, but it requires updating from time to time. This is one of those times. I hope this government realizes that and engages all members in a better and more constructive way to get this right. After all, it is from the voters, as represented by all members in this House, that this government, any government, derives its consent to govern. All we have to do is look to our neighbors to realize that Canada's electoral system works best for Canadians. Our system is trusted. It's a system in which folks, like I mentioned in the beginning, folks like Sue and Gurpreet contribute to the integrity of the electoral process and the final results. People trust their friends and neighbors. This is why we need mail-in ballot counting to be done at the local level, in the ridings, at the returning offices, in the communities where electors...
I'm sorry to interrupt. There seems to be an issue with interpretation. C'est-tu bien ça, un point d'ordre, l'honorable?
Point of order, Beauport Limoilou. We lost interpretation for a brief moment. Is it working now?
Est-ce que ça fonctionne maintenant? Testing? Ça fonctionne? Okay.
It's working? Okay. The honourable member has 1 minute.
Well, thank you, Madam Speaker. Let me just conclude by saying that if all politics are local, then so too should be the counting of ballots, including those received in the mail. I look forward to a constructive debate on C-19 and to getting this bill right for Canadians, because it's Canadians that ultimately make the decisions we're discussing today, and Canadians should feel they have the utmost confidence in our system. Thank you, Madam Speaker.
Comments? The Honourable Parliamentary Secretary, the Government House Leader.
Yes, thank you, Madam Speaker. And I think it's important for us to recognize that Elections Canada is in fact recognized around the world, not to mention from within Canada, as an institution that is second to no other when it comes to ensuring that people have the democratic rights and they're enabled to be able to vote. I think it's worth saying. A couple of very quick points. First, ballots will be counted in the riding if sent from the riding. And I think that's a very important point to note. Also, I would remind my friend that there is a sunset clause to the changes that we're actually putting in place, keeping in mind the reason why we're bringing in the legislation. The member makes reference to the withdrawal of writs, and this is where my question will be, Madam Speaker. He has a great deal of concern in regards to the withdrawal of a writ and how Elections Canada can do it. Elections Canada will, in fact, be appearing before the PROC committee once this bill goes to committee. That answer and many others could be accommodated. My question to the member is, when would he like to see this legislation go to the committee so that we can have Elections Canada and others answer the many questions he has?
Members to keep their questions to the 1 minute mark. The Honourable Member for Mission Metzke Fraser Canyon.
Well, I'd like to thank my the Honourable Member from Winnipeg for his question. First off, I don't make the decision or get to determine when a piece of a bill gets to be brought forward to a committee. I think he has more power over that decision than I would any day. Secondly, I think it's incumbent for me to mention again, upon my first reading of this bill and first speech, that the C-19 gives extensive temporary powers to our chief electoral officer. I think that we need to have very clear and transparent schedules available to everyone in this country to know why a decision would be made and under what context such a decision would be made. Thank you, Madam Speaker.
Questions et commentaires, l'honorable député de...
Questions and comments, the Honourable Member for Bobali-Moilou. Thank you, Madam Speaker. During the pandemic, we heard some horror stories with CERB and electronic fraud, people who stole other people's identities. I am worried that this type of situation could occur again with electronic voting. I would like to know what my colleague thinks of that. And does he have any ideas to avoid the horror of fraud with CERB?
Member for Mission Metzke Fraser Canyon.
Thank you, Madam Speaker. I'd like to thank my colleague from the Bloc Québécois for that excellent question. One of my questions actually that I was trying to have addressed earlier in this debate was how often voters' lists will be updated at the various polling stations across any riding. There's a lot of provisions in this bill that need a ton of clarification to ensure that there is no fraud, to ensure that people are not trying to vote twice. Elections Canada has a responsibility to always prepare for the worst case scenario. So what we're seeing in C-19 right now is that there are certain provisions in this bill that need a lot of clarification to provide us assurances that the system will in fact be robust in preventing double voting and electoral fraud. Thank you, Madam Speaker.
Comments? The Honourable Member for Elmwood Transcona.
Thank you, Madam Speaker. I took from the member's speech that a major preoccupation of his is, where special ballots are counted. And as a member of the Procedure and House Affairs committee, I think I can offer up, given the study that we've just undertaken for some time now. We've heard from Elections Canada and Canada Post both that the intention is to have special ballots counted locally within the riding. And so I think that is already foreseen. I take it from his comments he hasn't had a chance to consult members of his party who sit on the committee, but we've heard some pretty clear testimony to that effect. So I offer that by way of reassurance. And I just wanted to ask the member, I know he had also talked a lot about the receipt date of special ballots and this issue of people being able to vote in person even if they've applied for a ballot. But we know that there may be delays in people getting their special ballot. It seems to me that it's important to try and offer for people who have applied in good faith for a special ballot, but through no fault of their own don't receive one in time to be able to submit it in a timely way, that they have the option to vote in person. And I wonder what he thinks of that principle.
Member for Mission Matsky Fraser Canyon.
I'd like to thank the member from Elmwood-Transcona for the excellent question. And I don't think our positions differ too much on this. If people apply for a special ballot online and they receive that ballot, the C-19 allows for people to drop off that ballot in a special ballot box at a polling station. I think that's a good provision. My first reading is C-19 when I worked on this speech. It seemed to me that all of the ballots, special ballots, would be counted in Ottawa, and I know there is a precedent for that, but I want to make sure through this debate, and I'm glad he provided me some reassurances from the committee report that that local elections do in fact remain local, because Canadians like having scrutineers in their local elections. They like knowing that their neighbor is in the polling station overseeing the counting of ballots. That's what makes our system strong, and that's what we need to uphold during COVID-19.
Questions and comments? The honourable member for Cloverdale, Langley City.
Yes, I wonder if my colleague could talk to the risks that we would be taking having an election during the pandemic. I know here in BC, we saw a huge spike in cases following the election, and I'm wondering if he would be able to speak to those kinds of risks that we're putting Canadians at by holding an election during a pandemic.
For Mission Matsky Fraser Canyon.
I'd like to thank my honourable colleague for her question. My biggest fear about an election during the pandemic is in long-term care facilities, or someone like my 93-year-old Oma, who lives on her own and has received lots of support from nurses and care practitioners. We need to make sure that any changes to the Elections Act, whether temporary, account for the outbreaks we've seen in long-term care facilities in my riding and ridings across this country. So I am very concerned about an election during a pandemic and seeing a spike in the number of cases. I don't know if it's been verified or not, but in BC, 2 weeks after the provincial election, we had a big spike in the number of COVID cases in our province. Thank you, Madam.
Questions and comments? The honourable member for Kingston and the Islands.
Thank you, Madam Speaker. I guess we shouldn't be surprised that the Conservatives are trying to sow the seeds of doubt when it comes to mail-in ballots. The reality is that they did it in committee throughout the entire summer. I was on the committee. I listened to it. The word fraud and mail-in ballots came up repeatedly from the Conservatives, also a couple times from the Bloc Québécois, so I'm not surprised equally to see them doing the same thing. But I can assure this member, we heard from the Chief Electoral Officer from BC, from a couple different provinces on the East Coast. We heard from experts, and I asked the question repeatedly, have you ever had any concern for voter fraud with respect to mail-in ballots? And the answer was unanimously no. Not a single individual person indicated that there was a concern with fraud as it relates to mail-in ballots.
Brief answer from the member for Mission Matsky Fraser Canyon.
Oh, thank you, Madam Speaker. And I'm not sowing any doubt or deceit in our electoral process. My whole speech focused on the fact that I trust the institution, that I trust Sue and Gurpreet and all of the other Canadians who work in our local elections to make sure that our democracy is upheld. I think our Elections Act is one of the best acts we have. It provides confidence for Canadians, and for new Canadians, it's one of the first times that they really feel that they're a part of this country, that they're a part of something greater than themselves, that the words strong and free come true when they hear and when they see the people come and vote. We are so proud of the Elections Canada Act, and we are so proud to get it right during this debate. We love our country, and we want to give Canadians the best opportunity to vote safely. Thank you, Madam Speaker.
Okay, we have time for a very brief question. The honourable member from Nanaimo, Ladysmith.
Well, thank you, Madam Speaker. I support this bill, but one of the things that I find that's missing from it is what we've been asking for a long time, and that's electoral reform. And, the Green Party got almost 1.2 million votes in the last election, just short of what the Bloc Québécois got, who got 10 times more MPs than us. We had... the Conservatives got 5 times as many votes as us, but 40 times as many seats. And I'm wondering if the honourable member thinks that this is a fair representation of Canada we're asking for.
A brief answer from the member for Mission Maskey Fraser Canyon.
Yeah, I'm not going to lie. I'm a fan of first past the post. It has its problems, but I love my country. I love our democratic system. I love the way we conduct elections. I love the fact that Canadians have confidence in our electoral process, and I don't want to see that changed. I want to see ballots counted locally by local members of my community to ensure that Canadians continue to have the confidence in our electoral system, which makes our country so great. Thank you, Madam Speaker.
Reprise de débat.
Resuming debate. The honourable member from Montcalm.
Merci, Madame la Présidente.
Thank you, Madam Speaker. Before proceeding with my critique of C-19, on March 8th, I wish to extend greetings to all of my colleagues from all parties to thank them for their commitment to move forward with equality and fairness. That being said, the Bloc is in favor of the principle of this bill. We can't be against apple pie. We can't be against the idea that if we have to have an election during a pandemic, we need to adjust legislation in order to respect public health guidelines in Quebec and the other provinces. The measures in the bill will change for us the votes held in long-term care facilities and the deadline to receive mail-in ballots and the D-Day provisions, so to speak, which are extended over 3 days. For those who are listening to us, I want to go into detail about what this bill does. It only has to do with exercising the right to vote and counting votes. The bill could have gone much further if there had been a desire to do so and adjust the Electoral Act or the Elections Act during a pandemic. It would have been possible to look into funding of political parties. Let us recall that the government has failed in its attempt to reform the way that we vote. During hearings, Jean-Pierre Kingsley came to see us at committee, and he said that it was essential to reestablish the funding by vote received in order to ensure fairness. That needed to be reestablished. If we're not looking at the way that we vote, we should not lose the opportunity entirely. In our electoral system, it happens that citizens who vote for a more marginalized party that may not have a chance to elect an MP could at least be able to contribute through their vote, would not completely lose their vote, and through voting would be able to contribute to an amount of money that is offered to the party that receives that vote. Elections, in their essence, are a debate. They are a debate of ideas, a democratic debate. However, It is essential to make sure that during the election period, from the very start, there need to be measures to ensure fairness, to assure the exchange of ideas and the ability of every party to put forward their ideas. During a pandemic, we would have expected that funding and fundraising is more difficult to do. There's less contact. And what we've seen is that political parties went to go and stick their hands into the cookie jar that was set aside for companies. I'm talking about the wage subsidy here. At the time that I'm addressing you, there are sugar shacks in Quebec that aren't even entitled to this fund. They're struggling. And listen, this is very strange when we want to change things, but we only want to change them just a little, and yet at the same time, there's unfair practices that are occurring. Political parties that promised to pay back at this time. So let's change the Electoral Act during a pandemic. And it would have been a good time to reestablish the funding of funding received per vote received would have been a good opportunity.
On est donc en faveur.
That said, we're in favor of this bill in principle, which does allow for some modifications. So a 3-day polling period, or 8 hours of voting on Saturday and Sunday, and 12 hours on Monday. And I mention this because if this did pass, that would mean we would have to provide a lot of information to voters because this is a big change in the way of doing things. Then, a 13-day period before the beginning of voting would be allowed to facilitate the administration of the vote in long-term care homes or seniors' homes or other residences for persons with disabilities. So 13 plus 3, that's a total of 16 days. Increased power to the Chief Electoral Officer to allow him to adapt measures in order to ensure the health and safety of voters and election staff for reasons related to the pandemic. Implementing a number of measures aiming to facilitate mail-in voting, including setting up secure reception boxes in every polling office and asking for potentially online systems as well. So essentially that's what's proposed here. Now, the government seems in such a rush to have an election that it's tabling this bill even before the committee, which was working on these changes, was able to table its recommendations. Now, I would remind people here that the Bloc had provided a dissenting opinion, a complementary opinion, and I want to draw my colleagues' attention to it for the benefit of anyone who hasn't read this complementary report. Now, by talking a little bit to various people, we noticed that if the bill were left as is, it might potentially create some problems on the ground when it comes to carrying out the vote. So, when changes are made to the Elections Act, the Elections Act is like the tool that is used to administer this social contract that is an election. And so we need to maintain a balance between the fundamental right to voting and the integrity of the vote. And that's a very delicate balance between integrity and the right to vote. Now, the right to vote is also linked to a duty. But the vote itself is really a solemn moment. And it needs to be completely free of any constraint or influence. That's why we have a designated voting day, a single day where we oversee this process of voting. For the last few years, this has been extended to almost the entire polling period. And what's clear in this bill is that there will be 4 days of advanced voting, 3 days of regular voting, what would normally be election day, 13 days during which some people would be able to vote in seniors' homes. And then, now if you're looking at a 36-day calendar, starting on the 34th day, there's also the opportunity of voting every day. So there are quite a lot of opportunities to vote here. But we wouldn't want all of those opportunities to lead to any voting irregularities. Now, I'm not talking about irregularities caused by a deliberate intention to commit election fraud, but there can be irregularities that happen anyway. Now, currently, we have mail-in voting for people who may live outside of Canada. And those people have a specific time when they are allowed to send in a ballot. Currently, I believe it's up until 18 hours before the start of voting day. So this bill would allow for mail-in voting right up until the day after the voting day. And that, in my opinion, could create a certain number of problems. So I think we need to look at this and make sure we're doing it properly. Now, specifically, during a pandemic, we need to ask ourselves, why have 3 days of voting when you can essentially vote throughout the campaign, when you have 4 advanced voting days, weekdays and weekends? Why Monday? When during a pandemic, we need rooms and a whole logistical approach that would require social distancing. Because a lot of people are going to leave their houses to go vote. And so the solution of having Saturday and Sunday as voting days, which was a provision that was very much called for by the Chief Electoral Officer, who, I should say, has the necessary expertise and understands the logistical challenges of getting election workers, for example, but also of finding places that are safe and conducive to voting. Now, just talking about the situation that I'm familiar with in Quebec, having a vote on Saturday and Sunday and Monday, well, what that means is that on Monday, some of the voting locations will have to change. Because what you need is like school gyms primarily. What we want to be able to do is be able to use school gymnasiums every day. But the school boards in Quebec don't rent out their facilities on Mondays, on weekdays. So we would end up in a situation where we might not have enough voting locations to have a safe vote on the Monday as well. Now, C-19 is first and foremost about the idea of being able to have a vote safely. But we're going to have to really specify what we're going to do with those 13 days before the 3-day polling period. We need to ensure that our seniors have enough time to go cast their vote. But if you look at 2019, for example, in certain long-term care homes and other seniors' residences, now I don't mean specifically long-term care homes, but any seniors' homes, there was a single voting day, and all of the people living in the seniors' residences had plenty of time to go vote. So adding 2 more days of voting, well, it's not necessarily a problem, but how can you ensure that that will happen safely when you're having 13 days plus 3? Why would you prioritize the presence of non-residents over the presence of residents in the long-term, in the seniors' residence? And a lot of people I've talked to aren't very keen on this idea. I think that the returning officer could have a lot of logistical problems in actually implementing this. Of course, he's the one who would have the decision-making power there. Now, the other problem is how many mail-in ballots would there actually be? Now, a person might request a mail-in ballot because they want to vote, even though they're perfectly capable of voting ordinarily. Now, if people just don't feel like leaving their homes and they want to vote by mail-in ballot, I imagine they'll be able to do that. That's not a huge problem. I imagine that vote would be counted, that there would be a list that would be kept updated, and that the person voting wouldn't be able to go vote in an advanced poll as well, for example. So there are people who will want to vote during the polling period, and also people who are outside of Canada. But how is this all going to be counted? It seems to me that the counting should be done within the ridings. But how can we ensure that someone who asked for a mail-in ballot, but then who, for one reason or another, forgot about it, well, that person would be taken off the list. And once you're off the list, you can't then go in person to an advanced polling station or to a regular polling station during the 3-day polling period. Let's say, for one reason or another, the person shows up and says, listen, I got a mail-in ballot, but I didn't use it. Will that person be prevented from voting? And if they sign a declaration and they vote, but then the person actually did already vote, well, that's a problem. And you can't then subtract a vote. So with the mail-in ballots, at the very least, we need to ensure that it is a secret ballot. So now, I think we're going to have a discussion here, and I hope we do reach a consensus. But allowing mail-in ballots to be accepted up until the Tuesday seems to me like it's not necessary. I think that a better way of preventing this problem I've talked about would be, if people have already voted earlier, someone should have up until the Friday prior to the vote to send in the mail-in ballot. Then it would be easy to say, well, we received your vote. Don't worry, it's been received. So now you're not allowed to vote in person. And the different parties could then do the necessary checks to make sure that that's the case. So you wouldn't be able to vote and then also have a mail-in ballot that's accepted on the Tuesday. And even if the person is sanctioned, well, what happens to their vote? Their vote is in that electoral machine somewhere. So Why open the door to this type of irregularity, even if it's just a small irregularity? One fraudulent vote is one fraudulent vote too many, when we could prevent the issue from happening. So I would say let's be prudent here. Let's send this to committee. Let's look at things carefully. And let's really respect the advice of the Chief Electoral Officer, because they're going to be election workers involved. Now, currently, election workers are often people who are 60 years old and older. And during a pandemic, they might resist a bit. You know, we can certainly hope that vaccinations will be more widespread by then, but we don't know when the next election will be. So we can't plan based on the assumption that everyone will be vaccinated. We need to proceed otherwise, and we need to ensure that election workers will be safe and that their work is done optimally. Now, having the vote on Saturday and Sunday, that's what the CEO had recommended, because then you would have election workers on the Monday. So these are technical and logistical considerations, Madam Speaker, but I do believe that they need to be considered because we want this to work properly. Thank you.
Comments? The honourable member for Kingston and the Islands.
Thank you very much, Madam Speaker. And, you know, the member raised a number of interesting points. For starters, I don't think that there's a rush on this particular piece of legislation. We've been in a minority government for a year now, where an election can theoretically be called at just about any time, and we need to prepare. We need to be ready. Hopefully we won't have to use this tool that's been developed, but I think Canadians would expect us to be ready for that. But just, you know, to his issue about the Saturday, Sunday versus Monday, well, I can tell him that having been on the committee, we heard from a number of witnesses. There was concern for people who would have to get childcare on weekends in order to go out and vote. There were concerns from the disability community saying that they had better options for getting around and accessing the polls on Monday. There was also concerns, you know, in relation to a whole host of reasons, and that's why I think the minister has proposed it over 3 days, including the Monday.
Honorable député de Montcalm.
The honourable member. The honourable member for Montcalm? Yes. Well, I'm not sure if there was a question in there, but I do believe it's very clear that anyone who might find it difficult to get out and vote would have the opportunity to vote in the advanced polls. There are 4 days of advanced polling provided, which would cover weekdays as well. Then they would have the option of voting any day. So I think that the provisions are already there. And I think that we should really give returning officers every opportunity to have voting locations that are conducive to proper voting and that voting that could be done safely.
For Sherwood Park, Port Saskatchewan.
Well, thank you, Madam Speaker. I thank my colleague for his speech. I wonder if he can just reflect on the risks of calling an election when the circumstances of the pandemic could change quite dramatically in the middle. We saw a situation in Newfoundland where there was some shifting in the middle of it. Of course, we're dealing with the possibility of new variants and the public health orders that may be required under certain kinds of circumstances in terms of number of cases and so forth may need to tighten under other circumstances. To me, this really speaks to how irresponsible the government is in their push, it seems, to have a spring election. I wonder if you could comment on that as well. Thank you.
The honourable member from Montcalm. It's clear that if you talk to people on Zoom or whatever, you know, no one wants an election. Citizens in my riding don't want an election. That's not where their head is. But at the same time, the government needs to decide if it's going to have an election or not. It's up to the government. What I find a little peculiar is that I don't know why they didn't also look at allowing candidates to get the necessary signatures electronically. You know, as my colleague said, if we go into an election before we have the necessary herd immunity and before we have a vaccination rate that's high enough, it's clear that we will also need to make some further changes to the bill. Questions and comments. The Honourable Member for Trois-Rivières.
The Honourable Member for Trois-Rivières. Thank you very much, Madam Speaker. Apart from the safety issues that could be generated by an election, what I'm concerned about is the fact that these legislative measures would be temporary and only apply to an election that would begin within 90 days after royal assent. Frequently, governments have launched so-called temporary measures that may ultimately become permanent. Could this be a loophole for trying to make this permanent? The Honourable Member for Montcalm. Well, of course, we can't know what's truly in the government's heart, but I think it's important to consider what we should do during the pandemic and then clarify the intentions by working to improve the bill clause by clause at committee, during our work at committee. Now, if in the bill it says that these measures are temporary, well, they will disappear from the current Elections Act. That will happen. It would take further legislation to make this permanent. The measures that we see in C19, if these measures were to remain permanent.
Merci, Madame la Présidente, et merci aux députés pour...
Thank you, Madam Speaker. I'd like to thank my colleague for his speech. A situation can arise where an individual requests a mail-in vote, but they don't get their ballot in time in order to be able to vote. So I think it's important to ensure that if someone doesn't get their ballot, that they still be allowed to vote in person. And I know that there are concerns regarding some of these measures in the current bill. I would like to ask my colleague what he thinks about the situation where a citizen doesn't get a mail-in ballot. Does my colleague agree that we should ensure that people can still vote in person in that case, so they don't lose their right to vote? The Honourable Member for Montcalm. That's a great question. And it is principally for that reason that I would recommend that members of the committee review the legislation and ensure that mail-in voting stop on the Friday before the Saturday. Because as soon as someone requests a mail-in ballot, then they can't vote in person. But if on the Friday the vote has not arrived, then the person would have 2, maybe even 3 days to go vote in person. And so there wouldn't be any doubts about the issue. It would clearly be legitimate. That's why I recommend that the mail-in voting be stopped the day before the election, in-person elections begin.
Thank you, Madam Speaker. I want to thank my colleague for his great speech there. One of the things that this bill doesn't seem to address, and I think that should be addressed, is just around the confidentiality of people's votes. More and more I hear from Canadians that they're concerned that after they vote, that's in some way, the way that they voted will be known to the general public. That is not something that's specifically addressed here, but particularly around as we go to more
more and different ways of voting, that the confidentiality of our vote be secure and that it be maintained. I'm wondering if he's got any thoughts around that.
L'honorable député de Montcalm.
The honorable member for Montcalm. That's what I was alluding to when I said that we need to promote exercising the right to vote, but at the same time preserve the integrity of the voting process. However, I am reassured by the fact that these are simply pandemic measures. I don't think that mail voting should or will become a permanent measure, because indeed ballots are a secret and there is a very solemn aspect to exercising one's right to vote. And we must preserve that to ensure that people do not suffer undue influence or pressure. After all, it's hard to say what might happen between the moment that you get your ballot and the moment when you mail in your vote. And that's unacceptable. But in a pandemic, it would be even worse for people not to be able to vote at all. So we have to consider these measures. But ultimately, it's up to the government to decide whether it wants to go to the polls in a pandemic or not.
For Elmwood Transcona.
Thank you very much, Madam Speaker. And before I jump right into my remarks on C19, I want to take this opportunity on the floor of the House to recognize that it is International Women's Day, and also to note that we're debating two different bills. Bill C19 right now, which is about pandemic elections, and the government plans to call Bill C24 in the afternoon, which is about dealing with the economic consequences of the pandemic. And of course, we know that the pandemic has had a disproportionate influence on women in Canada, particularly the economic impact, because it's been workers who are in the caring economy and workers who tend to work in low-wage jobs that have seen a real disproportionate impact on their finances. And so I think it's important not only to recognize the general importance of International Women's Day, but to recognize it's important for the content of the debates that we're having today in the House. So with that, I'd like to speak to C19. I'm very glad that it has finally made it to the floor of the House of Commons. As far back as last June, this was an issue that I had reached out as the NDP's Democratic Reform critic to the other parties on to try and get a conversation started. And unfortunately, that didn't happen over last summer, but it did begin finally in the fall at the Procedure and House Affairs Committee. For Canadians who are interested in this issue, I think both reports by the Procedure and House Affairs Committee, as well as the testimony that's on the record there, would be a benefit to try and get a better handle on some of the issues that are at play and some of the very real challenges that Canadians and the country would face in the event of a pandemic election. It's why the NDP has worked hard in this Parliament to make Parliament work and to try and find and broker compromises that allow us to respond to the needs of people here in Canada to get us through the pandemic and to make sure that partisan politics isn't distracting us from that very important task, Madam Speaker. When it comes to the bill itself, I'll say that I think it's important, and we've heard this consistently at the Procedure and House Affairs Committee, that there be some more flexibility than that which our current system already allows, and in a few different ways, in order to make sure that as things progress, if we have a pandemic election, and I think we've heard from many different sides of the House today that, of course, the best way to protect both public health and our democracy during this pandemic is to avoid having an election. We know that takes effort on all sides of the House, but principally we need a government that is willing to work in good faith with the other parties in order to define its path forward and to define its pandemic response. We've seen the government do this at various times during the pandemic so far. We've been able to find that path forward, and I think as long as that spirit of collaboration persists on the government benches, we'll be able to find continue to find that path forward until it's rightly and properly safe to have an election and let Canadians decide what they liked and what they didn't, and whose interventions they appreciated and whose they didn't, and what they want in terms of a government as we come out of the pandemic and get on with the recovery in earnest. So what are some of the things that this bill does? Well, it does grant an additional adaptation power to the chief elections officer, which we think is a good thing. There's clearly going to be a need to be able to adapt some things on the fly, as it were, and in response to emerging conditions. And so we think it makes sense that because the chief elections officer already has powers to adapt the act, that we would add public health as a consideration explicitly, that the chief elections officer can take into account when exercising that power to adapt. There are some moves in the right direction in terms of long-term care and trying to clear some of the legislative roadblocks to conducting a vote safely in long-term care. I'm not sure that it addresses all of the issues that are there, but certainly being able to have one polling station per institution, which the legislation currently doesn't allow for, is an important change and will provide flexibility to Elections Canada in order to make sure that legislative requirements don't cause Elections Canada either to have the same people moving from institution to institution, which clearly is not a good idea during the pandemic and in many cases not consistent with local public health orders, or just as bad or worse from the point of view of democracy, cancel having a polling station in a long-term care facility for lack of being able to do it at one facility only. And I think one of the important themes to bear in mind for members as we have the debate about this legislation, and for Canadians as they consider this larger point about a pandemic election, is that our job is twofold. It's not only to protect public health, although it is obviously also that, and very importantly that, it is to protect democracy as well. And I think if we have an election during the pandemic that succeeds in protecting public health at the expense of not having people vote, either because people's perceptions and fears about their personal health meant that they make a choice not to participate, or because people who would choose to participate face insurmountable barriers to participation, we will have failed, because it's not enough simply to protect public health. We also have to protect our democracy, and that is a difficult thing to do. And I think it's one of the reasons why it's better if we do it in a preventative way by working well at the job we were elected to do, which is to defend the interests of Canadians and prevent the triggering of an election in any event. And of course, the NDP has asked many times in this House for the Prime Minister to commit to not unilaterally calling an election, which is now consistent with the recommendation in the final report of the Procedure and House Affairs Committee. We haven't got that commitment yet. I think that would go a long way to reassuring Canadians that we're not going to find ourselves in the unfortunate situation of a pandemic election. So there's some other things that the Act does. I know my time is limited today, Madam Chair, even more so than usual, given some of the proceedings of the House earlier today. I do want to speak a little bit to some of the challenges or some of the things that have yet to be addressed in the legislation. By way of challenge, I would just note, and the minister noted this in his lead speech on the bill, that these provisions are only set to come into force 90 days after this bill gets royal assent. So in other words, after it passes through the House and then the Senate and then gets the final nod from the Governor General. And I think that's important to bear in mind as well when we're addressing the general theme of a pandemic election, because even if the legislation were to completely pass and get royal assent today, which of course is not going to happen, we would still be in the position of having to wait another 90 days before an election would be held under these new rules as opposed to the existing ones. And I think that's important to mention, although I appreciate it will take time for Elections Canada to bring these new measures into force. I think it's important on the general point of getting some better reassurances from the Prime Minister and the government about whether we have an election or not. Because for as much as some people in the House will like certain things about this bill, it's not, even if we were to pass it today, it wouldn't be in effect for some time. So there's clearly a need to be working in that spirit of collaboration for some time to come in order to be able to avoid an election on the existing set of rules, which I think are not adequate to the circumstances. I also know that there's been a lot of talk about, whether we should accept postmark ballots by election day, whether the cutoff should be election day for mail-in ballots, whether the cutoff should be the Tuesday after the election day as this legislation foresees. The thing that I want to put on the record about this, Madam Speaker, because I think there is more than one way to solve this problem. I think the best way will be the way where we can find as much agreement as possible. I beseech members in all parties to keep an open mind about this, because it is a very difficult circumstance. I do think that having a hard cutoff for when ballots are accepted that corresponds to election day really does put us in the risky situation of having people who applied in good faith for a ballot and didn't get it in a timely way, and did as much as they could in order to ensure that it would get to Elections Canada, recognizing, of course, that as much as you can is different for different people. It matters whether you have your own vehicle. It matters whether you're able to drive or not. It matters whether or not you have somebody in your support network that can get you to one of the designated drop boxes outside of a returning office. It matters how easy it is to get to the local mailbox, which can vary depending on the weather. There are all sorts of things that come into play. It's not like a normal election. And I would want us to ensure that there is the possibility that people who applied for a special ballot but don't get it in time, or for other reasons aren't able to get it in the mail in time or in the drop box in time, are not deprived of their right to vote. Exactly because I think we have a double duty here, both to public health and to democracy. And I think it would be tragic if a number of Canadians were not able to exercise their right to vote because of administrative complications and deadlines that are beyond their control. And I do think it will be harder to meet the normal deadlines of an election in the ways that we're used to if we have a pandemic election. So I would just call for some open-mindedness on that, Madam Chair, as we go forward. I'm sure it will be the subject of some debate at committee when the bill finally gets there, as I'm confident it will. And so that discussion is not over, and I think it's just important that we perhaps could at least agree on some of the guiding principles for that conversation before partisan lines get drawn too starkly in the sand, Madam Speaker. I do think that there are a number of things that aren't addressed in the bill that ought to be. So for instance, it came up in debate earlier, but the question of how we collect nomination signatures, everyone in this House will know you need 100 signatures from people who live in the riding in order to be officially nominated as a candidate with Elections Canada. Usually that's done by going door to door with sheets of paper and pens. That's not going to make a lot of sense in the context of a pandemic election. So we need another way to do that that's appropriate and safe. This bill does allow for people to apply for a special ballot online. And while I think that's a great thing and a great tool, and is going to be wonderful for the people who are able to avail themselves of that because they have the technological literacy and because they have the equipment in their own home, we're very mindful that there are a lot of people for whom that technology is not accessible. And those people are going to need to be able to apply in person without having to print the documents at home and all of that. And we recognize in the NDP that we have an incredibly valuable resource at our fingertips, which is Canada Post, that has a number of postal outlets in every community across the country already, with people who check ID already for other reasons, and I think is well equipped to be a space for those who need it to be able to go and apply for a special ballot in person. And so we encourage the government and Elections Canada to look very seriously at leveraging that network to ensure that people can access their right to vote if the time comes that they're required to do so, Whether that's best done in legislation or not is a question that we're open to discussing. But I think seeing a commitment to that is important in recognition of all the people for whom online, simply isn't the best tool. We've talked a little bit about the Campus Vote program, and there's obviously some different opinions about, whether that ought to continue or not. But we heard from representatives of students at committee very clearly there continue to be students living and working on campuses, and we can increase access to the vote if we maintain that important program. It ought to be done. I think one of the other things that we need to see, I'm sure Elections Canada will be addressing in its own way, but we should know if there's anything legislatively required in order to do that in the best way before we approve the bill, is the question of scrutineering in long-term care facilities. Because as much as we've talked a bit about how to staff it, there's still the question of having scrutineers come in. So those are my initial thoughts. I see the Speaker is anxious to get on with the orders of the day, and I thank you very much for his grace in allowing me to conclude. Thank you very much.
I want to thank the Honourable Member for Almut-Transcona for cutting it short, but he will have another 6 minutes coming to him when we return, and he can start and continue and finish his argument. Right now, we'll go to statements by members. Déclaration de député, the Honourable Member for Saanich Gulf Islands.
Thank you, Mr. Speaker, and happy International Women's Day to all of us in the House of Commons. We have now made history as of October 2020. There are 100 women to celebrate in our Parliament across all party lines. I want to celebrate today the Daughters of the Vote. It was only 4 years ago that Daughters of the Vote first occupied the Centre Block Chamber in person. They're in Ottawa virtually now. And let's celebrate across party lines the Honourable Member for Nunavut, who was a Daughter of the Vote just 4 years ago and now sits in that place and does this chamber such honor. I want to celebrate our colleague, the first woman Minister for Finance, celebrating a Minister for Finance, at long last, a woman. And now we also celebrate some former colleagues. I want to celebrate my friend, the Honourable Pat Carney, who served as a cabinet minister, who negotiated the first Atlantic Accord, negotiated the first free trade agreement, and is now one of my constituents. Thank you all. Let's hold each other up and give Daughters of the Vote a future to look forward to with more women in the House.
The Honourable Member for Halifax West.
Hear, hear. Mr. Speaker, it gives me great pride to offer congratulations to Nova Scotia's new Premier, the MLA for Timberley Prospect, Ian Rankin. And thanks to former Premier Stephen McNeil, who stewarded the province so well from 2013 to 2021. Premier Rankin and his new cabinet were sworn in on February 23rd by Lieutenant Governor Arthur J. LeBlanc. I have every confidence Premier Rankin will guide Nova Scotia well through these challenging times and into a bright future ahead. In an address after swearing his oath of office, Premier Rankin said, "We are writing a new chapter for sure, but it is one that reflects and respects our past." During his first full day as Nova Scotia's 29th Premier, he announced a brand new initiative as part of the province's commitment to climate change action, supporting jobs, and a renewable future. Best wishes to Premier Rankin and his team. I know they'll do Nova Scotia proud.
The Honourable Member for Bellechasse-les-Etchemins-Lévis.
National Engineering Month across the country. It's an opportunity for young Canadians to learn about the exciting, fun, and rewarding world of careers in engineering. Gradué de l'Université de Sherbrooke, je suis fier.
Graduate of the University of Sherbrooke, I'm proud of my years in engineering. Before falling into politics, I would like to thank Engineers Canada for the title of Fellow granted to me. With immense natural resources and a country that always needs to be built up, Canada is a land of exceptional opportunity for engineers, both men and women. I would like to especially thank women who have chosen the profession of engineer. Through their accomplishments and their determination, these women are building a better and more equal Canada.
Opportunity to showcase the achievements of women and men in engineering, to share their successes and accomplishments. Oui, célébrons le mois national.
Let us all celebrate National Engineering Month.
I just want to remind all the members, j'aimerais rappeler aux députés.
I would like to remind members that it's better if they use their headset. The sound is much better. And for the translators as well, it's much easier for them, as well as everybody else online and in the house. That way they can hear you better, because we all want to hear what you have to say. So, for the remaining members, this is just a little reminder for you.
Brampton South.
Mr. Speaker, happy International Women's Day. Today we celebrate the contribution of all women, especially entrepreneurs and leaders within our communities. In my riding of Brampton South, I would like to thank women driving the feminist recovery, small business owners like Mary from Christina Strotina and Dupinder from Freshie, Parveen Rashid, Swati Tucker, Balbir Mali, Maninder, and Mandeep for doing charity work in Brampton, Melanie Campbell from Startup Hill, and many more. Women like Susie Godfrey from Downtown Business Association helped Brampton business throughout the pandemic. Today we celebrated women like them. But Mr. Speaker, we must continue to dismantle the barriers for women and work together. Initiatives like GBA+, pay equity, women's entrepreneur strategy will encourage the economic participation of women in the workforce. Together, we can uplift women within our communities and further Canada's journey towards gender equality. Thank you, Mr. Speaker.
The Honourable Member for Salaberry-sur-Roi. Mr. Speaker, I'd like to take the opportunity offered by International Women's Day to thank our staff in caring professions, to remind this self-identified feminist Prime Minister that 82% of them are women. When he refuses to increase health transfers during a public health crisis, it's not just Quebec and the provinces he's failing to support. It's not François Legault that he is saying no to. It's every nurse who has made immense sacrifices for a year to shore up our system. It's denying them the financial means to get more support to allow them to finally breathe for a moment. It's denying our nursing home workers the means to have working conditions that match their dedication. It's treating doctors and every other health professional who saves lives on the front lines as less than a priority. And so today, in the context of the worst pandemic of our century, I invite the Prime Minister to think of those women and to finally increase health transfers. The Honourable Member for Bourassa. Mr. Speaker, International Women's Day celebrates this year the theme of Choose to Challenge, and it gives me the opportunity to award for the fourth year 8 exceptional women the medal for the member for Bourassa to highlight the immense work accomplished by these women before and during the pandemic. Thank you to Honourable Senator Meji, the Minister of Women and Gender Equality, as well as elected officials in Bourassa for their participation. I'm proud to highlight Maslin Alexandre Auguste Jamal Awada, Leonarda Bonadonna, Stéphanie Germain, Ariane Hopkins, Maude Royal, Linda Terrien, and Nancy Wiseman. Dear colleagues, please join me in congratulating these exceptional women. Thank you, Mr. Speaker.
The Honourable Member for Saskatoon West.
Mr. Speaker, at the end of February, I was able to host an online town hall in my riding of Saskatoon West on the issue of affordable housing. The town hall was attended by our Shadow Minister for Housing, along with a panel of local experts and a good number of constituents from all backgrounds. Through my previous work as a home builder and my involvement of myself and my wife with the Bridge on 20th Fellowship Center for 20 years, giving a hand up to those who need it is something that I take seriously. Helping everyone get an adequate roof over their head is a critical first step in addressing other challenges like drug addiction. Unfortunately, the Liberal Rapid Housing Initiative, as we learned from the experts and constituents who attended my town hall, falls far short of the real need. Saskatoon was left out of the initial phase of the program entirely, forcing individual projects to compete and undercut each other for the remaining money with requests nearly 10 times the available funding. Mr. Speaker, I will continue to listen to my constituents and fight for the affordable housing that Saskatoon needs. I only hope the Liberal government heeds this call.
The Honourable Member for Charlottetown.
Mr. Speaker, today on International Women's Day, we celebrate the accomplishments and leadership of women in Canada and around the world, and recommit ourselves to moving forward to a future in which everyone has an equal chance to succeed. We know that when we invest in women's and equality-seeking organizations, we are helping to build a stronger and fairer Canada. Recently, I announced almost $1 million in combined funding for two organizations in the Great Riding of Charlottetown, the PEI Coalition for Women in Government and the Women's Network. This funding will help these organizations to continue to advance gender equality, which lifts up all islanders. Congratulations and thank you to Sweta Debu and Gillian Kilfoyle for their leadership. Since 2015, our government has invested over $4 million in PEI to empower a strong and vibrant women's movement. As we continue to navigate this pandemic, I'm proud to be part of a government committed to an inclusive recovery that advances gender equality and supports those who need it most. Thank you, Mr. Speaker.
The Honourable Member for Toronto Danforth.
Happy International Women's Day, Mr. Speaker. You know, our main streets have been hard hit over this pandemic, but women in my community have been at the forefront of standing up for small businesses and for strong, vibrant streets. Most of my local BIAs are led and have women in leadership positions, like Jennifer Lay at the Riverside BIA, Christiane Tétrault at the Leslieville BIA, Tasneen Bandkwala at the Gerard India Bazaar, Dawn Chapman for Gerard Coxwell, Susan Puff for Broadview Danforth, Mary Fragadakis for Greektown BIA, Tracy Kish and Clarraine Denny for the Pape Village BIA. And we just lost a tiger for our small businesses and BIAs, with the East Chinatown Chamber of Commerce having lost Valerie Ma, a real dynamo for our community. Thank you to all of these women and all of the work that they do to support our small businesses every year, and especially in this past year. Thank you, Mr. Speaker.
Honourable Member for Provencher.
Mr. Speaker, today is International Women's Day, and the theme is Choose to Challenge. Brave survivors of online sexual exploitation are doing exactly that. Survivor Victoria Gailey recently told the Ethics Committee, Pornhub has become my human trafficker, and they've been relentless in doing so. Over 100 survivors of sexual exploitation and hundreds of non-governmental organizations are calling on the federal government to initiate a full criminal investigation into Canadian-based MindGeek, Pornhub's parent company. In recent years, MindGeek has received international attention due to the real exploitation of women and minors featured in some of their published content. Many of these practices are prohibited under existing criminal code provisions, yet charges have never been laid. This lack of enforcement is shameful. Every Canadian, every woman, every girl deserves the full protection of the law. On International Women's Day, we affirm the rights of all women and girls to live free from violence and exploitation.
The Honourable Member for West Vancouver, Sunshine Coast, Sea to Sky Country.
Mr. Speaker, today marks the somber one-year anniversary since COVID-19 claimed its first life in Canada, a resident of Lynn Valley Care Centre in North Vancouver. Since then, over 14,000 more seniors have perished due to the virus in long-term care centres, representing over two-thirds of the total COVID-19 deaths in Canada, and undoubtedly the biggest calamity of this pandemic. This has hit very close to home, with West Vancouver's Capilano long-term care home tragically experiencing one of the deadliest outbreaks in British Columbia this past winter. With all long-term care patients and workers now vaccinated in BC and enough vaccines on the way for all eligible Canadians to get their first dose by early summer, we can look forward to better days ahead. But in the process, we must not forget the many neighbors and loved ones we have lost along the way, and remember the tireless work of our healthcare professionals and frontline workers who have sheltered us from the worst of this pandemic. Thank you, Mr. Speaker.
L'honorable député. The Honourable Member for Richmond-Arthabaska. Mr. Speaker, today, in my riding of Richmond-Arthabaska, like in many other regions in Quebec, we went into orange alert. That means that many local businesses, like restaurants and cultural establishments, can finally reopen their doors. I would like to remind everyone of the importance to support them by buying local. These businesses are the heart of our communities and the soul of our downtowns and municipalities. To ensure their survival, they need, now more than ever, our support. I would like to seize the opportunity to thank every frontline worker, whether it be in health care, food services, public safety, transportation. These men and women have been playing an essential role from the very beginning of the pandemic. I would like to say to them, On my behalf and on behalf of the entire public, thank you so much for your exceptional contribution.
The Honourable Member for North Okanagan, Shuswap.
Mr. Speaker, recently the Honourable Member from Niagara and I co-hosted a virtual town hall with my constituents of the North Okanagan Shuswap. We heard that Marcia operates a bed and breakfast, and she's been left behind by the government's faulty programs. Cheryl works with a small nonprofit that has also been left out of the relief programs. Tyler started producing hand sanitizer when Canada had none last year. But Tyler and his employees were left out when this government spent $252 million on Chinese sanitizer. And Tyler and other producers will be hit by another excise tax hike in April. Monica works at a marina that is going to suffer because this government is jacking up costs and licensing for boaters. These are more than just stories. These are people left behind by this government. These people and all Canadians deserve better. They deserve a Conservative government that will work with them to secure our future.
The Honourable Member for Edmonton Strathcona.
Today is International Women's Day, a day to celebrate women and girls, but today is also a day to fight. COVID-19 has had very serious consequences for women around the world. In Alberta, we have not seen women's unemployment rates so high since the 1980s. In Canada, even after 50 years of promises, women still don't have the National Child Care Program recommended by the Royal Commission on the Status of Women. And around the world, girls are leaving school at alarming rates, crippling their future and making them vulnerable to early marriage and sexual violence. As a woman who has fought for equality for women and girls my whole life, both in Canada and around the world, I will celebrate today. As a woman who has benefited from the leadership and strength of those who have come before me, I will celebrate today. And as a woman who has seen the power and the potential in my daughter and in all young women, I will celebrate today. But Mr. Speaker, I will also fight.
Le député de Thérèse de Blainville.
The member for Thérèse de Blainville. Mr. Speaker, during International Women's Day, I wish to highlight the colossal effort and sacrifices made by women workers during the pandemic. I say women workers because women are the majority in most professions that are on the front lines today. Caregiving staff is 82% women. And they've been shoring up our network and saving lives. Our teachers, 78% of them are women. They've been reinventing education every single day, but also they've been supporting our children during this difficult time. And the vast majority of people looking after our little ones in daycare are women. During the fight against the pandemic, essentially, women are the ones on the front lines. They are the ones who have been risking themselves from the beginning to allow all of our children, our parents and our grandparents to have support. On behalf of the Bloc Québécois, thank you from the bottom of our hearts.
Port Moody Coquitlam.
Thank you, Mr. Speaker. Today we celebrate the contributions of women across Canada. With the advocacy of the famous five, Canadian women won their rightful status as persons in 1929 and voted for the first time in 1916. We've made some progress, but when it comes to violence against women, under this Liberal government, we're far behind. There's still no government action on the report on missing and murdered Indigenous women and girls. The Prime Minister failed to acknowledge the systematic rape of Uyghur women as genocide in Xinjiang by refusing to show up and vote on the motion. Women have been sexually assaulted at government quarantine sites, yet the minister continues to assert these sites will keep Canadians safe and fails to shut them down. In 2018, Ombudsperson Welborn informed the Minister of Defence of a sexual misconduct complaint against General Vance, but the minister failed to act and the PM continues to cover up for the minister. On behalf of the traumatized women who have yet to see justice, I would like to ask the Prime Minister, when will he stop gaslighting women and start protecting them?
L'honorable député de Brassard.
The Honourable Member for Brassard-Saint-Lambert. Mr. Speaker, during this International Women's Day, I hesitated on the nature of the tribute I wanted to pay to my fellow sisters. There are so many women in my life to whom I owe so much. But After the year that we've all just experienced, I think it's important to highlight women. Every woman who, from the very beginning of the pandemic, have taken on the role of caregiver in every aspect of our communities. From mother to doctor, teacher to nurse, support worker to cashier, millions of women took on responsibilities, accepted burdens, and innovated around them. On this day that is dedicated to women, let it be the beginning of a deep reflection on how we can change the recognition, financial and societal, of these women for whom caregiving is a life's mission. Happy Commonwealth Day. Thank you, Mr. Speaker.
Question orale, oral questions. The Honourable Member for Portage-Lisker.
Mr. Speaker, when allegations surfaced about General Vance, the Minister of Defence said multiple times that he was shocked to learn about them. Well, we know this isn't true because he'd known for 3 years and he did nothing. It's obvious the minister never intended to act on this misconduct, and instead Liberals actually threatened members of the armed forces in order to keep them quiet. So the question is why? Why was the Minister of Defence more interested in protecting his battle buddy than the men and women of the Canadian Armed Forces?
Honourable Minister.
Mr. Speaker, I disagree with the member's assertions. I disagree with the testimony that Mr. Waldman provided to the committee, and look forward to setting the record straight when my opportunity comes to speak with the committee. Thank you, Mr. Speaker.
The Honourable Member for Portage-Lisker.
Mr. Speaker, you're either part of the investigation or you're part of the cover-up. There is no middle ground. This minister chose to turn a blind eye, and he helped cover it up. I believe the Ombudsman, Mr. Speaker, when he said that he tried to show the minister evidence, and the minister said, no, I don't want to see it. Rather than protecting the very men and women he was supposed to be serving, the minister was more concerned with optics and keeping dirty little secrets. Does the Minister of Defence realize he has failed to do his job? He has lost credibility. He has lost trust.
Honourable Minister.
Mr. Speaker, as I've said, any allegations that were ever brought forward were immediately put forward to the proper authorities. In fact, the very next day after informing me of the concerns, the former ombudsman was contacted by the Privy Council office to begin an investigation. There was no evidence that the ombudsman relayed this to the original complaint, despite repeated follow-ups by senior officials. And as I stated, Mr. Speaker, I look forward for an opportunity to go speak at committee once again. Thank you.
The Honourable Member for Portage-Lisker.
In November 2017, the Prime Minister said in an interview that when there are questions of sexual misconduct, many times Liberals know but say nothing. Well, it's 2021 and it's still happening. The Liberal Minister of Defence knew. He said nothing. Privy Council members knew. They said nothing. Liberal PMO staff knew, and they apparently said nothing. Today, on International Women's Day, it would be nice if the Prime Minister would stop defending these Liberals who knew about these allegations and said and did nothing. Will he do that, Mr. Speaker?
Honourable Minister.
Mr. Speaker, as we've stated, we have no tolerance for misconduct. Mr. Speaker, also, no politician should ever be part of any type of investigation. When any time allegations were brought forward, Mr. Speaker, were always provided to the appropriate authorities so that an independent investigation can be conducted, Mr. Speaker. Thank you.
The Honourable Member for Louis Saint Laurent. Mr. Speaker, 3 years ago, on the 1st of March 2018, the National Defence Ombudsman met with the Minister, who said that the current commander was the subject of a sexual harassment complaint. The Minister said that he only became aware of it, but he was contradicted by the Ombudsman. The Minister didn't even want to see the evidence. What a lack of courage, and what an abdication of responsibility. Why did the Minister of Defence act in this dishonourable way?
Mr. Speaker, I completely disagree with the member's assertions here. Any time any allegations were ever brought to my attention, was always brought forward. No politician should ever be part of an investigation. It should always be done independently. And that's why immediately that these allegations were brought forward to the Privy Council office so that the independent investigation could be conducted. I disagree with the testimony provided by the former ombudsman, and I look forward to showing up at committee to set the record straight. Thank you, Mr. Speaker.
The Honourable Member for Louis Saint Laurent. Mr. Speaker, what's incontestable is that for 3 years, the Minister and the Prime Minister were silent. For 3 years, they did absolutely nothing to solve the situation. Now today, the Prime Minister, what does he do? He defends his minister and accuses the Ombudsman. What a shameful attitude. How is it that a self-proclaimed feminist can deal with this sexual harassment case with so little courage?
Minister.
Mr. Speaker, we're not going to take any lessons from the opposition when it comes to our action supporting gender rights. We were the first government where the Prime Minister appointed a 50% cabinet. In the Ministry of Defense, we actually brought forward the Declaration of Victims' Rights, Mr. Speaker. We have taken action when it comes to gender rights and will continue to do so and not take any lessons from the previous government. Thank you.
The Honourable Member for Saint-Jean. Mr. Speaker, once again last week, Quebec and all the provinces asked the government to increase the health transfers. The Prime Minister replied that he would think about it, but only after the pandemic. How many times do we have to say it? We are in a public health crisis, so we need to invest in health. And we need to do it during the crisis, not after. There's a fire that needs to be put out. Everyone has understood that except the Liberals. When will they listen to reason and finally increase the transfers?
Le Ministre.
The Honourable Minister.
Merci, Monsieur.
Thank you, Mr. Speaker. At every step, we were there for the provinces and territories.
Historic investments in provinces and territories, pre-pandemic and of course during the pandemic. $19 billion in Safe Restart money, Mr. Speaker. $2 billion for safe schools, Mr. Speaker. Purchasing all the personal protective equipment, funding the purchase of vaccine acquisition, funding research, being there for long-term care outbreaks. Will continue to be there for provinces and territories, Mr. Speaker, as we get through this pandemic together.
The Honourable Member for Saint-Jean. Mr. Speaker, this government claims to be feminist. Well, 82% of nursing staff are women, and the government is abandoning these women by refusing to increase health transfers. Essentially, the government has told them to make do, and now they're telling them to make do in the second wave as well. And as vaccines start coming in, it's the same women who are going to be doing the vaccinations. They're carrying the entire burden on their shoulders. When will the government finally recognize their sacrifices and help them by increasing the health transfers?
L'Honorable Ministre.
Thank you, Mr. Speaker. As I've said repeatedly, we'll be there for provinces and territories as we have been all along. In fact, when we talk about gender equality today, it's important to remember that not only did we support immediate responses in long-term care, support provinces and territories in the extraordinary expenses they faced as a result of the pandemic, but we also topped up the wages, Mr. Speaker, for provinces and territories' essential workers that are often women. Mr. Speaker, we have been there for provinces and territories before the pandemic, throughout this historic health crisis, and we'll be there as we recover.
L'Honorable Député de Burnaby.
The Honourable Member for Burnaby South.
Merci. Ça prend...
Thank you. It takes a lot of courage to file a sexual harassment complaint, but that is exactly what a woman in the Canadian Armed Forces did. That complaint landed in the office of the Minister of National Defence, but he did nothing. What will the Prime Minister do to protect women in the Canadian Armed Forces? The Honourable Minister.
Mr. Speaker, we have absolutely no tolerance for misconduct, Mr. Speaker. Our government brought in the Declaration of Victims' Rights. Currently, we have Military Justice Fish reviewing the military justice system. We actually have an independent panel currently on the systemic racism, dealing with how to deal with systemic racism and gender bias, Mr. Speaker. We will continue this work. This is the work that we started as a government. We need to continue this so that we can prevent situations like this from happening at all. Thank you.
The Honourable Member for Burnaby South.
Mr. Speaker, it takes incredible courage to come forward with a complaint about sexual misconduct. And that's exactly what a woman did in the Canadian Forces. And that complaint made it all the way to the desk of the Defense Minister, who did nothing about it. That sends a message to all women in the Canadian Forces that they will not be listened to and that they're not safe. That is wrong. This doesn't stop with the Defense Minister. This goes all the way to the Prime Minister. what will the Prime Minister do to make sure women in the Canadian Forces are safe?
Honourable Minister.
Mr. Speaker, first of all, I disagree with the member's assertions. Our government has absolutely no tolerance for this type of inappropriate sexual behavior. As I've said, any allegation that was always brought forward were always taken to the appropriate authorities. No politician, elected official should ever be involved in any type of elected investigation. This should be done independently so that there is confidence in the process. And Mr. Speaker, we will always support those who come forward. Thank you.
The Honourable Member for Aurora, Oak Ridges, Richmond Hill.
Monsieur le Président.
Mr. Speaker, on International Women's Day, we celebrate strong women who had the courage to break down walls and inspire future generations. The women in our Canadian Armed Forces deserve to serve alongside their male counterparts and to do so proudly. But when the Minister of Defence was made aware of serious allegations of sexual misconduct at the highest level, he did nothing. How will he repair the damage done? The Honourable Minister.
Mr. Speaker, first of all, I disagree with the member's assertions. There's a lot more work that needs to be done. But the assertion that the member made is absolutely wrong. Anytime information that was brought forward is always taken to the appropriate authorities. But I do agree with the member. A lot more work that needs to be done to root this out. This is going to take a significant effort, an effort that should have started a long time ago, way before our government was elected, Mr. Speaker. But we're going to continue that work because we believe in it. We have to get this done, and we will. Thank you.
The Honourable Member for Aurora, Oak Ridges, Richmond Hill. Mr. Speaker, for 3 years, the Minister of Defence turned a blind eye to serious allegations against the former Director of the Canadian Armed Forces. Now, another high-up stands accused, while a whistleblower has received threats. No action was taken, and the abusive behaviour was allowed to continue. What will the Minister do now to ensure that the Canadian Armed Forces are completely free from harassment? The Honourable Minister.
Mr. Speaker, I completely agree with the member where we need to take action so we can have an inclusive environment, Mr. Speaker. We have done considerable work, but we have a lot more work to do. We actually got past the Declaration of Victims' Rights Bill, which, by the way, Mr. Speaker, it died on the order paper with the previous government. We have currently a review of the military justice system, how we can move forward. SMRC is also moving forward. We're currently looking at what type of independence needs to be provided. We have an independent panel on systemic racism and gender bias. Looking forward to those recommendations so that we can continue the progress that we have already started, because our women deserve to have an inclusive place in the Canadian Armed Forces. Thank you.
The Honourable Member for Aurora, Oak Ridges, Richmond Hill.
Mr. Speaker, when faced with serious allegations of sexual misconduct within the top ranks of the Canadian Forces, the Prime Minister and this Defence Minister failed to act. And now a whistleblower has been threatened to secure his silence. Senior officers who may themselves be complicit remain in key positions within the chain of command. Victims and whistleblowers must be able to come forward without fear of reprisal. How will the Defence Minister protect victims and ensure that those who may stand accused won't interfere to protect themselves?
The Honourable Minister.
Mr. Speaker, we want our survivors to come forward. We want them to be able to put forward the allegations. They will be heard. They will be protected. At no time did any staff member in my office ever speak with any of the callers. And any insinuation that any political staff ever reached out to the caller is absolutely false. Thank you, Mr. Speaker.
Honourable Member for Lakeland.
Mr. Speaker, people who have security clearances are thoroughly investigated for issues that might compromise them, like affairs, potential criminal behavior, and other actions that could open them up to external influence or blackmail. In 2018, the Ombudsman offered the Defence Minister evidence of sexual misconduct by his Chief of Defence Staff, but he refused it. Last week, he claimed he didn't know it existed, but clearly he did. His own staff flagged it. So did the minister tell the relevant security services that he knew of potentially compromising evidence against his own Chief of Defence Staff?
The Honourable Minister.
Mr. Speaker, first of all, I disagree with the assertions that the member has made. I disagree with the testimony that the former ombudsman has made. Any allegations were immediately taken forward, Mr. Speaker, to the appropriate authorities. In this case here, because it's a governor council appointment that we're talking about, to Privy Council, and immediate action was taken. In the former ombudsman's own testimony, the Privy Council office contacted him the very next day, Mr. Speaker. That's what action is about. We will always take this very seriously because we need to create an inclusive environment. That is exactly what our government and I have been working towards in the Canadian Armed Forces from day one. Thank you.
The honourable member for Lakeland.
But the minister himself is the top authority. And in security clearance vetting, people are asked about their families, about their previous jobs and previous addresses. They're asked about parallel relationships as code for extramarital affairs. Changing circumstances reports are issued for security purposes about divorces and financial transactions. The minister knows all this, and security services need detailed information on everyone who has a clearance. So again, when the minister was made aware of evidence of sexual misconduct by his chief of defense staff, did he tell the security services?
Honourable Minister.
Mr. Speaker, as a former police officer and a former member of the Canadian Armed Forces, absolutely. First of all, know exactly where to go. That's exactly where we went, to the Privy Council, who's in charge of governor and council appointments, to actually take a look at any type of allegations, Mr. Speaker. And I couldn't agree more. But you also have to realize, Mr. Speaker, that the former chief of defense staff was actually appointed by the previous government. So those are the things that we need to get to the bottom of. We will be looking at a review to take a look at what actually happened there. Thank you, Mr. Speaker.
Member for Lakeland.
What's clear, Mr. Speaker, it's that these Liberals are all just talk. They're all just total hypocrites when it comes to listening and believing women. He had all the power and all the facts. He had the tools, and it was his duty to investigate. The Ombudsman says after talking with him, the minister canceled 7 meetings. His work was, quote, gutted, hostile, toxic. He says there was a, quote, hit job, a cover-up to get rid of him, and months later he resigned in frustration. So why did these Liberals actually use all their tools to silence victims and force out a whistleblower to protect their buddies?
Before going to the minister, I just want to remind the honourable members that calling other members' names is not allowed. It's not parliamentary language. Just a reminder, and I'm sure that it'll sink in. The honourable minister.
Mr. Speaker, as I stated earlier, I disagree with the former ombudsman testimony, and I look forward to it. In fact, I welcome my opportunity to come speak at the next committee meeting, Mr. Speaker. And when it comes to the horrible situation that some of our women have been forced into, as I stated, we want our survivors to come forward. They will be protected, but we have a lot more work to do, Mr. Speaker, and we will continue to do this to make sure that we create an inclusive environment for everyone to be able to serve in the Canadian Armed Forces. Thank you.
The Honourable Member for Avignon-Lamitis Matane-Matapédia. Mr. Speaker, 2 weeks ago, the Prime Minister said that he was ironing out the details related to the mandatory quarantines in hotels. Well, that's an understatement. The situation is chaotic and even dangerous. The government was unable to ensure the safety of the people it's responsible for. It's such a problem that we've heard citizens saying they would rather pay the fine and suffer the consequences than go to the hotel under these conditions. Can the Prime Minister tell us how many people preferred to pay the fine than to take the hotel quarantine? The Honourable Minister.
Mr. Speaker, Canada has some of the strongest protective measures at the border to prevent the importation of COVID-19. We continue to work to add layers of protection to ensure that we understand who is carrying the virus and how infections are entering the country. And indeed, as we see the rise of variants of concern, how the virus is shifting and shaping. We'll continue to ensure that travelers are safe when they enter Canada and that Canadians are safe as well.
The Honourable Member for Laurentides-Labelle. Mr. Speaker, there's still more mismanagement in the hotel quarantine saga. The rules that apply to travelers arriving by air do not apply to those arriving at our land borders. So what's happening? People fly to Burlington, get on a bus, cross the border, and circumvent the mandatory quarantine at the hotel. Mr. Speaker, the goal of these measures is supposed to be to limit non-essential travel, regardless of the method of transportation used. So why don't the same rules apply to all non-essential travelers? That would make sense, wouldn't it? The Honourable Minister.
Monsieur le Président, comme...
Mr. Speaker, as my colleague from the Bloc Québécois knows well, we have some of the strictest measures in the world. There are, of course, the air traveler conditions, and there are also additional rules considering land travel. Now, would the Bloc Québécois prefer that there be no measure and that we stop controlling both air and land borders? Is that what I am to understand? The Honourable Member for Manicouagan. Well, I don't understand, Mr. Speaker, because soon we'll learn that tourists are escaping, or rather circumventing the quarantine by passing by Roxham Road. The whole saga of quarantines is just pathetic. What we're asking the government to do was regulate the return of travellers at Christmas to prevent the entry of COVID variants. That was Christmas that we asked for that, but it's taken until February for them to act. And now the variants are already in our schools. 2 weeks later, everyone had figured out how to get around the rules by crossing the land border rather than by air. How is it possible to drop the ball at every single step, Mr. Speaker? The Honourable Minister.
Monsieur le Président.
Mr. Speaker, it seems to me that the Bloc is very happy about the fact that they had to ask so many questions at Christmas. They probably asked questions before then and after. That's their job. But during that time, we were taking action. We were implementing some of the strictest measures in the world at the border. Whether we're talking about air transportation or land transportation, because our goal was to protect all Canadians. It seems to me that perhaps the Bloc would prefer not to have such strict measures, but we want to have them.
In St. Paul.
Mr. Speaker, the public has just learned that in February, a senior naval officer in the Canadian Armed Forces alerted the Liberal Defence Minister's office to an allegation of sexual misconduct against the Chief of the Defence Staff, Art MacDonald. In response, it is alleged he was told to report his concern elsewhere. Since then, the senior naval officer has received anonymous phone calls threatening his military career. Is the government investigating this shocking report of intimidation, and why is it that the defense minister is failing to protect whistleblowers and victims of sexual harassment in the Canadian Armed Forces? Is that not his duty, Mr. Speaker?
Honourable Minister.
Mr. Speaker, any allegations that were brought forward were immediately reported to the appropriate authorities. In this case, a complaint of misconduct was received by the switchboard, immediately relayed to an official in the Department of National Defense. And at no time did any staff of my office speak with the caller, and any insinuation that any political staff ever reached out to this caller is false. We want people to come forward, Mr. Speaker, that were sent to the appropriate authorities so that any allegations can be investigated. Thank you.
The Honourable Member for Elgin, Middlesex, London.
Mr. Speaker, in the last Parliament, the Status of Women Committee studied the treatment of women in the Canadian Armed Forces. Witnesses said their concerns were ignored and that after reporting sexual misconduct within the Canadian Armed Forces, they faced retaliation from their superiors. Women were passed over for promotions, and some even saw the reports being handled by those who were accused of misconduct in the first place. This government knew about issues occurring. Where was the action, and what has this government done to deal with these concerns?
The Honourable Minister.
Mr. Speaker, I couldn't agree with the member more. More needs to be done in the Canadian Armed Forces, and that's exactly what our government started doing. More importantly, we actually got the Declaration of Victim Rights Bill passed. And this was very important because it actually died on the order paper with the previous government, Mr. Speaker. We're also currently reviewing the military justice system by actually Justice Fish so that the changes we can look at to be more even responsive. We want to make sure we give survivors the opportunity to come forward so they can be heard, so that allegations can be investigated, Mr. Speaker, and making sure that no retributions could ever come on them as well. Thank you.
Honourable Member for Elgin, Middlesex, London.
Mr. Speaker, the Status of Women studied in 2019 that the government implemented all 10 recommendations of the 2015 Deschamps Report, an external review of sexual misconduct and harassment in the Canadian Armed Forces. The Chief of Defence Staff responded by launching Operation Honour. But as we've seen, even the top ranks of our military remain plagued by sexual misconduct. How can Operation Honour be effective if the Minister of Defence ignores reports about sexual misconduct at the highest levels of the armed forces?
Honourable Minister.
Mr. Speaker, first of all, I completely disagree with the member's assertions. As I stated, I look forward to going to committee and I welcome my opportunity to speak there. We take every allegation seriously, Mr. Speaker. There's a lot more work that needs to be done. The great work that has been done by Dr. Preston within the SMRC, where our justice, military justice, is being currently reviewed as well. More importantly, we actually have an independent panel made up of former serving members that's going to review the systemic racism, including gender bias. So a lot more work is going to happen. We have a lot more work to do. Everything is currently on the table so that we can actually make these changes, because this is the progress that we have started, and we're not going to stop until we have inclusive.
Member for London Fanshawe.
On International Women's Day, it is important to acknowledge the fact that women who report sexual harassment and violence are often not listened to or taken seriously, making it hard for them to come forward. The Liberal government has proven through recent incidents that they are part of this problem. The Minister of National Defence refused to even hear allegations against a top member of our armed forces, and the Prime Minister's office knew about these allegations and did nothing. How can the Prime Minister expect women to be confident to come forward when they themselves refuse to show leadership?
The Honourable Minister.
Mr. Speaker, as I stated, I look forward to going to committee to set the record straight when it comes to the former ombudsman's testimony. We do have a lot more work to do. The progress that has been made with having the Declaration of Victims' Rights Bill, a review of the military justice system. We are looking at other opportunities where we can create greater independence as well. We're going to build up on the work that we have done, Mr. Speaker. A lot more work that needs to be done, a lot more review that needs to be done. We need to make sure that we work harder to create an inclusive environment for all Canadian Armed Forces members, especially women.
The Honourable Member for Winnipeg Centre.
Mr. Speaker, last Thursday we heard very sad news that another Indigenous woman had been murdered in the city of Winnipeg. She was loved and cherished by her family, community, and friends. I send my love and sympathies. Government inaction is costing the lives of women, girls, 2S LGBTQIA individuals. Her life mattered, and her life was of value. Mr. Speaker, how many more sisters have to be stolen before this government finally implements the 231 calls to justice of the National Inquiry into Murdered and Missing Indigenous Women and Girls?
The Honourable Minister.
Mr. Speaker, I'd like to thank the member for those comments, and I extend our deepest condolences to the family of the individual that the member had referenced. Our hearts are with the survivors and families of missing and murdered Indigenous women, girls, Two-Spirit, and gender diverse people. In response to the first ever national public inquiry on the ongoing national tragedy, our government is working with all provincial and territorial governments, as well as Indigenous leaders, survivors, families, to develop a national action plan that sets a clear roadmap to ensure that Indigenous women, girls, Two-Spirit, and gender diverse people are safe. Thank you, Mr. Speaker.
The Honourable Member for Mississauga, Erin Mills.
Mr. Speaker, this International Women's Day comes after a long year of combating COVID. Women have been at the forefront of the pandemic's impact. And as we move forward towards recovery, can the Parliamentary Secretary to the Minister of Women and Gender Equality update this House on how the recent launch of the Feminist Response and Recovery Fund would provide support to essential organizations working at the front lines to ensure the safety and security of women?
The Honourable Parliamentary Secretary.
Thank you, Mr. Speaker, and I want to thank my colleague for advocacy and hard work on women's issues. Canada's recovery from this pandemic depends on ensuring that Canadian women are working and safe. The $100 million Feminist Recovery and Response Fund will support local, regional, and national efforts to end violence against women and girls, improve their economic security, and to increase their participation in decision-making roles. Our government is investing in women's and equity-seeking organizations because it's one of the best ways to advance gender equality. We have a strong track record of supporting the women's movement, and we're continuing that support when they need it the most. Thank you, Mr. Speaker.
The Honourable Member for Calgary Skyview.
Mr. Speaker, in 2015, then Chief of the Defence, General Vance, launched Operation Honour with the mandate to address and eliminate sexual misconduct within the military. Now we learned that allegations of sexual misconduct against General Vance were brought to the ministers and Prime Minister's attention in 2018, and they actively chose to ignore it. Mr. Speaker, with today being International Women's Day, why should women place their trust in this Prime Minister when he deliberately ignores sexual misconduct within the military at the highest ranks?
Honourable Minister.
Mr. Speaker, as I've said, any allegations that were brought to our attention were always taken to the appropriate authorities who have absolutely no tolerance for this type of behavior. No elected official should ever be part of an investigation. In this very case here, after informing the former ombudsman, was contacted by the Privy Council the very next day so that an investigation could begin. There is no evidence that the ombudsman relayed the original information, despite repeated follow-ups by senior officials. Mr. Speaker, we take this very seriously. Our government has taken every steps to making sure that we create a greater opportunity for women. And in the Canadian Armed Forces, we need to create an inclusive environment for all women in the Canadian Armed Forces. Thank you.
Member for Calgary Skyview.
Mr. Speaker, in 2018, at the Status of Women's Committee, the minister said, quote, "Inappropriate sexual behavior of any kind is completely unacceptable and will not be tolerated in the Canadian Armed Forces," end quote. Now we know that those were just words and nothing more. It is clear that this Prime Minister likes to say he stands up for women, but when it actually comes down to standing up for women, this government frequently and consistently turns their back on women. Mr. Speaker, how many more women need to come forward before this Prime Minister takes sexual misconduct seriously?
Honourable Minister.
Mr. Speaker, we want all survivors to have the confidence to be able to come forward so they could be heard, so they can be protected, to making sure that their allegations can be investigated, Mr. Speaker. When it comes to actions of our government, Mr. Speaker, we will take no lessons from the previous government. Bill C-77, the Declaration of Victims' Rights, which actually died on the order paper by the previous government, Mr. Speaker, we passed it. Plus, we have SMRC currently right now provides 24/7 support to anyone and on these type of matters anywhere in the world. We will continue this work. We know that we have a lot more work to do, Mr. Speaker, but we will not stop rest until we have a zero tolerance gate. Thank you.
The Honourable Member for Calgary Nose Hill.
Today, Pfizer told Parliament that the original contract the Liberals signed with them had no vaccines scheduled to be delivered in Canada until sometime in 2021, even though other countries were receiving them in December of 2020. We also found out that it wasn't until late November and after the issue became a political hot potato that the Liberals went back to Pfizer to renegotiate. It appears the Liberals negotiated a position for Canada that had us at least 2 months behind other countries. Why?
Honourable Minister.
Mr. Speaker, is the opposition upset that our government was able to accelerate vaccine deliveries? We received doses sooner and were among the first countries to begin vaccinations in December. Next, will we hear that they are upset that we are receiving an additional 1.5 million doses in March, earlier than planned, to bring us to 8 million doses for this quarter? We'll keep bringing vaccines into this country for Canadians. Thank you, Mr. Speaker.
The Honourable Member for Calgary Nose Hill.
Well, Mr. Speaker, today Pfizer told Parliament that unlike other developed economies, the Liberals did not negotiate for December deliveries of vaccines in the original contracts. In fact, they didn't even bother to ask Pfizer for December deliveries until late November. This cost Canadian lives, jobs, and left our country more vulnerable to the spread of variants. Can the minister confirm what Pfizer said today, that the Liberals used tax dollars to pay a premium to get a photo op on a tarmac, only to be followed by months without the Pfizer vaccine?
Honourable Minister.
Mr. Speaker, I wish the honourable member a very happy International Women's Day, and I would also like to correct the record. In fact, Mr. Speaker, we were able to accelerate vaccine deliveries because of our strong relationship with Pfizer, and indeed it was because of that relationship that they have committed to another 1.5 million doses in March, and additional 3 million doses in Q2 to bring us up to 36.5 million doses for Canadians prior to the end of June, and 117.9 million doses prior to the end of September. Thank you, Mr. Speaker.
Honorable Député de Shefford.
The Honourable Member for Shefford. Mr. Speaker, seniors
are the most affected by the pandemic, but they are the ones who are least supported by the federal government. And it's even worse for women, who are the most likely to live in poverty after 65. That is why the Bloc Québécois is demanding a $110 per month increase in the old age pension for those 65 and older. Would they thought for our mothers and grandmothers? Does this government recognize that this pandemic is difficult for seniors, especially women? Will it increase the pension? The Honourable Minister.
My honourable colleague for the question. What the Bloc motion today fails to recognize is the full range of challenges that seniors face, and that we have been supporting seniors with direct financial support and enhanced programs. Our government recognizes the pressures on older seniors, and as seniors age, their financial security often decreases and their needs increase. That's why our government recognizes this need and will help address it by increasing old age security by 10% for seniors aged 75 and up. We've taken significant actions to support seniors, especially during the COVID-19, and we'll always stand with seniors.
Le député de Shefford.
The Honourable Member for Shefford. Mr. Speaker, we don't need to increase the pension only from 75 up. We need to do it from 65 and up. Now, from out of all Canadians, seniors had the longest and strictest lockdown. They are the most affected by price increases and the virus, of course. And they are the ones most affected by isolation, which affects their mental health, but which also speeds the cognitive decline of the most fragile seniors. During the election campaign, the government promised to increase the old age pension. Its promise to seniors was already not enough, but now it's been reduced to nothing. When will this government finally increase the pension as of 65?
Sure.
Mr. Speaker, many Canadians have faced significant challenges due to COVID-19, and to support seniors, our government issued special one-time payments for those who receive OAS, GIS, and the GST credit. Altogether, we provided over $1,500 for a low-income senior couple, all tax-free. We'll continue to support seniors and all Canadians during this pandemic. We remain committed to increasing old age security by 10% for seniors aged 75 and up.
The Honourable Member for Renfrew, Nipissing, Pembroke.
Mr. Speaker, in March of 2018, the military ombudsman met with the Defence Minister to confidentially advise him of an allegation made against the head of the Canadian military. The minister refused to look at the evidence and the meeting ended. The next day, the Prime Minister's department asked the ombudsman to divulge the details of the case. He refused to break his word and tendered his resignation. 3 years later, the matter became public, yet the minister feigned surprise. Who was the minister trying to protect, himself or the Prime Minister?
Honourable Minister.
Mr. Speaker, no elected official should ever be part of an investigation. And that is why I immediately informed PCO, who's in charge of Governor and Council appointments, to take up this matter. And they immediately contacted the Ombudsman, whose job it is to investigate allegations, Mr. Speaker. And I look forward to going to committee to testify there once again. Thank you.
Member for Kamloops, Thompson, Caribou.
Mr. Speaker, the Minister of Defence has been complicit in covering up allegations of sexual harassment against the former Chief of the Defence Staff. It is appalling that on International Women's Day 2021, our women in uniform are afraid to speak out against sexual misconduct and inappropriate behavior, all under the watch of our feminist Prime Minister. What happened to honor? What happened to ministerial accountability? Will this minister take responsibility and admit to participating in this cover-up?
Honourable Minister.
Mr. Speaker, as I stated, we have always taken every allegation seriously. No elected official should ever be part of an investigation. That is why immediately it was reported to the appropriate authorities, in this case here, Privy Council Office, who's in charge of Governor and Council appointments, so that they could follow up with the Ombudsman, whose job it is to look at allegations, Mr. Speaker. And that's exactly what it was done. And I look forward to testifying at committee at the earliest opportunity. Thank you.
The Honourable Member for Kelowna Lake Country.
Mr. Speaker, on the government's agenda for legislation in Parliament this week, we see their priorities include ensuring they can have an election and ensuring that convicted criminals have it easier. What is missing is the Canada-UK trade deal, ensuring free trade with one of our most important and largest trading partners. The government missed one deadline already, having to sign a temporary agreement. The next deadline is just weeks away. What's the plan? Or will we need to sign a temporary agreement?
The Honourable Minister.
Mr. Speaker, I want to thank the honourable member for that question. The Canada-UK continuity agreement, trade continuity agreement, very proud of it. We have worked with the United Kingdom so that we can provide that predictability for Canadian exporters and for Canadian businesses. That is what they get right now with the continuity agreement. I'm looking forward to working with my honourable colleague and all members on all sides of the House to make sure that this important agreement gets passed and continue to provide the tariff reduction rates and that continuity that our businesses so need at this time. Thank you.
L'honorable député de Châteauguay-Lacolle.
The honourable member for Châteauguay-Lacolle. Mr. Speaker, when we asked Canadians to stay home to limit the spread of COVID-19, we recognized that home is not a safe place for everyone. Today, as we celebrate International Women's Day, it's important to recognize that the struggle continues. Can the Parliamentary Secretary for Women and Gender Equality tell us how our government has supported victims and survivors of gender-based violence during COVID-19, specifically in the province of Quebec? The Honourable Parliamentary Secretary. We have taken rapid measures to help women and children fleeing violence by providing up to $100 million to women's shelters and other organizations. In Quebec, we have provided more than $8 million for groups that provide shelters and other supports to women and victims of sexual assault. We have funded more than 200 Quebec organizations, like the Montreal Centre for the Victims of Sexual Assault and L'Auberge Madeleine. We want to end gender-based violence. Thank you, Mr. Speaker.
Lambton, Kent, Middlesex.
Mr. Speaker, the minister said that international farm workers arriving on flights would be exempt from hotel quarantine until March 15th. But now we're hearing from farmers from the Prairies and the Maritimes that the Liberal government is forcing workers to quarantine in Toronto hotels before proceeding to farms. Left hand, right hand, Mr. Speaker, as the largest number of farm workers are now set to arrive. Will the minister do the right thing and give certainty about getting workers straight to their farms without delay?
The Honourable Minister.
Mr. Speaker, I want to thank the provinces, territories, and indeed my ministerial colleagues for working so hard to ensure that we can ensure the arrival of temporary foreign workers to do their important work for Canadians in a safe manner. This is an all-hands-on-deck approach where we are making sure that temporary foreign workers have a safe place to quarantine, that they have supports from the provinces, territories, indeed the farmers, and of course the federal government will continue that hard work, Mr. Speaker.
Honourable Member for Carlton Trail, Eagle Creek.
Mr. Speaker, citizens across Canada, including constituents in my riding, have been writing me to express their horror at the Senate amendments to Bill C-7. Canadians affected with mental illness want hope, not death. Why is this government opening the door for their untimely death rather than providing legal protection and hope?
Honourable Minister.
Mr. Speaker, I want to thank the honourable member for her question. The Senate reviewed the bill. It did its homework, Mr. Speaker, by proposing very thoughtful amendments to the bill, and we have responded. Mr. Speaker, mental illness is a very serious illness. It is an illness. It needs to be treated as an illness. It was always going to be looked at in the second stage of the bill, Mr. Speaker, and we are going to continue to do that, but this time within the frame of the Senate amendment. Thank you.
The Honourable Member for Richmond Centre.
Mr. Speaker, today is International Women's Day.
a day we should be celebrating the achievements of women across Canada. Instead, we read headlines about women being the victims of sexual assault in government-mandated quarantine facilities. When will this government reverse its practice of turning a blind eye on sexual assault? And when will they take steps to protect our vulnerable women in government-sanctioned quarantine facilities?
Honourable Minister.
Mr. Speaker, every woman deserves to live a life free of violence and harassment. Our government takes these allegations very seriously. They are being fully investigated, Mr. Speaker, and we have put into place processes to ensure this doesn't happen again.
The Honourable Member for Cumberland Colchester.
Thank you, Mr. Speaker. Sorry, I couldn't find my mute button. Happy International Women's Day. From the beginning of COVID-19, our government has been doing everything we can to keep Canadians healthy, safe, and supported. However, many workers continue to face challenges in these uncertain times, particularly when they're laid off in the middle of a pandemic. Last week, I met with employees of Stanfield's garment factory here in Truro after they suddenly received layoff notices, and many of them are women who've worked there for decades. As their MP, I am very concerned. So could the Parliamentary Secretary for Employment, Workforce Development and Disability Inclusion please provide an update on our government's extension of EI benefits that will help hardworking Canadians like my constituents?
The Honourable Parliamentary Secretary.
Mr. Speaker, our government is committed to keeping Canadians safe and supported during the pandemic, and that's why we introduced Bill C-24, which extends the number of weeks available under EI regular benefits. With some workers beginning to exhaust their benefits in late March, this bill will ensure Canadians have the support that they need. We will be debating C-24 this afternoon, a straightforward bill all members have had since February 25th. I hope all parties recognize the allotted time for debate is sufficient and send this bill to committee for further study this week so we can get Canadians the support they need. Thank you, Mr. Speaker.
The Honourable Member for Edmonton Strathcona.
Humanity is facing one of the biggest ethical issues of our time, ensuring equitable distribution of vaccines everywhere in the world. If we don't get this right, 30% more people will die, Canadians will be exposed to more dangerous variants, and our global economic recovery will be delayed by years. And now, when the world needs Canada to step up and support waiving intellectual property rights so that poor countries can access vaccines, the Liberals have sided with Big Pharma once again. Will this government vote to waive IP rules this week?
The Honourable Minister.
Thank you, Mr. Speaker. As the Honourable Member mentioned, equitable access to vaccines is a top priority for our government. And in fact, I'm really pleased to note that COVAX over the past couple of weeks has delivered millions of vaccines to dozens of countries in the developing world. It is a good news story that vaccines are being distributed right around the world. When it comes to intellectual property, Mr. Speaker, we have been very open to this conversation and have been open to hearing from the proponents of this proposal since the very beginning. Thank you, Mr. Speaker.
Honourable Member for Saanich Gulf Islands.
Thank you, Mr. Speaker. Terrible news. Another Indigenous person has been killed in the course of a wellness check. Another member of the Clayoquot Nation, the same nation to which Chantal Moore belonged when she was killed by the Edmundston, New Brunswick police. The killing over the last weekend in February was on Mears Island, on the traditional territory of the Indigenous people of the Clayoquot Nation. That nation issued a statement pointing out so tragically that there have been more members killed in wellness checks by police and RCMP than have died from COVID. When will the minister take responsibility? When will this government call an inquiry and end the threat that wellness checks propose to Canadians, Indigenous and non?
Honourable Minister.
Thank you very much, Mr. Speaker, and I share the members' sadness and concern about this tragedy. And our thoughts are with the community. But, Mr. Speaker, in situations such as this, it is absolutely essential that there be a timely, transparent, and independent investigation in order to provide answers to the many difficult questions that the people of that community quite rightfully have. We welcome and support the appointment of an Indigenous civilian monitor for the first time to help oversee that investigation, and he will have full access to the investigation. We'll continue to monitor this situation, and we're working with the RCMP and police right across the country to find a better response to these tragic situations and to help keep people safe.
And that's all the time we have. C'est tout le temps que nous avons pour la période de questions aujourd'hui. It being 3:07, pursuant to order made on Monday, January 25th, 2021, the House will now proceed to the taking of deferred recorded division on the motion of Ms. Larouche relating to business of supply. Convoquez les députés.
Call in the members.
Is it too late? Order. À l'ordre. On Thursday, February 25th, 2021, the House leaders of the recognized parties informed me that they were satisfied that the new electronic voting system is ready to be used. Accordingly, I would like to take this opportunity to share some information on the new process for taking of recorded division that members may find useful. Voting is one of the most fundamental rights of a member of Parliament. The ability of members to participate fully in this process is of the utmost importance. This first hybrid vote using the electronic voting system marks another adaptation of our normal practices and procedures in response to the COVID-19 pandemic. Comme le prévoit l'ordre spécial,
as per the terms of the special order, votes will continue to take place as per the usual process for those in the chamber. Members present in the House must stay in their seat for the duration of the voting period and should not vote via the electronic system.
For members participating remotely, the new process will be as follows. Members will receive notifications informing them of the upcoming vote. Once the vote starts, they will have 10 minutes to cast a vote via the electronic system, indicating whether they are for, against, or abstain from voting on the motion. Members will then be required to take a photo to validate their identity and submit their vote. Members may change their vote during the 10-minute period, but all attempts must be completed before the end of the voting period for the vote to be recorded. Lorsque le vote en personne
After the in-person vote is completed, members may continue to vote via the electronic system for the remainder of the voting period. During this time, votes cast via the system will be displayed on the broadcast feed, and no points of order or interventions are permitted during this period.
Lorsque la Chambre prendra,
when the House resumes its business, I will invite any members who encountered technical difficulties to identify themselves using the raised hand feature to cast their vote.
Il désire voter. In accordance with the motion adopted on February 22nd, 2021, I will then entertain any concerns raised by the House officer of a recognized party regarding the visual identity of a member voting remotely where a possible issue has been indicated by the system. It is the responsibility of members to be ready to respond should concern be raised about their photo, failing which, as per the terms of the motion, the vote will not be recorded. Once these steps are completed, the table will then compile the results of the vote, and the clerk will announce the final results to the House. IT ambassadors are available before, during, and after a vote to assist members if they encounter difficulties with the system or indeed for any technical matter related to the virtual sitting. It remains the responsibility of members to ensure that they have adequate connectivity to fully participate in the parliamentary proceedings and that they fully complete all steps of the voting process. Enfin, le decorum.
Finally, decorum remains an important part of any sitting of the House, whether members are participating in person or virtually. I would ask that members continue to demonstrate respect for the dignity of the House when participating or intervening in proceedings, including being judicious in the backgrounds they choose and their attire.
I would like to thank members for their participation in the simulation and their feedback regarding the electronic voting system. As we continue to learn and adapt to the constraints of the COVID-19 pandemic, I am continually impressed by the innovation, creativity, and resilience of members and their staff, as well as the administration employees who support us as we serve our constituents through this difficult period. We will now proceed to taking a first recorded division using the new electronic voting system. La question est la suivante.
The question is the following one. Ms. LaRouche, seconded by Ms. Chabot, moved that the House A recognize that the elderly were most directly affected by the COVID-19 pandemic. B, recall that too many of the elderly live in a financially precarious situation. C, acknowledge the collective debt we owe to those who built Quebec and Canada. And D, ask the government in the next budget to increase the old age security benefit by $110 a month for those aged 65 and over.
The 10-minute period for members voting electronically has started, and the House will now proceed to the vote for members participating in person. All those in favor of the motion will please rise.
Madame de Bellefeuille.
Madame de Bellefeuille.
Madame Larouche.
Madame Larouche.
Madame Normandin.
Madame Normandin.
Madame Chabot.
Madame Chabot.
Madame Gaudreau.
Madame Gaudreau.
Madame Gill.
Madame Gill.
Monsieur Deltel.
Monsieur Deltel.
Mr. Viss.
Mr. Viss.
Mrs. Block.
Mrs. Block.
Mrs. Stubbs.
Mrs. Stubbs.
Mrs. Gallant.
Mrs. Gallant.
Mr. Richards.
Mr. Richards.
Ms. Alislev.
Ms. Alislev.
Mr. Massey.
Mr. Massey.
Ms. Matheson.
Ms. Matheson.
All those opposed to the motion will please rise.
Ms. McKenna.
Ms. McKenna.
Ms. Vandenbeld.
Ms. Vandenbeld.
Mr. Garrettson.
Mr. Garrettson.
Mrs. McCrimmon.
Mrs. McCrimmon.
Monsieur Seri.
Monsieur Serré.
Monsieur Lefebvre.
Monsieur Lefebvre.
Madame Mendez.
Madame Mendez.
La Chambre attendra maintenant.
The House will now wait for the voting period to end before resuming its proceedings.
I wish to inform the House that the voting period has ended. Si des députés n'ont pas
If members were not able to vote because of technical issues, they can now activate the raised hand function and the speaker will recognize them.
This is Ms. Jordan.
Thank you, Mr. Speaker. Mr. Speaker, I just wanted to make sure that my vote was registered. I did get an email, but I also got a note that said I may have to log in and register my vote.
No, it's very good. It was flagged, but it was counted as voted. So thank you for bringing that up.
Thank you.
Mr. Baker.
Thank you, Mr. Speaker. For technical reasons, I tried to vote on the app, but it wouldn't register my vote, and so I wanted to register my vote as nay.
Very good.
Mr. Baker, nay, contre.
Monsieur Lauzon.
Oui, merci, Monsieur le Président.
Thank you very much, Mr. Speaker. For the same reason, I will vote against. No.
Okay, very good.
We're just checking.
Okay. Very good. If a House officer of a recognized party wishes to bring any concerns to the attention of the chair regarding the visual identity of members in relation to the vote, they may do so now.
Mr. Speaker, point of order.
Is it a technical matter?
Yes.
Okay, we'll give it a, okay, the honourable member for Ms. May.
Thank you. I may not be the only one who was unable to hear the announced results of the vote from the table officer. So I think that's part of our rules. We should all hear that.
Yeah, just to clarify for everyone, as long as you can read it on your system, the voting system, you should be able to vote.
She's waiting for the results of the vote.
Oh, I'm waiting for the. I want to ask the honourable member. Is she waiting for the results?
Yes, I heard them. Rather, we'd say sotto voce. The microphone wasn't on when the table officer read out the results of the vote.
Oh, haven't read them out yet. That's probably a good reason for it. Okay. And now here's my cue. The table will now compile the results of the vote.
Yeas pour 183, 183. Nays contre 147, 147.
Je déclare la motion.
I declare the motion carried.
Conformément à l'ordre.
Pursuant to order adopted Monday, January 25th, 2021, the House will now proceed to a deferred recorded division on the motion at the second stage of reading of Bill C-14. The question is as follows.
By Ms. Bibeau. Moved that Bill C-14, an act to implement certain provisions of the economic statement tabled in Parliament on November 30th, 2020, and other measures be now read a second time and referred to the Standing Committee on Finance. The 10-minute period for members voting electronically has started, and the House will now proceed to vote for members participating in person.
All those in favor of the motion will please rise.
Ms. McKenna.
Ms. McKenna.
Ms. Vandenveld.
Ms. Vandenveld.
Mr. Garrettson.
Mr. Garrettson.
Mrs. McCrimmon.
Mrs. McCrimmon.
Monsieur Seri.
Monsieur Seri.
Monsieur Lefebvre.
Monsieur Lefebvre.
Madame Mendez.
Madame Mendez.
Madame de Bellefeuille.
Madame de Bellefeuille.
Madame Larouche.
Madame Larouche.
Madame Normandin.
Madame Normandin.
Madame Chabot.
Madame Chabot.
Madame Gaudreau.
Madame Gaudreau.
Madame Gill.
Madame Gill.
Ms. Matheson.
Ms. Matheson.
Mr. Massey.
Mr. Massey.
All those opposed to the motion will please rise.
Monsieur Deltel.
Monsieur Deltel.
Mr. Viss.
Mr. Viss.
Mrs. Block.
Mrs. Block.
Mrs. Stubbs.
Mrs. Stubbs.
Mrs. Gallant.
Mrs. Gallant.
Mr. Richards.
Mr. Richards.
Ms. Alislev.
Ms. Alislev.
La Chambre attendra mes...
The House will now wait for the voting period to end before resuming its proceedings.
Je désire informer la...
I would like to inform the House that the voting period has ended.
Not able to vote due to technical difficulties, they may now use the raised hand function, and the chair will recognize them. Si un agent...
If a House officer of a recognized party wishes to bring any concerns to the attention of the chair regarding the visual identity of a member in relation to the vote, they may do so now.
Sir. The table will now compile the results of the vote.
Yeas pour 214, 214. Nays contre 119, 119.
I declare the motion carried.
Second reading of this bill, deuxième lecture de ce projet de loi.
Accordingly, the bill stands referred to the Standing Committee on Finance. I'm just going to go through this and then go to... in the past year, the employees of the House of Commons administration helped set the stage so that members of Parliament could meet a challenge like no other, continuing their work during the global pandemic. Thanks to the talents and dedication of the men and women across the entire organization, the House has been able to conduct its business on behalf of Canadians, even if we cannot be together in person for the time being. I'm very proud of this. Today, the first... Yeah, they all deserve a good round of applause. Today, for the first time, members were able to either vote in person or submit their vote through the electronic voting system. This solution offers the House another secure and reliable way to conduct its business over the next few months, despite the constraints of the pandemic. Au cours des derniers mois,
over the last months, the House of Commons showed that it was able to adapt to the temporary constraints imposed by the pandemic. And one day soon, I hope, we will all be able to get together again in person in this chamber to continue our work on behalf of our fellow citizens.
To express my profound gratitude to the employees of the House administration. They have worked and continue to work tirelessly to ensure that ourselves can work for our constituents. We could not have done this without them. Merci. Thank you. We have a point of order. The Honourable Government Whip.
Thank you very much, Mr. Speaker. Mr. Speaker, I just want to take a moment with your indulgence to extend on behalf of, I believe, all members of Parliament and indeed all Canadians, a massive thank you to House administration. What we just saw in that last vote was not a single technical error, an absolute flawless execution of an incredibly difficult task. And we were able to watch for months as House administration not only helped us in this incredible change, but deal with the adaptations as a result of COVID across the board. We are deeply in their debt, Mr. Speaker. And we are every day in all the ways that they serve us. I also want to take this opportunity quickly to thank the members of the Procedure and House Affairs Committee for their extraordinary work in getting to this point. And lastly, I want to thank my colleagues, the whips for both the Bloc, the Conservatives, and the New Democrats, who were extraordinary to work with through this. This was all able to be achieved through unanimous consent, which is no small thing. Thank you, Mr. Speaker.
The Honourable Member for Hull-Aylmer is rising on a point of order.
Yes, thank you, Mr. Speaker, and I apologize to you and to colleagues for not raising this immediately after the House, but I failed to get your attention, and I did not want to interrupt the votes. I'd like to raise a point of order following question period. It had to do...
Order. If I can ask the Honourable Member to maybe just put his... yes, there we go. It's very distant, and we can barely make him out.
My apologies.
There we go.
Speaker, I hope that is better. So it has to do with a point of order arising from question period, Mr. Speaker, which you yourself actually had risen to remind members of the importance of using parliamentary language. There was some unparliamentary language used by the member for Lakeland. I know, and I've sat in this House with this member who is a vigorous debater, but an honorable member, and I'm sure I'd like to offer an opportunity to withdraw the unparliamentary word, and for all members, again, to heed your advice to stay well within the bounds of acceptable language in the House.
The honourable member is not in a position to respond at this time. Maybe what we'll do is we'll wait if she wants to respond later. But again, I want to remind the honourable members that we can debate ideas, but we don't want to call names of one side or the other. The honourable member for Sarnia-Lambton has a point of order.
Thank you, Mr. Speaker. I'm just writing on a point of order with respect to the vote. The voting application showed that I was on the vote, ready to vote for C14, and I would have voted against, but it did not give me any opportunity to vote at all. And I see that the vote has been counted, so I would just ask you to investigate that for future.
Okay, I want to thank the honourable member for pointing that out. We're just checking it out to see exactly what happened. Okay, I want to thank the honourable member for bringing that up. We will look into it on a technical basis to find out exactly what happened. I want to remind all members, if that does come up, please raise their hand and make sure that their vote is counted. I want to thank the honourable member for Sarnia-Lambton for bringing that up. The honourable member for Richmond Centre has a point of order.
Thank you very much, Mr. Speaker. All of us, probably including them, in those in the public, heard someone on the government side who forgot to unmute himself and then was heard swearing. That is not parliamentary, whether you are in the House or even in the public. So I want to draw your attention to that. That person should really apologize.
I didn't hear it, but if the honourable member who realizes that they used unparliamentary language while their microphone was off, did they want to apologize? Although the honourable member, can the honourable member for Richmond Centre identify who it was?
No, I couldn't.
Okay, I'll leave it to the honour of the member, whichever side they're on. Okay. Okay, I want to thank the honourable member for bringing that up. Now we'll continue to the daily routine of business. Tabling of documents. Dépôt de projet de loi émanant du gouvernement.
Introduction of government bills.
Statements by ministers. The Honourable Minister of Women and Gender Equality and Minister of Rural Economic Development.
Hello, Mr. Speaker. Bonjour, Anin, salam alaikum, et bonne journée internationale des femmes.
Happy International Women's Day.
To my honorable colleagues and to every woman in this great country. I'd like to begin my remarks with some gratitude, Mr. Speaker. I'll speak about where we are at with respect to the status of women and put forward an invitation for my colleagues in wrapping up. This day provides us all an opportunity to be grateful and to give thanks to those who've come before us, who've paved the way for the rest of us, who fought the fights that we cannot imagine and who were much lonelier than we could ever comprehend in those fights. Those who never gave up, those who persisted, and also those who believed in each and every single one of us. Mr. Speaker,
the Senate of Canada is close to gender balance. For the first time ever, there are 100 strong women in the House of Commons, and each of us got here because someone or many believed in us. Today, we thank them. I'd like to thank our teams, including my own, and to the great women and feminists in my own family. This year, though, Mr. Speaker, we owe great thanks to the women on the front lines of the fight against COVID. The essential workers, healthcare workers, personal support workers, nurses, technicians, administrators, cleaning staff, teachers, childcare workers, charitable sector workers, including those working to support those fleeing violence and abuse. To the moms who've had to take on many extra responsibilities, the sisters, aunties, and grandmothers who are struggling and helping to keep it all together for others, to community leaders and women in politics in all orders of government, we thank you, we appreciate you, you are holding it all together for all of us. I also think it's important on a day like today to acknowledge the women for whom the mere act of survival is a heroic act. The woman stuck in an abusive relationship right now, doing everything she can to keep her kids safe and looking for a way out. The women living with mental health challenges or caring for those who are struggling. Those women, we see you, we hear you, and we will do everything we can to support you. There are also great women who are not here with us this International Women's Day. Great women we all grieve, but have not had a chance to come together collectively and to remember. Women like Sister Ruth Hennessy in Peterborough, Kawartha. Women like my own grandmother. And mothers who've lost their battle to cancer and now leave behind young ones. We see you, we remember you, and our job is to do everything we can to make the world a better place for your daughters and granddaughters. Mr. Speaker, it is well documented that women have been hit hardest by COVID, with jobs lost, unpaid care responsibilities increases in gender-based violence, and of course, on the front lines of the fight against the pandemic. And Mr. Speaker, the path ahead will be a difficult one. The path ahead will require all of us to work together in solidarity like never before. But I am hopeful and optimistic about the status of women in Canada. First and foremost, because we are counting women in ways we've never done so before. Disaggregated gender data. Canada has the best intersectional feminist response of its COVID measures. We also have a gendered budget. There are more women at the table now than ever before. A national housing strategy exists, and because of it, when we told Canadians to stay home, 1 million families had a safe and affordable roof over their heads. Because of the child benefit, child poverty rate was cut by 40% before the pandemic, and we were able to provide additional supports to families when they needed it most during the pandemic. 40,000 childcare spaces were created in our first mandate, and we are looking forward to building a childcare system that is universal and worthy of our children and our parents. Mr. Speaker, this Women's Day, we also have an opportunity to benefit from the $100 million Feminist Response and Recovery Fund. That money is available for partners who want to make sure women are safe and healthy and improve their workforce participation. As we speak, Mr. Speaker, and over to tomorrow, the largest feminist gathering virtually that we know of, this Women's Day is happening. The Government of Canada is hosting it. And this Feminist Response and Recovery Summit is meant to be the beginning of many conversations to ensure women's voices are shaping their futures. The Finance Minister and the Associate Finance Minister have announced their action task force on women's economic participation. As well, our Economic and Innovation and Science Minister has also announced that 1,000 companies have signed up to our 50-30 challenge to ensure greater diversity in our corporate boards. We are currently seeking calls for nominations of women of impact in communities across the country. I encourage Canadians to nominate women they believe in. We have a response coming forward on missing and murdered Indigenous women and girls, and we are working to implement our anti-racism strategy. La COVID-19 est la plus grande.
COVID-19 is the most serious health crisis we have ever experienced. There is no doubt that COVID has had a disproportionate impact on those who are already vulnerable. Women have lost hope. Many of the frontline workers in this crisis were women who helped our communities, and these women carried the burden of care and also unpaid care at home. And on this International Women's Day, we recognized women who are on the front lines fighting COVID-19. We recognize all the ways which women, and in particular racialized women, have been hit hardest by the pandemic. We invite the Safe Restart program of $100 million to help these women, and our government will continue to work with determined feminists to create 1 million new jobs and to improve the health and safety of all women.
There has never been a more important time for our country to come together in a Team Canada approach. Our daughters are counting on us. My nieces, little Layla taught me my French because my own tutor has her own care responsibilities at home. They're looking to us. And I urge all my honorable colleagues to work together and to seize the opportunities that have come with the social reckonings upon us, to work together to ensure that we close the gender wage gap, to ensure that our women are safe in every workplace, and to ensure that vaccine rollout is done equitably, and so that someday we can hold our loved ones close again and tell the stories of how an unprecedented pandemic actually allowed us to build back better. Merci.
Thank you.
For Calgary Skyview.
Thank you, Mr. Speaker. I'm honored to rise in the House today to mark International Women's Day. Women's Day was first celebrated in 1911, and in 1975, the United Nations passed a resolution declaring March 8th as International Women's Day. This day is a day when we reflect on the progress we have made towards women equality, both here in Canada and around the world. Mr. Speaker, just a few months ago, we were recognizing the 50th anniversary of the Royal Commission on the Status of Women. We discussed how vital this report was at highlighting many of the inequalities that women were still facing in society and how the government responded to them. However, as I said in my speech, working towards equality in Canada is never done, and how we need to continue to build on what has been done and work towards building a better future for the women yet to come. Mr. Speaker, as a female member of Parliament in the Conservative Party of Canada, I'm proud of our continued advocacy and our long history of supporting women across our country. Not only was it under a Conservative government that a woman's right to vote was recognized, but women play a vital and leading role in our party today. However, I've been disheartened by the continued lack of action by the Liberal government. Mr. Speaker, this Liberal government says they stand up for women. They want to eliminate gender disparity and end violence against women. Yet these sentiments appear to be nothing more than just words from this government. The Liberal Party added to their platform they would develop and release a national action plan to combat gender-based violence, yet nothing. Mr. Speaker, 1 in 3 women and girls in Canada will face some sort of gender-based violence in their lifetime. And with the ongoing pandemic, a detrimental effect of COVID, and the restrictions that have largely confined us to our homes over the past year has resulted in women who are in abusive relationships being stuck in their homes with their abusers. This was heartbreaking to hear about and concerning that women continue to face this sort of degrading and brutalizing crime, both mentally and physically. No person should be ever subjected to that sort of treatment. Mr. Speaker, as the Conservative Shadow Minister for Women and Gender Equality, I want to help contribute to the discussion about gender-based violence and work with my caucus towards developing policies that we can use to help eradicate gender-based violence in Canada. This is why, for the past several months, I have been meeting with organizations and individuals across Canada who work with and help individuals escape this abusive life. Mr. Speaker, the pandemic has also highlighted many of the inequalities that still exist in our society today. At the Status of Women's Committee, we've been hearing from witnesses that women disproportionately represent the number of people unemployed, not only because they worked predominantly in the industries that have been hit the hardest, such as the retail and the hospitality industry, but also because with children staying home from school or elderly parents who were at high risk of catching COVID, many women left the workforce to take on the role of at-home caregiver. While people have started going back into the workforce, many women have chosen to remain at home. We heard from many witnesses how this is a concerning trend because women play a vital and very important role in our economy, and the risk of women not returning to the workforce can set women advancements back decades. One of the advancements at risk is pay equity, an issue that was a major pillar in the first International Women's Day and in the Royal Commission. Just the other day, the Status of Women Committee was reviewing the implementation of the Pay Equity Act and had the Minister of Labour appear before committee. My Conservative colleagues and I were consistently asking the Minister why it has taken so long to implement and pointed to the fact that it was their own legislation, which the PVO even confirmed could have been implemented faster. Mr. Speaker, the only response from the Minister of Labour on why it has been taking over 3 years, with a minimum of another 3 years to fully implement, was to quote, "not rush it." Taking over 3 years to implement isn't rushing, it's delaying. Mr. Speaker, this government and Prime Minister likes to say they stand up for women, but when it comes to actually standing up for and representing women, this government frequently and consistently turns their back on women. Mr. Speaker, today on International Women's Day and every day, Canada's Conservatives will continue to call on the Liberal government to take real, meaningful action to support women across Canada as we focus on securing our future. And I know that under a Conservative government led by the member for Durham, Canadian women will not only be well represented, but heard by us and see real action on the issues that matter the most. Happy International Women's Day to all the women in Canada and across the world. Thank you, Mr. Speaker.
The Honourable Member for Shefford. Thank you, Mr. Speaker. A year ago, in turn, we stood in the House to mark March 8th. It was a March 8th, like any other, when, one by one in turn, our political parties praised the work of women and the advances in their struggles. A March 8th, like any other, where all parties play feminist. 1 year later, everything has obviously changed for Canada, for Quebec, and for the whole world, for men and for women, especially for women, Mr. Speaker. There is a real risk of losing some of the gains that have been hard-won over the past 25 years. Coronavirus has affected women's lives more than anyone else's. And in the past year, since this pandemic struck, women have given and taken more than their fair share. What have women given? They've given care to our seniors in long-term care. They've given care in our hospitals, on the front lines, with the enemy right beside them every day on the front lines. 82% of healthcare workers are women. They are the ones we've been able to count on and who we continue to count on because the vaccine won't give itself. It is women who still are leading this fight. They've given of their time. Work-life balance has become telework-life balance. And who's taking care of the kids at home during lockdown? Women's invisible work and overtime has only grown. They have given and they have taken, and they've taken lower and lower salaries than men. There's still no effective pay equity for workers under federal jurisdiction. If they are seniors, these women have received an old age benefit increase, a one-time payment to deal with the increased cost of groceries and delivery. The young person who delivers groceries wants a tip, and seniors want to give them a tip. And what women have received exceptionally this year, what they've taken, Mr. Speaker, is slaps across the face, insults, and so on. There's been a 40% increase in domestic violence. 40%. That's indexation for you. That's our way of thanking women this year. Violence like we've rarely seen. There's no way out. Cooped up with the one holding the belt, clenching the fist, and raising their voice. Women have definitely taken this year more than they usually do. So for everything women have given, they deserve to be thanked. And for all they've taken, they deserve an apology from us and action from us. They deserve us to do something now. They deserve an increase in health transfers because they're the ones on the front lines. They're the ones doing the overtime. They're the ones who are underpaid. Senior women deserve decent living conditions with purchasing power that allows them to make ends meet by the end of the month, to stop having to choose between toilet paper and paper towels. Seniors deserve a good life. That's not too much to ask. Women's shelters have done such a great, crucial job. They deserve better support. Violence will not stop on the last day of the vaccine. Shelters need support. They need predictability over the long run. Unemployed women deserve a plan that addresses their needs. Unemployed women who are sick deserve health insurance that lasts more than 15 weeks. So they have time to heal and recover with some peace of mind. Mr. Speaker, women deserve more than an apology and a thank you. They deserve a recovery that is truly feminist. We won't recover from this pandemic without women, without their leadership. Everyone knows that. But I refuse to return to the normalcy of the past if it means starting to live in a society where women are second-class citizens, paid less, with programs that are not designed for them and do not take their situations into account. We can make March 8th as different from today's as today's is from last year. To do this, we have to listen to women, so let's listen to women. Thank you, Mr. Speaker.
The Honourable Member for London Fanshawe.
Mr. Speaker, I want to also wish all women a happy International Women's Day. In particular, I salute all my female colleagues who were elected to this chamber since 2019 and in the years prior who helped break down barriers for us all. Of course, it goes without saying that we need more women in this House. Last Friday, I had the opportunity to address the delegates of Daughters of the Vote. That program brings young women from all over the country to fill every seat in this House. And although this year they had to complete this program virtually, there were 338 representatives that filled those seats. 338 incredible women excited about politics, excited to make change, to improve the lives of all women in Canada. I spoke to some of the daughters before, and they told me that they want to eradicate barriers to women's full economic, social, and political participation in society by fully enacting pay equity, creating an affordable national universal childcare program, building an adequate amount of safe, affordable housing, addressing violence against women and rejecting all restriction on women's reproductive rights, improving the lives of Indigenous women and girls by enacting all of the calls for justice, and addressing the specific challenges faced by women of color, members from the LGBTQI2S+ and disability community. Make no mistake, these barriers are real and significant. We cannot accept virtue signaling while doing little to break down those barriers. A piecemeal approach is no longer acceptable. Less than a third of MPs in this chamber in 2021 are women. And frankly, the number of women of color, members from the LGBTQI2S+ and the disability community is embarrassingly low. That's why it is so important in my role as the NDP critic for women and gender equality, but also as an MP, to share with young women what it is to have this job. To be frank about the hurdles, to be supportive, and to be there to answer those all-important questions. The only way that we will have more women fill these seats in this House, to ensure women have a real opportunity to join us here, is to support and encourage all women mentally, emotionally, and especially financially. As part of that support, and a part that I love, a part of that support is to talk to women interested in government from all different groups, all different backgrounds and ages. And last week, I got to speak to 9-year-old Sophia. I went to university with her mother far too many years ago. But when Sophia, she started to learn about politics at school, and she wanted to do more research on her own. So she and her mother went online, and that's when her mother realized I was elected. So her mom reached out to tell me about Sophia, and then I got to speak to her, and I was thrilled to do so. At first, Sophia's questions were very familiar. They were ones that I receive often. These include questions like, what got you involved in politics? How do you become an MP? What do you most like about the job? We talked about that job of being an MP, the hard days, the good days, the successes and the losses. Then Sophia asked me, do you get nervous when people disagree with you? Because I do. And I said sometimes, especially when I was younger. But the more that I do this job, and the more people I help, the more I know that the work I do is meaningful, and the less nervous I get. But I also take comfort in the fact that I'm not alone, that I have incredible colleagues that share my ideals, my beliefs, that stand with me. And equally important, I'm not alone because I stand on the shoulders of giants, women who have fought for the chance to speak, to be heard, or have influence. They have fought for their grandmothers, mothers, aunts, sisters, and daughters to have a fair chance. I told Sophia that standing up for what you believe in isn't always easy. Political courage isn't easy, especially when some people aren't respectful or kind or open-minded. And often women are put down more when they stand up simply because they are women. Even more if they're women of color, lesbian women, transgendered women, Indigenous women, women living with disabilities. Women are silenced. But I told Sophia that one of the many things I love about my job is that I'm there to fight for her to be heard. And in turn, in the future, she will have to fight for other women to be heard. I, as a woman, must be well-researched, thoroughly researched, and I have to be absolute about the proof to support what I believe in. I have to be better, stronger, louder, more just. But when I know I'm right, I have to stand up. especially as a woman. Sophia took a little time to process that. And then she asked, why don't women have the same opportunities as men? Why is progress so slow? And I said, change is slow because too often those in positions of power have shied away from making those hard choices, or they genuinely believe that they weren't the right choices at the time. Again, that's where having proof, researching your ideas, listening to all sides, and remaining open-minded must always be at the center of your choices. We talked about supports that can make life better for women, about choices made by those in power that could give women the same opportunities as men. We talked about universal affordable childcare. We talked about pay equity, about violence against women, affordable housing, clean drinking water, justice for Indigenous people. We talked about the importance for women to have choice, to have true choice, to have access to all the services, to be able to have that power of choice. Sophia's final question was, how can I help to make change? So I knew that Sophia was hooked, and I am so excited to see what she will do as she grows up. Sophia will help to make that progress that we are too slow to make now. Whether the change she makes is at her school, with her friends and family, in her community, in an environmental group, or a political group, I know she will make change. And when she sees more women in the House of Commons, voicing the concerns of women, fighting for equality, fighting for universal childcare, for affordable housing, for pay equity, when she sees more women being able to stand up and speak their truth, to have the courage to make those tough choices, and when she sees how they succeed, I believe she won't be nervous when she's challenged. She will stand up, she will use her voice, and she'll succeed because she will not be alone. Thank you, Madam Speaker.
The honourable member for Fredericton has a point of order.
Yes, Madam Speaker, I'm seeking unanimous consent to be able to reply to the minister's statement.
Does the honourable member have unanimous consent to reply? Yes, and so ordered and carried. And the honourable member for Fredericton.
Thank you, Madam Speaker. It is always an honour for me to be able to speak in the House of Commons. The magnitude of this reality is not lost on me, especially today. On International Women's Day, a day where we celebrate and advocate for women's rights across the world, I wish I could simply deliver pleasantries, highlight the work of some incredible women, and wish all present a happy International Women's Day. But based on the real experiences of women across this country and across the globe, that would not be enough. I'd like to begin by exploring some of the history of the women's rights movement, rooted in struggle and conflict, intertwined with colonialism and racism. Before the suffragettes, colonists arrived in North America and deliberately tore apart the fabric of the matriarchal leadership of the first peoples of this land. The intergenerational trauma of these acts continues to ripple through Indigenous communities today. International Women's Day itself can be traced back to 1908, when thousands of working women in New York City marched to protest their working conditions. These women worked at low wages with no protection and regularly experienced sexual harassment and abuse. This uprising continued for more than a year, leading to National Women's Day in the US in 1909. At the International Conference of Working Women in 1910, the idea for an international movement advocating universal suffrage was born. The day took on a truly revolutionary form in Russia in 1917, in a country exhausted by war, widespread food shortages, and escalating popular protests. Russian women demanded and gained the right to vote in 1917 as a direct consequence of the March protests. Suffragettes in the UK and their counterparts in the US and Canada looked to Russia as an example. White women in Canada were enfranchised in 1918, but this right would not extend to many women of color or Indigenous women until decades later. We have yet to fully embrace the layers of intersectionality in feminism and tear down the many ways women continue to be oppressed. The pandemic has plainly demonstrated how race, gender, class, disability, and immigration status intersect and compound risk, resulting in worse health outcomes, increased rates of domestic violence, and greater economic struggle. International Women's Day remains steeped in the fight for women's rights, all women's rights. I think about the women facing violence in their homes, Madam Speaker, I addressed this House regarding gender-based violence on February 25th. That same day, a woman from my home province was murdered by her intimate partner. In Quebec, 5 women were killed by their partners in just 1 month. The government has put money into supporting shelters and services for women fleeing domestic violence, but Madam Speaker, it's not enough. I think about the survivors of sexual assault being re-traumatized and stigmatized again and again by a court system that was designed to protect property. Bill C-3 will finally require judges to receive sensitivity training on sexual assault, which is a step forward. But our judicial system is so deeply flawed. This is not enough. I think of Chantal Moore, of Joyce Etchikhan. These women's final moments on earth were facing down racism and misogyny. Our policing and health systems let them down. We let them down. This government has initiated an anti-racism secretariat, but it seems to be operating quietly behind closed doors. This is not enough. I am discouraged by the failings of our systems, reinforced by almost every statistic, by almost every headline. I am discouraged that I hold this seat of power, and yet I often feel powerless to right what remains so very wrong. So I look to what brings me hope. I think of my sisters, my friends, the women I work with. Through their trauma, I see their strength. I see their resilience. This year, they have given birth without their loved ones present. They have loved and supported family members in a mental health crisis. They have taken in their adult children who could no longer support themselves financially. They have bravely served, overrepresented on the front lines of this pandemic. They have left abusive jobs. They have left abusive relationships. And they stand strong, but not unscathed. What I need from this government is leadership that sees their resilience and meets it with equal force. International Women's Day has always been as much about struggle and solidarity as it is about celebration. Today, for women across this country, the struggle is real. With some direct action, perhaps next year, we will have more to celebrate. Thank you, Madam Speaker.
Okay. I wish to inform the House that because of the deferred recorded divisions and ministerial statements, government orders will be extended by 61 minutes. Alors, conformément à la...
Pursuant to Standing Order 38, I'd like to recognize the questions that the House will mention at adjournment tonight.
Air transportation, l'honorable député.
The honourable member from Mégantic-L'Érable, Finance.
Honourable member for Leeds, Grenville, Thousand Islands, and Rideau Lakes, Telecommunications. Reports from interparliamentary delegations. Presenting reports from committees, the honourable member for Humber River, Black Creek.
Thank you very much, Madam Speaker, and happy International Women's Day. I have the honor to present in both official languages the 4th report of the Standing Committee on International Trade in relation to Bill C-18, an act to implement the Agreement on Trade Continuity between Canada and the United Kingdom of Great Britain and Northern Ireland. The committee has studied the bill and has decided to report the bill back to the House without amendments. Thank you, Madam Speaker.
Presenting reports from committees, l'honorable.
The honourable member for Bourassa. Thank you very much, Madam Speaker. I have the honour to table in both official languages the 3rd report of the Standing Committee on Official Languages with respect to the position adopted in March of this year with respect to support to educational institutions providing official language instruction. Thank you.
Introduction of private members' bills. First reading of Senate public bills. Motions. The honourable member for New Westminster, Burnaby.
Merci beaucoup, Madame la Présidente.
Thank you very much, Madam Speaker, and happy International Women's Day. There was a discussion amongst the parties, and if you seek it, I think you will have unanimous consent for the following motion, that notwithstanding any standing orders or special orders of the House, Bill C-5, the Interpretation Act, to amend the Canadian Labour Code, and be now deemed adopted at the report stage, and that the House continue to sit this evening beyond the daily adjournment to study Bill C5 at the third reading, when no more members will rise to speak, or on midnight of the same day, according to the first possibility that the Speaker interrupt deliberations and put to vote 2 questions to dispose of this at report stage. And if there is a recorded vote requested, that it be deferred until the end of the question period tomorrow, March 9th, 2021, and that the House adjourn its work until the next sitting day.
All those opposed to the honourable member moving the motion will please say nay. The House has heard the terms of the motion. All those opposed, so unfortunately the honourable member does not have unanimous consent. Therefore, the motion is rejected. Motions. Presenting petitions. The honourable member for Sherwood Park, Fort Saskatchewan.
Well, thank you, Madam Speaker. I have 5 petitions to present today. The first is, I think, particularly pertinent in light of it being International Women's Day. It draws the attention of the House to the horrific violence against Uyghur women that is taking place as part of the genocide happening in China as we speak. Members of the Canada Uyghur Parliamentary Friendship Group were, I think, particularly struck and moved last week to hear the story of a survivor. We know that this campaign of genocide includes forced abortion, forced sterilization, forced insertion of IUDs, and sexual violence. So petitioners are calling on the House and the government to recognize that Uyghurs in China have been and are being subject to genocide. It also calls for the use of the Justice for Victims of Corrupt Foreign Officials Act, or Magnitsky Act, to sanction those that are responsible for these heinous crimes. Madam Speaker, the second petition that I'm tabling is with respect to Bill C6. Petitioners want to express that they support efforts to ban conversion therapy. They are, however, concerned by the definition of conversion therapy that is used by this bill. They note that certain drafting problems in the bill, in fact, define as conversion therapy things which have never been called conversion therapy and don't align with any existing definition of it. Petitioners therefore call on the House to ban coercive, degrading practices that are designed to change a person's sexual orientation or gender identity, to amend Bill C6 to fix the definition of conversion therapy, thus banning conversion therapy without banning voluntary counseling or criminalizing conversations, and to allow parents to speak with their own children about sexuality and gender, and to set House rules about sex and relationships. The third petition is about the carbon tax, Madam Speaker. It highlights just the significant economic challenges that have been created and exacerbated by the government's decision to increase the carbon tax and to announce that increase in the middle of a pandemic. Petitioners therefore call on the government to repeal the decision to increase the federal carbon tax to $170 per ton, and to have the carbon tax shown as a separate expense when buying products, so that citizens are aware of exactly how much money they're paying at a given time in carbon tax. The fourth petition is about Bill S-204. It's in support of that Senate bill, which would make it a criminal offense for a person to go abroad and receive an organ in a case where there has not been consent. It seeks to combat the horrific practice of forced organ harvesting and trafficking, and also would create a provision whereby someone could be deemed inadmissible to Canada for their involvement in forced organ harvesting and trafficking. And Madam Speaker, my fifth and final petition raises significant concerns about Bill C7. It objects to how this bill removes a 10-day reflection period. Petitioners are also deeply concerned about the fact that the government is now trying to, through a Senate amendment, legalize suicide facilitation and euthanasia for those facing mental health challenges. And I'm sure they would want to highlight to the House that our focus should be on helping people with mental health challenges find recovery, not facilitating their deaths. I commend all 5 of these petitions, Madam Speaker, to the consideration of all members. Thank you.
Presenting petition, the honourable member for Mission Mashkee Fraser Canyon.
Thank you, Madam Speaker. Today I'm tabling 3 petitions. The first petition calls on the federal government to apply the Magnitsky Act sanctions on Chinese Communist Party officials who, for over 2 decades, have persecuted Falun Gong practitioners. The second petition I'm tabling today highlights the lack of legal restrictions on sex-selective abortions, a situation domestic healthcare professionals and international bodies like the UN recognize as discriminatory towards women and girls. The petitioners call upon the House of Commons to pass a criminal code prohibiting sex-selective abortion. And thirdly, I table over 8 individual petitions on the ongoing protests in the Punjab and Haryana regions of India. My constituents are concerned for the safety of Indian farmers, protesting changes affecting their livelihoods. They call on the federal government to condemn the use and reaffirm Canada's international support for the fundamental freedoms of expression and assembly. Without farmers, we don't have food, we don't have a future. Thank you, Madam Speaker.
Presenting petitions, the honourable member for Yorkton Melville.
Thank you, Madam Speaker. Thank you very much, Madam Speaker. The petition I'm presenting today is on behalf of individuals who are concerned about the legislation before the House, the bill before the House on C6 conversion therapy. They're concerned that conversion therapy has historically referred to coercive, degrading actions that seek to change a person's sexual orientation or gender identity, which are wrong and should be banned. However, Bill C6 defines conversion therapy as a practice, treatment, or service designed to change a person's sexual orientation to heterosexual, to change a person's gender identity or gender expression to cisgender, or to repress or reduce non-heterosexual attraction or sexual behavior or non-cisgender gender expression. This broad definition, they indicate, wrongly applies the label conversion therapy to a broad range of practices, including counsel from parents, teachers, and counselors encouraging children to reduce sexual behavior in general. So they are calling on the House of Commons to take the following actions to address this situation: to ban coercive, degrading practices that are designed to change a person's sexual orientation or gender identity, to ensure that no law discriminates against Canadians by limiting the services they can receive based on their sexual orientation or gender identity, also to allow parents to speak with their own children about sexuality and gender, and to set out house rules about sex and relationships, to allow free and open conversations about sexuality and sexual behavior, and finally, to also avoid criminalizing professional and religious counseling voluntarily requested and consented to by Canadians. Thank you.
Presenting petitions, the honourable member for Nanaimo Ladysmith.
Well, thank you, Madam Speaker. It's a privilege to table this petition today on International Women's Day. A guaranteed livable income is a powerful equity policy. It is one of the calls to action in the Missing and Murdered Indigenous Women and Girls Inquiry Report. A GLI would replace a current patchwork of income supports with a universal benefit that is progressively taxed back based on income. It would reduce poverty and reduce demand on social services, healthcare, and law enforcement. And it would ensure a financial safety net for all Canadians through major economic shifts, pandemics, natural disasters, or industry automation. For these and many other reasons, the petitioners from Nanaimo Ladysmith who initiated this are calling upon the Government of Canada to implement a guaranteed livable income for all Canadians. Thank you.
Presenting petitions. Questions on the order paper. The Honourable Parliamentary Secretary of the Government House Leader.
Yes, thank you, Madam Speaker. I would ask that all questions be allowed to stand at this time, please.
Agreed? Agreed, and so ordered. Orders of the day, ordre du jour.
Orders of the day, government orders, government bills, commons. Consideration of Bill C-24, an act to amend the Employment Insurance Act, additional regular benefits, the Canada Recovery Benefits Act, restriction on eligibility, and another act in response to COVID-19.
And before I do this, I also want to wish happy International Women's Day. Bonne journée internationale de la femme.
Happy International Women's Day. It's a very important day for all women.
Second reading of Bill C-24. Ms. Qualtrough, seconded by Ms. Tassi, moves that Bill C-24, an act to amend the Employment Insurance Act, additional regular benefits, the Canada Recovery Act, restriction on eligibility, and another act in response to COVID-19 be now read a second time and referred to the Standing Committee on Human Resources, Skills and Social Development and the Status of Persons with Disabilities. The debate, the Honourable Minister of Employment, Workforce Development and Disability Inclusion.
Thank you, Madam Speaker, and happy International Women's Day. Madam Speaker, I'd like to start by seeking unanimous consent to share my time with the member for Windsor-Tecumseh.
Does the Honourable Member have unanimous consent to share her time? Agreed? Agreed and so ordered. The Honourable Minister.
Thank you. I'm pleased to be present today virtually to speak to Bill C-24. I want to acknowledge that I'm joining you from the traditional territory of the Tsawwassen and Musqueam First Nations.
The bill before us today would make important changes to the Employment Insurance Act, the Canada Economic Recovery Benefits Act, and the Customs Act, so that we can continue to support Canadians.
I can't stress enough the importance of this timely passage of this legislation. It is straightforward, just 11 clauses. It is designed to help Canadians in response to the ongoing COVID-19 pandemic. From the beginning of the COVID-19 pandemic, our government has been there for workers. We've provided them with the support they need to stay healthy and safe and to pay their bills. Our first emergency measure, the Canada Emergency Response Benefit, was introduced in March 2020 and helped more than 8 million Canadians avoid catastrophic income loss.
We then added to this historic measure and provided support to students through the Canada Student Emergency Benefit and to persons with disabilities through a one-time payment.
Not to mention the more than 5 million Canadian employees who have had their jobs supported through the Canada Emergency Wage Subsidy and the 842,660 businesses who have accessed the Canada Emergency Business Account, both of which protect jobs through this crisis. This kind of government action has helped buffer the worst economic impacts in Canada. Last summer and fall, we laid out a plan to continue to support Canada's workforce through the ongoing pandemic. We transitioned from the CERB to a simplified EI program and introduced a suite of recovery benefits to provide income support to workers whose employment continues to be impacted by COVID-19. At the time, we said that we'd monitor labor market conditions and make adjustments as needed. We're still very much in a time of crisis. Restrictions are still being implemented across the country to slow the spread of the virus and its variants.
Canadians still need support when they lose their jobs, when their hours of work are reduced, or when they have to stay home because they're sick or they have to take care of their children. Today's bill reflects this reality.
We've assessed the current labor market and are following through on our commitment to continue providing certainty for workers. Madam Speaker, on March 28th, many Canadians could be faced with delayed benefits if we don't take action this week with Bill C-24. If passed quickly, this bill will increase the maximum number of available weeks of EI regular benefits, and Canadians will not face a gap in receiving the support they continue to need right now. In parallel to this bill, we are making increases through regulations to the number of weeks available under the Canada Recovery Benefit, the Canada Recovery Caregiving Benefit, and the Canada Recovery Sickness Benefits, and to secure job-protected leave under the Canada Labour Code. We are increasing the number of weeks available under the Canada Recovery Benefit and the Canada Recovery Caregiving Benefit from 26 to 38 weeks each, and are increasing the number of weeks available through the Canada Recovery Sickness Benefit from 2 to 4 weeks. Madam Speaker, as of February 28th, 2.5 million Canadians have accessed these three benefits. These additional weeks offer the certainty workers need in a difficult time and in an uncertain labor market. To be clear, Canadians receiving recovery benefits will not see any disruptions in their benefits. But I can't make the same guarantee with respect to Canadians on EI who face the same pending end to their benefits. It's up to this House to ensure that Canadians on EI do not face a benefit disruption. So let me now discuss the amendments to the Employment Insurance Act in more detail. Madam Speaker, Bill C-24 amends the Employment Insurance Act to increase the number of weeks that workers can claim in EI regular benefits. Workers would be eligible for up to a maximum of 50 weeks for claims established between September 27, 2020 and September 25, 2021.
This will ensure that millions of Canadians continue to receive support while still having access to the essential tools and resources that the EI system provides to help them re-enter the workforce.
Resources include Working Well on Claim, where workers can keep part of their EI benefit and all earnings for their job. This is an especially important tool right now as many workers face reduced work hours. The work sharing program is another tool available through the EI system that helps workers and employers facing layoffs when there is a decline in production or operations. By redistributing available work through a voluntary reduction in hours worked by all employees within one or more work units, employers can retain a full workforce on a reduced work week rather than laying off part of their workforce. This keeps workers on the job, maintaining skills and working habits, and avoids uncertainties that come with full unemployment. And Madam Speaker, keeping workers attached to the labour market will be key to Canada's successful economic recovery. Le marché du travail de notre pays.
Our country's labour market is also changing rapidly due to the pandemic. This new reality calls for the need to increase skills and train more workers. This is another good reason to expand access to the EI system. Canadians who are out of work can access courses and training programs while receiving employment insurance benefits.
We know that Canadians want to work. Evidence from last year's labour market data clearly shows that when there is work available, Canadians take these jobs. I also want to highlight that as part of this legislation, self-employed workers participating in the EI program would be able to temporarily access EI special benefits with an earning threshold of $5,000 compared to the previously set threshold of $7,555. Self-employed workers have also been hit hard by the pandemic and need this extra support. Enfin, Madame la Présidente.
Finally, Madam Speaker, I would like to address the issue of returning travellers and access to Canadian stimulus benefits. We've always made it clear that these benefits, and in particular the Canada Sickness Benefit for Economic Recovery, were created to provide Canadians with the opportunity to take paid sick leave when it is not available from their employer.
Benefits were never intended for travelers who are quarantining after non-essential travel, nor were they meant to incentivize or encourage Canadians to not follow public health advice or international travel guidelines. No one should be vacationing abroad right now. The amendments to the Canada Recovery Benefits Act and the Customs Act that are proposed in Bill C-24 would make Canadians who travel for non-essential reasons ineligible for recovery benefits. However, Canadians who travel internationally for medical treatment that is considered by a medical practitioner to be necessary, or to accompany such a person as an attendant, will remain eligible for recovery benefits, as will Canadians who travel internationally for essential reasons and must self-isolate upon their return to Canada. L'application de ces règles.
These eligibility rules will be applied retroactively to October 2nd, 2020, and this corresponds to the creation of stimulus benefits after the Canada Economic Recovery Benefits Act received royal assent.
Comme je l'ai dit plus tôt, nous sommes toujours en période de crise.
We are still in a crisis, and we will continue to evaluate the labour market and will be there for workers during this difficult time.
Let me close by restating the importance of passing this legislation in a timely manner. The bill has been in the hands of all members since February 23rd. All parties have said that the bill is straightforward and necessary. I'm happy to join this debate, and I look forward to moving it to committee swiftly for examination and further review. I urge all parties to move this bill along as quickly as possible. Canadians are depending on us, et quand nous avons travaillé.
And when we worked together in the past, we established key measures to help millions of workers.
First, to support this very important piece of legislation. Thank you.
And comments? The honourable member for Kildonan St. Paul.
Thank you, Madam Speaker, and I'd like to thank the Honourable Minister for her comments. She mentioned she cannot stress enough the timely passage of this bill, so I do hear her on that. She also mentioned there are labour market conditions her department has been monitoring since, I believe, September, but likely before that, since they instituted the CRB and the EI changes. Now, the original bill was to provide that 6 months or 26 weeks of coverage, which would come to end of March, as she mentioned. So my question is, we knew the second wave was coming. We knew there would be labour labor market devastation from that second wave. She mentioned she provided this to us at the end of February. Why not sooner? Why not at the end of January?
The Honourable Minister.
Sorry, I thank the honourable member for her question, Madam Speaker. When we put in place C4 back at the end of September of 2020, we built in the regulatory ability to increase the number of recovery weeks on recovery benefits, recovery caregiver and sickness benefits. We did know, obviously, at the time that legislation, if we wanted to increase the number of weeks available on EI, that would have to be done through regulation. Madam Speaker, we believe we've given sufficient time. We've been very clear with our intention to continue to support Canadians along this journey. And I just hope the member is with me on the necessity to pass this legislation quickly. With 11 clauses, I'm sure we can do this together.
The Honourable Member for Thérèse de Blainville. Thank you very much, Madam Speaker. I'd like to ask the following question. The Minister is right to say that there were several emergency measures established, and many of them had timelines and had to be extended or renewed, like the bill that's before us. What is the Minister's vision from September 2021?
Honourable Minister.
Merci, Madame la Présidente.
Thank you very much, Madam Speaker, for that question. Our government has always supported workers. We don't know what will happen in September, but we will continue to be there for workers, and we will continue to improve the EI system, and the flexibility we established last September will end in September 2021. So I'm taking time now to assess the system and to establish what we need to continue going forward with an EI system that is more modern. I know that a House committee is looking at the EI system still, but we will be following the labor market, we'll be following vaccines, workers, employment levels, and we will continue to be there for workers, and we'll do what we have to ensure that Canadians are safe and healthy. Thank you.
For Elmo Transcona.
Thank you, Madam Speaker. This very House and this very Parliament has twice called for the EI sickness benefit to be extended to 50 weeks. The Liberals committed to extending the benefit in the last campaign. This is not the first time that the EI Act is being amended this Parliament, and yet there's nothing in this about extending the EI sick benefit. We know that there are a lot of sick Canadians that need that help. We know that as long COVID develops, there's a lot of people who are falling through the cracks. The EI sick benefit would be the easiest way for them to be able to access a benefit while they're unable to work. Why is it not there? And when is the government going to get this done?
The Honourable Minister.
Well, thank you, Madam Speaker. As the member knows, and I thank him for his question and for his camaraderie on this really important file, two things are happening right now in EI. We are proposing immediate temporary changes to the EI regular benefit system to allow for increased number of weeks for EI regular benefit recipients. Very straightforward, one single surgical goal of this particular legislation. And in addition, we are looking to September. I'm looking to fulfill my mandate commitment to improve and modernize the EI system. We know we have doubled the recovery sickness benefits as well. We will be doubling it, pardon me, Madam Speaker, through regulations. We want it to be very surgical and precise in this legislation, but I know HUMA is studying EI. Happy to have those conversations. As the member acknowledged, we are committed to increasing the number of weeks on EI sickness benefits, but we want to really make sure that is a comprehensive reconception of what EI should be for workers of 2021, and that's what we're doing, Madam Speaker.
Resuming debate, the Honourable Parliamentary Secretary to the Minister of Employment, Workforce Development and Disability Inclusion.
Well, thank you, Madam Speaker, and thank you to the Honourable Minister for providing an opportunity to speak to this important legislation today. I would like to begin by acknowledging that I am speaking from the traditional and ancestral lands of the Three Fires Confederacy. That includes the Ojibwa, the Ottawa, and the Potawatomi. I am delighted to speak today in support of Bill C-24. If passed, this proposed legislation would temporarily increase the maximum number of weeks of employment insurance regular benefits available. It would also make returning international travelers ineligible to receive support from any of the Canada Recovery benefits for the period of their mandatory quarantine or isolation. We don't know how long this pandemic will last. What we do know is that Canadians need support for as long as it does. We need to adopt this legislation to provide Canadians with the support that they need. Soon, some workers could begin to exhaust their benefits. We need to act now to make sure that they continue to receive the income support they need as Canada's economy and labour force continue to recover. Par le volet de projet de loi sous nos yeux,
with this bill, we want to increase to 50 weeks recovery benefits under the EI system for any benefits claimed from September 27, 2020 and September 25, 2021.
En outre, nous souhaitons aussi de...
As well, we want to allow self-employed persons who have registered for EI to access special benefits with an income threshold of $5,000 for 2020 compared to the previous threshold of $7,555. This change would be retroactive to claims established on or after January 3rd, 2021, and would apply until September 25, 2021. But we are not stopping there, Madam Speaker. We also have promised to make regulatory changes to increase the number of weeks of benefits provided by the 3 economic stimulus benefits. That's what we're doing as we introduce this bill. Let me explain it to you in more detail. With respect to the Canada Economic Stimulus Benefit and the Canada Economic Stimulus Benefit for caregivers, we will increase the maximum number of weeks available under these 2 benefits from 26 to 38. And for the Canada Recovery Sickness Benefit, we'll increase the number of weeks available from 2 to 4. Madam Speaker, these measures are important. These measures are important because they take a tremendous amount of financial stress off the backs of workers and because they give them some of the financial certainty they need because these benefits will help them continue to take care of their families.
To the Canada Recovery Benefits Act and the Customs Act would also prevent international travelers who need to quarantine or isolate upon their return to Canada from being eligible to any one of the 3 recovery benefits during their mandatory quarantine or isolation. The changes to the employment insurance program and the introduction of the recovery benefits last fall were necessary and had to be put in place quickly to support workers and help them get through this difficult period. The changes we are proposing today address an important issue. They would apply to everyone who has had to quarantine or isolate under the Quarantine Act upon their return to Canada as of October 2nd, 2020. I must mention that individuals who are required to quarantine or isolate because they traveled internationally for medically necessary treatment or needed to accompany someone receiving such treatment could still receive benefits. As well, individuals who need to isolate but would otherwise have been exempt from the mandatory quarantine requirements under the Quarantine Act, such as truck drivers, would remain eligible for the benefits. Madam Speaker, Canadians from across the country have been making sacrifices and efforts since the beginning of the COVID-19 pandemic, and the Government of Canada has been there to support them from the beginning. It all started with measures such as the Canada Emergency Response Benefit, the Canada Emergency Wage Subsidy, and the Canada Emergency Student Benefit. We provided extra support for families through an increased Canada Child Benefit, as well as extra one-time payments for seniors and for persons with disabilities. we stepped up and took action to make sure that no one was left behind. We also created thousands of jobs and training opportunities for youth and ensured that the not-for-profit sector was supported so that organizations could continue to provide assistance to their communities. Moreover, we created the Canada Recovery Benefit, the Canada Recovery Sickness Benefit, and the Canada Recovery Caregiving Benefit. We have been there since day one, Madam Speaker, and since day one, Canadians have been making sacrifices. We will continue to be there for them and to make sure that they are all treated in fairness. Ça fait presque un an que
This pandemic has been going on for almost a year now, and with the second wave, recent public health measures, and the emergence of new variants, we all live in a climate of uncertainty. We do not have control over the pandemic, but we do have control over the measures we can put in place to support Canadians. So let's give them the confidence that no matter what the future holds, their government will not let them down. I therefore appeal to the goodwill of all my colleagues, and I hope that the changes we are proposing today receive the support of all. Thank you, Madam Speaker.
Questions and comments? Questions et commentaires. The honourable member for Windsor West.
Thank you, Madam Speaker, and thanks for my colleague from Windsor-Tecumseh in our area, as he well knows that the supplementary unemployment benefits from auto workers has not been addressed yet. He's had several pieces of correspondence from me and from others that have not even been answered yet, and we don't see a resolution in that in C-24. So I'd specifically ask him to respond to those issues and to tell auto workers in his region and my region and Essex County and across this country, when is the sub issue going to be dealt with, because tax season is upon us.
Honourable Member, Parliamentary Secretary.
Well, thank you, Madam Speaker, and I thank the honourable colleague for his excellent question. As the honourable colleague knows, I've been in regular communication with workers, both automotive, manufacturing, and across multiple sectors on many issues that are important to them, including the SUBs, or the supplemental unemployment benefits. And what I can tell you, Madam Speaker, is that we have committed to modernizing EI. We have committed to increasing, for example, sickness benefits to 26 weeks. We've committed to looking at all of these issues. And in fact, there is a study that is currently taking place in the HoMA committee that's looking holistically at the entire EI system. But the focus today is on addressing the urgent fact that EI benefits will cease for many workers by the end of this month. And I would really ask the member to really work together today, come together in that spirit of collaboration, like we did in the fall when we moved Bill C-4, to protect workers and their families across all sectors. This really is an urgent matter, and it requires our focus today.
And comments? The honourable member for Renfrew, Nipissing, Pembroke.
Yes, Madam Speaker. All there's financial help to keep workers attached to the workforce is necessary at this time, and the exception for people going across the border for medical treatment is certainly welcome. But is the funding of the cost of keeping initiatives for workers through the different program funding that are taking place the reason why the minister is canceling the funding for survivors, for Canadians with printing or services for Canadians living with printing disability like blindness, dyslexia, Parkinson's disease, and cerebral palsy? Is that why the funding for those services is being cut, so they can fund other things?
The Honourable Parliamentary Secretary.
Well, thank you very much, Madam Speaker. And again, I thank the honourable member for the important question. You know, since taking office, our government has brought disability inclusion to the forefront and really made historic advances in ensuring persons with disabilities have the support they need to succeed. We've developed an overarching strategy to increase access to accessible books in Canada, including a transition strategy towards the goal of books being born accessible. We are committed, Madam Speaker, to embracing the potential of new technology and inclusive production practices, and we will continue working with the disability community every step of the way to find the right solutions. And as we continue our work on Canada's economic recovery, I think it's important to also emphasize that we are set to share and update in short order on key supports for persons with disabilities.
On a le temps pour une brève question. L'honorable député.
Time for a brief question. The member for Longueuil, Saint-Hubert. Thank you, Madam Speaker. Bill C-24, we understand it'll help vulnerable workers who've lost their job during the pandemic. But there are other vulnerable people like seniors, and this afternoon we voted to increase old age security for seniors, but the government voted against this initiative, and yet seniors are isolated. They're suffering. The cost of living has increased. So how can the government tell seniors that their pensions will not be increased? Unbelievable. So what does my honourable colleague think of this?
Please.
Well, thank you very much, Madam Speaker, and I really do appreciate the honourable member raising this important issue. Absolutely, we have to look after our seniors, make sure they have the supports that are necessary, especially throughout this pandemic, but beyond this pandemic. But today, what today is really about is the urgent fact that we have to pass Bill C-24 in order to address the potential interruption in supports for workers really across all age brackets in Canada. And so the focus today, the laser focus and the urgency today is on passing Bill C-24 to make sure that we prevent that interruption of supports for all workers and all Canadians across all age brackets. Thank you, Madam Speaker.
Resuming debate, the honourable member Kildonan St. Paul.
Madam Speaker, I ask for unanimous consent to share my time with the honourable member for Carleton.
Does the honourable member have unanimous consent to share her time with the honourable member for Carleton? Seeing the will of the House, I would say that yes, you do have unanimous consent, and so it's agreed. And the honourable member Kildonan St. Paul.
Thank you, Madam Speaker. Today, the House of Commons is debating Bill C-24. Two key components of this legislation are that it will increase the maximum number of weeks available to workers through EI with up to a maximum of 50 weeks for claims that are established between September 27th, 2020 and September 25th, 2021. This is up from 26 weeks, which was established in legislation passed by the House earlier in the fall. This legislation is essentially an extension of pandemic emergency support benefits for Canadians because there are no jobs available to them. And this legislation fixes the Liberal-caused loophole in the Canada Recovery Sickness Benefit for international leisure travelers. In the previous legislation this past fall, Canadians who could claim this benefit for their quarantine weeks when they returned from vacation, which obviously doesn't seem very ethical, and the official opposition brought this issue to attention back in December and January and called for an immediate change. And so here we are, the third month of 2021, and we are finally debating the needed changes to the September 2020 legislation. Conservatives support getting help to Canadians in need whose jobs have been eliminated as a result of government-mandated restrictions and closures in response to the pandemic. But we are disappointed that once again, the Liberal response to the pandemic in this bill and in the minister's speech resoundingly failed to put forward a worker-led, jobs-first economic recovery plan for a post-pandemic Canada. And it really would have been timely to do so today, given this week marks the one-year anniversary since the World Health Organization declared a worldwide pandemic and lockdowns began in Canada, and life changed dramatically for all of us. And since that time, 12 very long months ago, the statistics of unemployment have been staggering. Since the end of CERB in September and the implementation of the new EI and CRB benefits, over 3 million Canadians have accessed the EI supports, with over 2.3 million Canadians currently receiving EI benefits as of mid-February, and over 1 million Canadians that are on the CRB since the end of September. So that's over 3 million Canadians that remain out of work. And it is very important to recognize that there is a sunset clause in these direct payments to Canadians, and that's September 25th, 2021, which is about 7 months from now.
But my question is, what comes after that? Is the Liberal government suggesting that Canadians will no longer require government supports by the end of September? Will there be a transition period to help Canadians get back to work, or is the government planning to cut off Canadians and their families come September without providing a pathway or support to help them re-enter the workforce? And has the government examined what the impact to wages and the job market will be when 3 million Canadians attempt to re-enter the labour market? There's a lot of questions that have not been answered in the minister's speech or in this legislation. And the end of September for these programs also coincides with the Liberal promise to vaccinate everyone who wants one by the end of September. But here's the problem. Even if we do achieve that vaccination goal by the end of September, we know that jobs won't miraculously return overnight. The Canadian Federation for Independent Business has said between 71,000 and 220,000 small businesses will close permanently, which will eliminate between 1 million and 3 million jobs from the Canadian job market. 58,000 small businesses officially closed in 2020, and in the end, whenever that will be, CFIB suspects that 1 out of 6 Canadian businesses, that's all businesses, small, medium, and large, will close, with an estimated 1 in 5 to close in Alberta. And so for Canadians that aren't sure really what that means, go walk down the street, look at 6 businesses, now eliminate one of them, and then just keep doing that as you walk down the street. That's truly devastating for the economy and for Canada. And in Canada, the data has been clear that the uneven impacts of the pandemic, there are very uneven impacts of the pandemic. Men are rejoining the workforce in greater numbers as women are leaving the labour market altogether. In fact, labour force participation for women has been set back 30 years. So it hasn't been this bad for women, Madam Speaker, since before I was born. And regarding newcomers, people may remember in the fall when the Liberal government triumphantly said it would bring in over 401,000 new permanent residents in Canada this year, which is more immigrants into Canada than any single year in our history. And they argued it would help our economic recovery, which it might. However, numbers just released saw that Canada lost 4% of its permanent residents last year. They just packed up and left Canada, possibly for good, because there was no opportunities here for them. And Canadians should know that on a regular year, our permanent residents grow by 3%. So really, this is a 7% setback. So immigrants are giving up on the Canadian dream. Women and young people have fewer and fewer opportunities. And it would seem that Canada is no longer a place for small business entrepreneurship. So it really doesn't take an economist to realize that it will likely take years, perhaps a decade or more, before new businesses are created to replace the ones that we've lost. And after a year, the government's only plan thus far is to further extend emergency supports. And so my issue with Bill C-24 is that it is not a jobs recovery plan. It is yet another Band-Aid. And the Prime Minister recently promised in the House of Commons that the government would, quote, bring back opportunities. But he has failed to tell Canadians exactly how he will do that, and in particular, how he will do that given the top developed nations in the world are racing to be some of the first to recover and to relaunch their economies. Fierce world economic competition is imminent. The U.S. has pledged to fully vaccinate its population by the end of May, and the United Kingdom has said it will be fully reopened by June 21st because of their successful vaccine rollout strategies. They have made that commitment to their people. Meanwhile, in Canada, our vaccine rollout has been hovering around, 50th in the world. And as a result, we will be slower to recover. And we are in danger of being locked out and left behind of the international COVID-19 economic recovery and the jobs to be found therein. And more than that, there is the very odd fact that Canada has spent more per capita than any other G7 country, and yet has achieved the worst unemployment outcomes, as well as the worst vaccine rollout, as I've said, and also suffers from the lowest business confidence right now. So we're spending more, getting less. That really seems to be the Canadian Liberal way these days. And it does not bode well for the future, nor does it provide Canadians with confidence that this Prime Minister and his Liberal government have the competency to really turn the ship around. And so to conclude, I would like to touch on something beyond the job losses and the economic devastation, because the stakes really are very high that we get this right. So following a year of isolation due to lockdowns and restrictions, we know that the mental health of Canadians has been deeply impacted. People are deeply suffering. I speak to my constituents on a regular basis, and I can tell you people are really beginning to hurt it. It's palpable in my community, as I'm sure it is for all members of parliaments in their communities. Being kept inside, away from the people and activities we love, is really difficult for any amount of time, let alone 12 months. And what I find most frustrating is the Liberal government has not offered a solution or strategy to Canadians of how we get out of this. We're all praying for the vaccines to be delivered as soon as possible, but the Prime Minister said that the bulk of them may not get here until the end of September. He continues to make this promise, but is 7 long months away. And more than that, the Liberal government has not, this is the really shocking part to me, they have not even committed to reopening our economy, even if we do achieve 70% vaccination rates in Canada, which seems to be understood of what we need for herd immunity. And so to be clear, they have yet to promise that if we get people vaccinated by September, as they've promised on several occasions, that things will go back to normal. In fact, they've made every effort to avoid making that commitment. Meanwhile, other countries are delivering plans and promises and deadlines to their people. So Canadians have been left to guess when there will be a full economic reopening and a full dismantling of these restrictions. And that is something that people really do need to understand. No promise or commitment has been made. And as of right now, there is no end in sight for Canadians, and the Liberal government has failed to make this commitment. And I'm not sure why, given that they have yet to give these thresholds or indicators or measures as to when we can return to normal and get our lives back. Again, like I said, other countries are providing this certainty to their people. Or why they have failed to ensure widespread use and implementation of all tools available, like rapid tests, therapeutics, and of course vaccines. We've heard about these things for a year, and yet they have not been widespread. They're not in widespread use. And I know that the Liberal government is happy to blame the provinces, but the fact remains the federal Liberal government is supposed to be Canada's leaders in this crisis. So don't accept that excuse. In my view, they should be moving heaven and earth to ensure the tools like that and like this are commonplace by now. They should be by now. And instead, we're being told to sit tight for a minimum of another 7 months. What I do know is Canadians need hope. That is something I hear every single day. They need to know when we will get out of this hell. And Madam Speaker, I do not choose that word lightly. That is what this is for people. Hope is something that will help people, and I'm almost done, will give them the strength to push through it for another 7 months, and really, God help us if we're in this for longer. We need hope, a plan, indicators, communication. There has been nothing, and I cannot put in stronger terms, people are suffering immeasurably. Years from now, we will be looking back on this data and seeing the economic devastation and mental health devastation it has caused. And I'm not really the only one saying this, it's social sciences experts across the country. And to conclude, parents have been telling me about their children that
is up, but the honourable member will be able to add during questions and comments. Questions and comments, the honourable parliamentary secretary, the government house leader.
Yes, thank you, Madam Speaker. In so many ways, I would like to express how I disagree with my colleague in many of the things that she says, but I'm afraid, Madam Speaker, you won't allow me the time to do so, but I will be able to address them a little bit later, hopefully, in regards to more full detail. The question I have for the member is, does she actually support the legislation? This legislation is there to support a great number of Canadians. We just witnessed the Conservatives voting against support packages in C-14. Does the Conservative Party support this legislation? And if they do support the legislation, will they recognize the urgency and start allowing government bills to pass?
The honourable member for Kildonan St. Paul.
Madam Speaker, I will note that the member did not dispute any of my claims, or that the claim that his Liberal government has not provided an end date in sight or any hope for Canadians or any commitment whatsoever. And I'll just refer him to the parents that tell me their little children are depressed, wives whose husbands have been laid off, and they've told me they've seen their self-confidence plummet to dangerous levels. The elderly who have been emotional with me on the phone saying they don't want to spend their last few months or years on this earth alone in a room. It's the family businesses that have closed, their entire life work gone, and there's nothing they can do about it. So I did not hear anything from the member about those comments.
Questions and comments? The honourable member for Elmwood Transcona.
Thank you very much, Madam Speaker, and a pleasure to have Winnipeg MPs playing such a prominent role in the debate. Of course, one of the things that's an issue in our home province of Manitoba is kids who are graduating out of care and had been, encouraged to apply for the CERB, even though they may not have met the eligibility criteria. They're among many low-income Canadians who were encouraged to apply and did so in good faith, not realizing that they didn't meet the criteria. and don't have the money to pay it back. That's why the NDP has joined many in civil society calling for a low-income CERB repayment amnesty. And it's one of the things we thought might have been in the bill, considering that we're coming up on the end of the tax year. There's not a lot of time left for these folks who don't have the money anyway. So it's not like government is going to get this money back. It's not going to help the bottom line. It's just going to further ruin the lives of people who are already in a very tough spot. And I wondered if the member has given some thought to the idea of a low-income CERB repayment amnesty and what the position of her party is in that regard.
The honourable member for Kildonan St. Paul.
I thank my colleague from Winnipeg for his questions. It certainly is nice to see Winnipeggers up today. And, I understand where he's coming from. What I really do feel is that this loss of hope, this despair is really that people don't have a choice. They have no power. There is nothing they can do when their businesses are closing. There's nothing they can do when their children are, they have no other options today. And we're really all powerless to the whims and decisions of our governments, which is of course led by the federal Liberal government and the Prime Minister. And really, I believe when people feel this powerless for this long, they lose hope, they lose strength to keep fighting, and frankly, they lose the will to live. And I've heard that firsthand. And I'm sure the member has heard similar from his constituents.
Questions and comments? The honourable member for Cloverdale Langley City.
Yes, thank you so much to my colleague for her fantastic speech. You mentioned that people seeking PRs has dropped dramatically. I know I received over the weekend a desperate plea to help with someone who has been working hard to become a Canadian, and he's basically begging me, put yourself in my situation. I'm getting absolutely no response back from Service Canada. I mean, he started this back in 2019. He's been having to reapply every time for visas, which he cannot afford to do. And he says, I'm so worried. My wife, my son's visas, we all will expire. My son's going to have to leave school. My wife and I have to leave our job. I lose my license. I won't even be able to drop my son off to school. I wonder if you could just speak to how we got in this situation, since we don't have any vaccines. We have no end in sight. What are we going to do?
So I just want to remind the member she's to address all questions and comments through the chair. A brief answer from the member for Kildonan St. Paul.
Thank you, Madam Speaker. I thank my honourable colleague for her question. When I was the critic for immigration, I saw the vast mistreatment and the lack of dignity for new immigrants and newcomers. And I just want to conclude by saying that the Prime Minister and the Liberals have provided, again, no strategy and no plan of how to reopen our economy, how to return to our free lives, other than vaccinations, maybe by September, and then maybe that's when we'll reopen. But it's been a year, and I firmly believe Canadians deserve more than a maybe 7 months from now. And as a Canadian and as a parliamentarian representing nearly 100,000 people, I urge the Liberal government to bring forward a plan to reopen the economy, to bring back jobs and bring back life and living. It is time for a plan, and it is time for hope. Thank you, Madam Speaker.
Perfect. Resuming debate, reprise de débat. The honourable member for Carleton.
Thank you very much, Madam Speaker, and thank you to the member for Kildonan St. Paul for an excellent speech that will be very difficult for me to follow. But here are the hard facts. While it is important to provide interim support for people jobless during COVID, what people really want are paychecks. Now, this is all against the backdrop of an unemployment rate that is by far the highest in the G7, higher than the United States, the United Kingdom, France, Italy, Germany, and Japan. Now, the government has tried to, since these data points have come out, claim that unemployment rates no longer matter, that we should look at some other statistics that they've cooked up. The problem is that since the Prime Minister took office, he has on 49 occasions in the House of Commons said that the unemployment rate is precisely the measure we should look at to determine how our job market is working. Well, the answer is right now, it's not working. There are 850,000 more people unemployed today than there were in February of 2020. And Interestingly, the government brags that we have in Canada secured a larger recovery of the lost jobs in percentage terms than other countries. Well, that's, of course, the result of the fact that we lost more jobs in the first place. We had more to gain back. But even with the recovery of the minimal recovery that we have had of jobs, we still have a higher rate of unemployment than our competitors. And it's getting worse. The most recent monthly data showed the loss of another 200,000 jobs in the same month where the United States gained jobs. And the leading indicators, that is to say, of what job losses are to come, are even worse. According to the largest association of small businesses in Canada, the CFIB, between 70 and 220,000 businesses in Canada are thinking of closing for good. This is between 7 and 21% of all businesses in the country. All of them. If they were to close, we would lose between 1 and 3 million jobs, a catastrophic outcome for our economy. Now, forget the fact that other countries are roaring back, that they are recovering and putting their people back to work, that foreign workers are getting paychecks while ours are getting credit card debts. Let's stop talking about stats and start talking about people. Because a job, though it means a paycheck, means so much more than that. It means the pride and purpose and independence of getting up in the morning and taking control of one's life. People who lose jobs lose this pride and independence. And the data shows that their mental health suffers dramatically. According to a study by the University of Calgary, the suicide rate rises by 2 percentage points for every 1 percentage point increase in unemployment. People take their lives when they lose their jobs. Since the pandemic began, we've had 50% increases of opioid overdoses in Alberta and Ontario. In British Columbia, 911 operators report a surge in phone calls from family members and loved ones who are begging for a paramedic to come and rescue someone who's overdosed, usually on opioids. This is the result of depriving people of work. It is good and necessary to provide interim income for those people, but it is not the ultimate resolution to their problem, which is they don't have a job and they don't know how they're going to pay the bills in the long run. Now, this is not just because of COVID. Of course, the whole world is facing COVID, and yet all the other G7 countries have lower unemployment than Canada. This is the result of a government policy that has systematically destroyed employment in this country for 4 years. They blocked the Energy East pipeline, which would have delivered 1 million barrels of Western oil to Eastern refineries, creating jobs for energy workers out west, refinery workers out east, steel workers in central Canada, and trades workers everywhere across the land. They vetoed the Northern Gateway pipeline and therefore deprived dozens of First Nations communities of thousands of jobs and billions of dollars worth of agreements to share revenue, money that would have paid for schools, hospitals, and job training for the youth. They've imposed job-killing taxes that have driven employers out of Canada and into the United States. Right now, Canadians have $800 billion more invested outside of Canada than foreigners have invested inside of Canada. Why is that? Because Canada, right now, is not the place you invest if you want to get things done. It takes 170 days longer to get a building permit for a pipeline, a business park, a factory, a warehouse, or any other economic infrastructure in this country than it does in the United States. In fact, we are ranked 34 out of 35 OECD nations for the delays associated with getting approval from government to build anything. Our First Nations communities are forced to send their own source revenues to Ottawa and then apply for some of it back, rather than allowing them to harvest the revenues directly from their own economic activities. Leading First Nations entrepreneurs talk about how long it takes for bureaucrats and politicians to sign off on commercial and other development activities on First Nations lands, preventing them from giving paychecks and purpose and pride of a job to their own people. Here in Canada, when immigrants come and seek out the chance to work in the fields for which they were trained, they're prevented by professional bodies and other occupational licensing regulators from getting a permit to work. And they're not told what they have to do to get a permit to work. And therefore, we have doctors earning minimum wage and architects unemployed and mechanics who are stuck only changing oil and changing tires when they could be running a full service mechanical operation and earning six figures. These people deserve the paychecks for which they were trained, but because of the bureaucracy of our permit-driven economy, they are prevented. Our government should put paychecks first. We should make Canada, the federal government, should set the goal and drive all other levels of government towards it, to be the fastest place on planet Earth to get a building permit for any kind of economic project, to allow First Nations people to approve their own economic developments, and to welcome home ownership for their people. We should allow First Nations communities to keep more of the revenue from these projects. We should repeal C-69, the No New Pipelines bill, so we can actually deliver our oil to market and get full world prices. We should end the offshore shipping ban off the northwest coast of British Columbia so that our energy producers can get world prices as well. We should reduce the tens of billions of dollars of regulatory red tape costs that hold back businesses and force them to spend their time serving bureaucrats rather than hiring workers and serving customers. We should knock down interprovincial trade barriers so that Canadians can buy and sell goods from one another rather than just importing and enriching foreign businesses abroad. We should reform our tax system so that it rewards work, savings, and investment and allows people to climb the income ladder rather than being penalized for each extra dollar that they earn. We right now should be encouraging municipalities to make it easier for newly and long-term vacant office space to be repurposed for housing for people who desperately need it. Here in Canada, where despite having one of the most sparsely populated countries on earth, we have among the highest real estate costs for people trying to find a home. These are all actions we could take right now.
Questions and comments? The Honourable Member for Kingston and the Islands.
Thank you very much, Madam Speaker, and I appreciate the comments by the member from Carleton today. And I took note to one comment that he made right after rattling off a whole bunch of stats. He said, and I quote, "Let's stop talking about stats and start talking about people." And I think that's really good advice, because the reality is, Madam Speaker, and this member goes on about it a lot, yes, it is true that our approach to dealing with COVID-19 was different than the U.S. And as a result, yes, we do have an unemployment rate that is 2% higher than the U.S. Ours at the end of 2020 was 8.8, and theirs was 6.7. But another very interesting thing when it comes to talking about people that this member never mentions is the fact that the fatality rate as a result of COVID is about a third in Canada what it is in the States. 506 people per million have died in Canada as a result of COVID. 1,298 have died, 1,298 people out of a million have died in the States as a result of COVID. So yes, let's talk about people. This is about people, and the approach this government took is much different than the approach that our neighbors to the south took. And I don't think that's a surprise to anybody. So my question is very simple for this member. Would he not agree
that seeing, or I'll put it in another way, what percentage would have been acceptable for him in order to save the number of people that we saved?
The honourable member for Carleton.
That self-righteous member didn't save anyone. In fact, he and his government left the borders open for months after the military warned them to close the borders to keep COVID out. They invited 2,000 people from the most affected region of China to come in after they were warned by the military. They then were the slowest among the G7 to get rapid testing, which would have helped us safely open our economy and protect people's lives. And now we're the last place in the G7 for vaccination rates. So I think we've all had a little bit enough of the government claiming that the reason why they've destroyed so many livelihoods is because they were busy protecting lives. They weren't protecting people's lives. If they were, we wouldn't have the worst vaccination rate in the G7 today, and we would be competing with countries like Israel.
Comments, questions et commentaires.
Questions and comments.
Member for Elmwood Transcona.
Thank you, Madam Speaker. In his remarks, the member said, and I agree with him, that Canadians want a paycheck. They want to be able to work. It's been a difficult time for that, obviously, and there's been a need to support them through these challenging times. But I think it's actually because of the truth of that statement that in so many cases where there's been pilot projects for guaranteed annual income, it's been shown to have a negligible impact on workforce participation because people do want to work when they can work, even if they have income support. However, what we find is that some of the serious mental health consequences that the member mentioned are mitigated by knowing that they have a guaranteed income to back them up. And we know that for those people who don't participate in the workforce, usually it's because they're caring for family or because they're pursuing some kind of education or training that later helps them participate in the workforce and contribute to the economy. And of course, a guaranteed annual income is there for people who may well want to work but simply can't because they're living with a disability or something else prevents them. So why is it that the member has so often expressed opposition to the idea of a guaranteed annual income?
Honourable member for Carleton.
Well, the NDP can't tell us how they'd pay for this. They say that there's money would fall out of airplanes into people's hands, but they don't tell us from whence that money would come. And there is no study, actually, that has simulated what the effect would be on people's health and well-being of raising their taxes by 7 or 8 points on the GST to pay for the scheme that he describes. So if he can come up with an explanation of where he'll get the money, then I'll look at the proposal and judge it on its merits. It's just that so far, all we get are dreamland promises that cash will fall from the heavens with no idea where it's going to come from. And the previous proposals that have come forward by, for example, the provincial Liberal government in Ontario would have actually hurt working class people and disproportionately given money to well-off families at the expense of working class families. So we need to work through all of those details before we can talk about just dumping money out of airplanes into people's hands, because as we know, money comes from people who earned it in the first place.
Resuming debate. Reprise du débat.
Resuming debate, the honourable member for Thérèse de Blainville. Madam Speaker, I would like to request the unanimous consent of the House to share my time with the member for La Prairie. Does the honourable member have the consent of the House? Since there are no objections, thank you very much. Madam Speaker, the crisis that we're still experiencing today has hit hard. And numbers talk. In just 3 months since the beginning of the pandemic, unemployment has risen to 13%. In March 2020, 167,000 women were laid off versus 96,000 roughly men. This crisis has been particularly devastating for women who saw their unemployment rate skyrocket between February and December 2020 from 37% to 48%. Last January, long-term unemployment was still at a record level, standing at nearly 512,000 people out of work. Even today, the market is far from stable in several sectors such as restoration, hotels, retail, culture, aerospace, etc. At the beginning of this crisis, many emergency measures had to be adopted. And why? Because the current EI system cannot help people. Therefore, we are in favor of this bill, which increases the number of weeks of EI to 50 weeks. But do we have a choice? Not really. Because the current EI system, as we know it today, has failed. It failed to protect workers in a time of crisis, but also when times were normal. Madam Speaker, the current crisis has exposed the flaws in the EI system. And we know that the coverage rate is barely 40% and slightly less for women. Many workers are excluded from the program, such as contract workers, part-time and self-employed workers. Seasonal industry workers go through big periods of black holes. It means that there are periods when they don't have income between two periods of employment. And these shortcomings were supposed to be fixed through pilot projects, but also had to be extended, but they were not improved. They weren't able to end these black holes once and for all. And there are also women who are on mat leave and parental leave who find themselves excluded from regular benefits if they lose their jobs when they return to work. Clearly, there are numerous examples to show us that comprehensive reform of the EI system is needed, and quickly. At my initiative, work has begun on this necessary revision of the EI system at the HoC committee where I sit. I'd like to thank my colleagues who sit on this committee for accepting to do this study as a priority. There's a great deal of interest in this study, and many witnesses were interested in telling us about changes and solutions to be put into place. Need I remind you that the Minister of Employment, Labour Force Development received this mandate, had already received it. And during the last Parliament, the minister in question also had this mandate to reform the EI system. And what has been done in 5 years? Nothing, Madam Speaker. The government, through the President of the Treasury Board, even had to recognize last spring that it was too late to reform the EI system. So I would say that the time has come, and it's also running out because all of these temporary measures will run out, and then what will we do? We can no longer accept the status quo. We have to implement structural, predictable, and sustainable changes to the EI system now so that it can regain its role as a social safety net for workers. Also, I have to address the whole issue of sickness benefits and mention the injustice that sick workers are currently suffering. How can we consider that someone with cancer only has 15 weeks of benefits? On several occasions, the Bloc has intervened on this issue by tabling a motion in the House and was adopted on a majority. And we also introduced a bill. We are asking for 50 weeks of benefits for sick workers. And we're still waiting for concrete action from the government on this. If the system needs to be reformed, it's because aside from the pandemic, the labor market has undergone several changes in recent years that require a full overhaul of the system. And allow me to address a few of these changes. It's a fact. The number of minimum wage workers is increasing. According to Stats Canada, there was an increase from 5.2% to 10.4% between 1998 and 2018. That means 1 out of every 10 people earns minimum wage. And according to a study, only 45% of workers earning $15 an hour or less are covered by the EI system. If this trend accelerates, more and more workers will be left behind. Moreover, there are a number of discriminatory factors, such as age, gender, race, and migration status, that often make it difficult for many workers to find jobs after being laid off. These same workers therefore need more time to find a job. The system must therefore consider this reality and give them the resources they need to overcome these difficulties. The labor market has also seen an increase in the number of self-employed workers in recent years. According to Statistics Canada, in 2019, they represented about 15% of the total workforce. And at the risk of repeating myself, Madam Speaker, there are solutions, whether it's in terms of the eligibility criteria, the number of hours, the number of weeks, or in terms of the calculation of regional unemployment, or in terms of the income replacement rate. There are solutions. So I urge the Minister and the government to listen to the recommendations of the various groups and to begin work right now on comprehensive reform of the EI system. In conclusion, there is one thing I would like you to take away from my speech, and it is this. It is clear that the government, through this bill, had to act, and that is why we are supporting this legislation today. However, the government also needs to work on a long-term vision. This crisis will have highlighted many flaws in the EI system, and these flaws existed well before the pandemic. With a great crisis comes great opportunity. The government must seize this opportunity and reform the EI system so that we ensure once and for all that all workers have access to an employment insurance system that is worthy of the 21st century. Thank you very much, Madam Speaker.
Questions and comments?
The honourable member for Newmarket. Sorry? Newmarket, Aurora, yes. Yeah, I was just missing the
Okay.
second part.
Do you mean Aurora, Oak Ridges, Richmond Hill, Madam Speaker?
Yes.
Thank you. Est-ce que mon collègue a exprimé?
My colleague put forth ideas to improve the EI system. Can she perhaps tell us a little more about why it is important to improve the system so we can all understand better? I would like to thank my colleague for her question. I will not give you a master class on the EI system. That's not what I want to do. In fact, the Human Resources Committee will study the EI system. It will not be the first study. The EI system is a social security net, and the point is to protect workers who lose their jobs. And since the EI system was implemented at the beginning of the 1970s, the protection it affords has shrunk rather than expanded. As it now stands, the EI system is not adapted to the reality of today's labor market, and even less in a period of crisis, because workers are falling through the cracks. Measures are being introduced in C-24, but they're temporary. And that's why it's important, and it should be a priority for the government to widen the eligibility criteria for workers. Questions and comments? The member for Elmwood Transcona. Thank you, Madam Speaker. We have heard representatives of the government say a little earlier that this bill will bring about urgent and targeted reforms. However, it seems there is a huge flaw because this bill is not extending the number of benefits weeks under the current EI system. We know there's an urgent need for that, and we know that the House of Commons twice already has called for extending the number of sickness benefits to 50 weeks. So I would like to know what the member thinks of that particular issue and whether the Bloc Québécois believes that kind of measure should be included in this bill. The member for Thérèse de Blainville. Thank you. Well, sure, technically it could have been easy to include that measure in the bill. But for the government, these are two different things. So as it now stands, this bill is meeting some urgent needs, and some workers will be left waiting. And we have to act on that, and we have to act on that quickly and send the bill to the Human Resources Committee. However, the government has the opportunity to do something about sickness benefits, and in fact, the government has committed to doing so, to increasing these sickness benefits. We're asking for 50 weeks. The motion was adopted in the House, so we expect the government to make a legislative change or to introduce this measure in the next budget. Therefore, to extend sickness benefits under the EI system for people who need it. The member for Longueuil, Saint-Hubert. Thank you, Madam Speaker. I appreciated the speech by my colleague. What she has to say about EI is always relevant. Today is International Women's Day, and I know that women are underrepresented in terms of salary, and they don't do as well as men. So what measures does she believe the government should take to make women truly equal? The member for Thérèse de Blainville. Thank you to my colleague. The problem is that there's a lot of talk, and these different points of injustice are constantly brought up. We talk about them especially on March 8th, and then we forget about them. And measures to correct these injustices, such as the Employment Equity Act here in Canada, we're still waiting for that to be implemented. So I hope we see something in the budget. And I hope the government will apply a gender-based analysis to every part of the budget. Resuming debate, the member for La Prairie. Thank you, Madam Speaker. Bill C-24 has two main guidelines. First, extending EI to 50 weeks, and my colleague, the member for Thérèse de Blainville, has given a very good overview of the bill. The second guideline is that returning travelers to Canada from non-essential travel will not be eligible to any of these benefits following mandatory isolation once they're back in Canada. I'd like to focus on that particular aspect of the bill and say, and I'm not revealing anything here, that we will support the bill. We are going to support Bill C-24. What I think of when we talk about this $1,000, which will be taken out of the pockets of people who would have gotten it after coming back from a trip down south, coming back from tourism travel, what we're saying at the Bloc is finally, Madam Speaker, here is a bill to fix that situation, which really made no sense. Now, coming back in time, let's go back. This all started with Bill C-4 in September, which was unanimously passed. And under the bill, people who had COVID or who were in quarantine and who lost revenue, well, they were entitled to $500 a week for 2 weeks, so $1,000 in total, to help them get by because they were doing the right thing, namely going into quarantine to protect public health. So that obviously was a good thing. So that was C-4 in September. It came into effect on October 2nd, but it was only after that that problems really started. And why am I talking about this? Because if you look at what happened afterwards, the government was simply procrastinating, hemming and hawing, and this government, as it has done from the start of the pandemic, it's been improvising. When you improvise, well, normally there's a bit of thought involved, but in this case, the government clearly did not know what it was doing. And this government has been improvising from the start. And yet, we've told them to watch out for this, that, and the other thing, but this government refused to act. It's a very passive government. Yet we're in a crisis, and in a crisis, we need leadership. We need a government which is in tune with what's happening in history. Every time there was a crisis, great men have emerged. In the 1930s, one of the greatest economists in the history of mankind, John Maynard Keynes, helped us completely change our view of society. And in the current crisis, this government should have been vigilant. What does that mean? It means that when the original bill was implemented, C4, the government should have known that $1,000 could have been problematic in some situations. So the government should have been attentive, and it should have been attentive to the consequences of Bill C4. It should have done that. It did not do that. To govern means to look ahead, and yet this government has not done so. Unfortunately, the government really never looks ahead. So if this government had been vigilant, it could have helped the economy even more. If this government had been vigilant, it could have done more to protect the health of our population. If the government had been vigilant, it could have helped save more jobs. If the government had been vigilant, more lives would have been saved. And this is what we must remember from the unfortunate inertia of this government, which we've seen time and time again. I'm not just saying this as a member of the opposition, claiming we would have done better. It's simply an observation of fact. So what originally seemed to be a good idea turned into a very bad one. Why, Madam Speaker? Because new variants were emerging, including in Great Britain, and borders had to be closed, and yet the government waited. The government told Canadians, don't travel. You might as well stay here. The government waited before it shut down the border. But in any case, the government said you shouldn't travel, but if you do, when you come back, go home and we'll give you $1,000. Well, that's a contradictory message. The government should, from the outset, have been vigilant and should have understood that it was sending out mixed messages. It was reporters who reported on December 31st that something wrong was happening. And only then did the government take notice and said on January 3rd that it would put an end to these returning travelers from down south. The Bloc had seen this coming. We had mentioned this to the government. We told the government that if it wanted to pass that bill, we would support it. And yet, we said that it should be retroactive to October 3rd. Still, we supported the government and said action had to be taken quickly. It was only on January 20th that the government sort of introduced the bill. We weren't sure what was going on. So on January 20th, it seemed that the government wanted to introduce a bill. And we said, well, it's not retroactive to October 3rd. It has to be retroactive. Then the government panicked and quickly withdrew its bill. And then for 2 months afterwards, opposition parties, and I know I was there, I was here in the House, and I saw the other parties, everybody was telling the government, you have to introduce a new bill, we'll support it. And now I say I'm supporting C-24. But we told the government that it had to make its bill retroactive to October 3rd, and we would support that bill. Well, it took the government almost 2 months to introduce a new piece of legislation. So here we are today. We're fixing a problem which did not start at the very start of the pandemic. All the parties agreed at the start of the pandemic on measures which were taken, but we're not in power. The government is in power. We were telling the government, go ahead, pass legislation, but we're in a crisis, so let's remain vigilant. But the government, unfortunately, did not remain vigilant. Why are we supporting this bill? Because, in fact, this bill should have been passed a long time ago. So we're happy it's here today. It's fine. We agree with it. But I'd like to insist on one thing. We've already tabled motions to this effect, and my colleague mentioned this earlier. 15 weeks for a person who is fighting for his or her life, 15 weeks of EI sickness benefits, when in other circumstances people can get 50 weeks, really it's inhuman. It's unacceptable. It's just not possible to support that kind of approach. When you're hit with a terminal illness or with a very severe illness, when you cannot work anymore, when you need time to heal and to recover, when all you can focus on is getting better, well, these people will not get the financial support they need when they are fighting for their life. It just doesn't make sense. You're looking at me, Madam Speaker, and I know you believe what I'm saying. Everyone here is saying the same thing. So I cannot conceive that a Canadian who has cancer, who's getting treatment, who's suffering, is not entitled to more than 15 weeks of EI sickness benefits. That makes absolutely no sense. And we should amend this bill to fix that situation. And we should put that in effect and, sure, put it in so it's valid until September 25th of this year. And then we should make that measure permanent, which has already been proposed in a bill put forth by one of the members of the bloc. We have to be more human. We have to be good. Thank you very much, Madam Speaker. Questions and comments? The member for Longueuil, Saint-Hubert. Thank you, Madam Speaker. I'd like to thank my colleague for his speech. And in fact, he was nominated as the best speaker in the House, and we can see why. My colleague mentioned some important things. Today is a dark day in Parliament. Well, good and bad. Seniors have been the most affected by this pandemic. They died in the highest numbers. They were hit hard by the pandemic. They're paying more for groceries, for the cost of living. And OAS will go up to $110 a month. This was voted by all the parties in the House except by the government. So what does my colleague think of the fact that the Liberals voted against an increase in old age security, money which would go to the most vulnerable people hit hardest by the pandemic? The honourable member. I'd like to thank my colleague who was absolutely right, and I just can't explain something I don't understand. The Conservatives, the NDP, and the Greens also supported this measure. You just cannot understand why the government and the members of the Liberal Party, why they did not vote to increase the revenues for those who are most hard hit by the pandemic. When you look at a senior, look at the senior in the eye and tell them, I voted against helping you, and see how they react. The honourable member. Thank you very much, Madam Speaker. I'd like to thank my colleague for La Prairie for his speech. He said the government has been procrastinating. Good point. In January, a bill was quickly thrown together which did not address the issue which needed to be fixed, as Mr. René Lévesque said. you don't fix an injustice by creating a new one. So I'd like to ask my colleagues about something. He talked about the past and the chronology of events, starting with Bill C-4. The government had previously provoked Parliament, and originally billions were going to be spent under C-4 until the end of December of 2020. Can my colleague tell me what he thinks about the government's actions, how it governs, and whether it's providing certainty or not? The member for La Prairie. Well, on this side, we're watching the government go. And we know the Bloc will never be in power here in Ottawa. It might happen one day, but in Quebec. Here we'll never form a majority. So I think we are a good opposition, a constructive opposition. And when I describe what I see across from me, well, I can't say good things. I wish I could say differently. I wish I could congratulate the government and tell them it did well. The leader of the government can confirm this. If a party, or rather, had been open to collaborating with the government, it's us. It's the Bloc Québécois, because we know that the government is flying an airplane but building it at the same time, and it needs help from us. And so we shared our ideas. And we told the government we have to support Canadians. We have to save them. We have to be good. We have to be good to them. We have to provide certainty. We have to be vigilant and proactive. So when I tell you, Madam Speaker, that I'm saddened by what I see, well, that's the only word I can use. I wish I could say better things about the government and the way it has managed this terrible crisis we're in, but unfortunately, I cannot do that. Questions and comments?
The honourable member for Elmwood Transcona.
Thank you very much, Madam Speaker. And here we find ourselves again debating some of the financial measures that are necessary in order to help Canadians cope with what has, inarguably been one of the most difficult public health and economic challenges of our time. So, I mean, in terms of response, I have to say, Madam Speaker, although there isn't anything objectionable about the measures proposed in the bill, I do think that it's missing a really important and significant opportunity to make some much needed headway on issues that Canadians are facing that are part and parcel of the employment insurance system, and that there's a well-established general support for in the House of Commons. So I'm going to speak to that very shortly, but I do also want to recognize that, when we talk about the pandemic and its effect, that we all know, and it's been said many times today on International Women's Day, that it has had a disproportionately negative effect on women across the country for all sorts of reasons, because women do a disproportionate amount of the caregiving work in families. We've seen women step back from the workforce above and beyond the simple amount that might have taken place due to job loss in the economy, because they're shouldering the brunt of a lot of the care work that's been required to happen, particularly when schools are closed and there's and access to childcare has been difficult. That's had a disproportionate impact on women's ability to participate in the workforce. So those are things that we need to be mindful of as we move towards a recovery, but there are also things that we need to be mindful of as we discuss the measures that are in this bill and the measures that are not in the bill that ought to have been. And so, we see in this bill an extension of the EI regular benefits to 50 weeks, which is something that makes sense. We know that the economic consequences of the pandemic are far from over, and that people who have been requiring exceptional financial support are in many cases going to continue to require that kind of support on an extended basis. It is curious to note that the 50 weeks of EI was not matched in the government's announcement for extensions of the Canada Recovery Benefit and other like benefits. up to the 50-week mark. And I think that does raise some questions in terms of how long the government is anticipating that these economic circumstances are going to last. And it would be nice to hear at some point why it is that the government didn't see fit to extend the Canada Recovery Benefit up to 50 weeks starting now, leaving Canadians who are dependent on that benefit to wonder whether that help will be there for them when the next round of extensions run out or not. And of course, the other thing that this bill does is to end the ability of Canadians to use the Canada Recovery Sickness Benefit, or what's could have been known as the Sick Day program, in order to self-isolate upon their return from non-essential travel. Something that really, was not foreseen in the establishment of this benefit. Something that wouldn't have happened had the government gone ahead with what New Democrats believe is really the right way to do this, which is to legislate 10 paid sick days for workers across the country. Now, the federal government isn't able to do that for over 80% of workers in the workforce, as members here I'm sure all know. It is most workers fall under provincial jurisdiction, but I think the government could have shown leadership by doing that within the federal sphere. And I think they could have, made headway by sitting down with provincial premiers and pushing very hard on this matter as an appropriate way to make sure that Canadians have the resources that they need in order to be able to stay home and protect their co-workers and their communities from COVID-19. So we haven't seen that degree of leadership. I think that's regrettable. I think that would have been better, and it would have been much harder to abuse in the way that we found the Canada Recovery Sickness Benefit being abused for the purpose of allowing people to stay home after non-essential travel. And I think it's important to say to any Canadians that may be listening that to beseech them to follow those travel advisories, and if they don't have an essential reason for travel, to stay home. Particularly in light of the fact that it seems, as we've known for some time, government has taken a while getting around to it, unfortunately, but there is widespread support within Parliament in order to see this program changed and to prevent Canadians from using it in that way. And so, if Canadians are going to embark on any ill-advised travel, they really should be doing their homework and understanding that the rules can change very quickly, and build that as best they can into their travel plans. And if they feel that there's any important uncertainty in that plan that they can't resolve, to make the choice to stay home. So I want to talk a little bit now, Madam Speaker, about what's missing in this package of reforms, because there are some things. And I have to say, I'm going to be honest with you, Madam Speaker, I was a little frustrated and in fact outraged by some comments from the Minister for Employment, Workforce Development, and her parliamentary secretary, who said that the idea of this bill was just to deal with some urgent matters. And I put it to them: go ahead and talk to Canadians who are suffering from cancer that are at the end of their 15 weeks of EI sickness benefit. Go ahead and talk to people who have had COVID and it's not leaving them. Maybe they're not in hospital, they're not in intensive care, but they have recurring symptoms and a condition that's coming to be known as long COVID. They're not able to look for work because they go through periodic episodes of chronic fatigue and other symptoms, trouble breathing. And it's occurring often enough that they know they're not going to be able to hold down a job, but their EI sickness benefit is done. There's no other program. Private insurers don't all recognize long COVID because it's a relatively new condition, and they don't have the resources that they need in order to be able to look after their families and themselves and maintain their financial wherewithal while they're dealing with a serious sickness. And the answer for those people, as it was for 15 weeks, would be an extended EI sickness benefit. Now, that's not so. I put to you, Madam Speaker, the urgency is absolutely there. Well, they said simple reforms and urgent reforms. There's nothing more simple than changing the number of benefit weeks in the Employment Insurance Act. There's nothing more simple than that. You change a 15 to a 50. and it's done. You couldn't ask for a more simple legislative reform if you tried. So the idea that this isn't simple is false. The idea that it isn't urgent is false. The idea that it isn't related to the pandemic is false. There's absolutely no good reason whatsoever to have omitted this. Well, let's look at the politics of the situation, Madam Speaker. The politics of the situation don't stand in the way either. 2 times, this very House of Commons in this Parliament has called on the government to extend the EI sickness benefit from 15 weeks to 50 weeks. 2 times. Once by majority vote on a motion, and the second time by unanimous consent, which is to say, Madam Speaker, that nobody out of the 338 members elected to this House objected, because if they had, that motion would not have passed. So 2 times, once by majority, once by unanimous consent, we've seen this House call on the government to extend the EI sickness benefit to 50 weeks. Now, is this something that the government has a principled objection to? Apparently not, because they themselves committed to extending the EI sickness benefit in the last campaign. Now, they don't go far enough. They didn't commit to 50 weeks. They committed to 26. But they have had ample occasions to make good on that election commitment in the context of a House of Commons that wants it to go even further than their own election commitment. The Liberals are the laggards when it comes to extending the EI sickness benefit. They're the ones that want the least amount of extension, and yet they won't even extend the benefits to the amount that they themselves promised, despite Canada and Canadians going through an enormously difficult time when the EI sickness benefit could be an important tool that helps keep sick Canadians going financially for a little bit longer. And here we see an acknowledgement of those difficult circumstances with an extension of up to 50 weeks of the regular benefit. That's the right thing to do, but it's also the right thing to do when it comes to the EI sickness benefit. And we have not had anything approaching an adequate explanation as to why the government is so dead set opposed to actually getting this done. I don't know if it's just because they want to campaign on it again. It worked well the first time, so let's keep it around for another election commitment. I don't know if it's in keeping with another theme that I've discerned in my time negotiating across the table with the Liberal government during the pandemic, which is that they are very reticent to do anything that would be a benefit that lasts beyond the pandemic. Whether we talk about the sick day benefit, that is set up in a way, and I'm going to talk a little bit about that shortly. There are some problems with that benefit. All of them stem from the fact that the government is resisting making sick days permanent. They want a benefit that will die with the pandemic rather than having something that will go on past it as a permanent and positive change for Canadian workers. And we're seeing the same thing here with the EI sick benefit that really ought to be extended on a permanent basis. Not my opinion, the unanimous opinion of the House of Commons, Madam Speaker. So let us not say that this is somehow just a partisan issue or something like that. So, you know, I don't know what it is, but unfortunately, there's not a lot of charitable explanations that one can draw. Maybe it's that they want to keep it for an election commitment. Maybe it's that they just don't want any good permanent changes emerging from the pandemic. I suspect we would never get a Liberal to admit that on the record, but fine, let them put a good reason on the record, because the research on the EI sick benefit is in, the politics are favorable to getting it done, the circumstances make it as urgent as any of the reforms in this bill, and yet it continues not to be done. It is incredibly frustrating to see the government pass up yet another opportunity to make this simple and urgent change to the employment insurance regime, Madam Speaker. Another thing that really ought to be here, Madam Speaker, as we approach the end of the tax year, is a low-income CERB repayment amnesty. We know that right now the government is asking a lot of people to pay back their CERB payments who don't have the money because they were living in poverty before the pandemic. They were told in good faith. Sometimes they were told by representatives of the federal government itself, including some members in the chamber. Sometimes they were told by administrators at the provincial level that they should be applying for CERB. We know in Manitoba that happened in some cases with kids graduating out of care. These are people who were told by people in various positions of authority that they ought to go ahead and apply for CERB. And they did. And they were supported for a time. And that money is spent, didn't get shunted off into a tax haven. It wasn't spent on international, shares in some kind of multinational company. It was spent here in the local economy supporting people who live on the margins and face some of the most economically difficult challenges as anyone in the country. And they don't have the money to pay it back, Madam Speaker. So let's not kid ourselves that somehow there's a big wad of cash out there and all the government has to do is demand it from the poor and it's going to help the bottom line. The fact of the matter is that money isn't there. And the only thing that the government is going to accomplish by insisting on getting that money back is making it even harder for folks who are already struggling with poverty to get back on their feet. And I don't see what the benefit is. I don't think there's any justice in that. And I don't think there's any financial or economic benefit to Canadians out of that, frankly. Certainly not in the short term. And I'd argue that in the long term, we're actually making it more difficult for people to get back up on their feet and to contribute in what ways they can to the economy. And that doesn't benefit us, and it ends up costing us more in the long run. And we don't see any mention of that here, Madam Speaker. I think it's a real disappointment, and again, fails to seize upon a really urgent issue as we near the end of the tax year and the deadline that so many have been told they have to meet in order to make those repayments that they quite clearly can't afford to make. So I want to use the time I have left to talk just about two more issues. One is the Canada Recovery Sickness Benefit, or the sick days, the 10 sick days. Now, I spoke a little bit about that. I think I've made it clear, Madam Speaker, we're of the view that those should be legislated and they should be a matter of right for every Canadian worker, regardless of whether they have a collective agreement or not, regardless of whether they have a generous employer or not, regardless of whether they work in a federally or provincially regulated workplace. Canada should be able to get to the point where every worker is entitled to 10 paid sick days, whatever the reason, whether it's COVID-19 or something else. But in this time, it's imperative that people be able to call in sick to work. That's why we push so hard to try and get 10 sick days. And so we have this program. It's seen less uptake than was projected. And part of that is because people can't take their sick days one day at a time. And so as people wake up with some symptoms and don't want to go into work on pain of infecting their colleagues, they decide maybe they're going to take a day off work. But they have to miss, not only can they not take it a day at a time, they have to miss at least 2.5 days or 50% of their normal work time in a week in order to be able to take the benefit. So, if they go to take that day and their test comes back rather quickly, they could be back at work before they qualify for the sick time, in which case we haven't helped them at all to take time off work in order to protect the public health of their colleagues and their communities. And so that means people may well make the choice. They can't afford to have a test result come back the next day because then they'd have to go back to work and then they'd have had a day that they didn't get paid for. And if they're only getting by as it is, you can't afford to do that too many times before you find yourself in financial difficulty. So it's important that people be able to take it one day at a time. We know that some people are making more than $100 a day, but they still need all of what they make in order to be able to make their bills work at the end of the month. And that's true even for people who aren't living extravagantly, Madam Speaker. And so this isn't a program that offers full wage replacement in the way that employers who are required to give sick days as a matter of law to their employees would be expected to provide full wage replacement. And so we continue to have these deficiencies in the program. We're missing an opportunity to try and address those deficiencies. We're only addressing the one, which was that it was left wide open for non-essential travelers to claim it. So, good to be fixing one problem, but really missing an opportunity to get to the real meat of the issue that's preventing this program from being the success we need it to be in order to protect public health and in order for it to be a proper stepping stone to those 10 days of paid sick leave that New Democrats believe every worker should be entitled to, pandemic or not. Now, the other thing that's harder to address in legislation, but I think this is a moment to ask if there is any legislative barriers or issues that are leading to this problem, is the fact that there are many Canadians, we've been hearing about them. I've written the government about this. It's come up in question period. The issue of people who have exhausted all of their EI regular benefits. So those are the benefits that we're extending up to 50 weeks now, but still have open claims that would allow them to claim, for instance, a sickness benefit or another kind of EI special benefit. And because that claim is open and they can't close it without losing those potential benefit weeks, they're being told by the CRA they can't get the Canada Recovery Benefit. Go talk to Service Canada. They go talk to Service Canada. Service Canada says, well, your regular benefits are exhausted, so that should be enough for you to be able to apply for the benefit with the CRA. So they go back to the CRA. The CRA says, well, your claim is still open, so you got to talk to Service Canada. And finally, Madam Speaker, they just get fed up of being bounced around, and they call their MP. This isn't the way to be helping people in an emergency. They need access to these benefits, and it's up to government to sort it out. If there's a problem with the fact that the CRA doesn't understand that people can have exhausted their regular benefits and not want to close a claim in case they get sick and they can access the sickness benefit, or in case they want to use other kinds of EI special benefits, this is something that government should be able to figure out on its own. It shouldn't be up to individual Canadians who are facing financial crisis to spend days, weeks, or months running around chasing different people in departments, getting their MP involved, trying to figure out how they can get access to what is supposed to be an emergency benefit in difficult times. Give me a break. So what we need is some political leadership for sure. And if there's some kind of legislative change that needs to be made in order to end this infuriating problem that Canadians are facing, now's the time to do it. Let's get it done because the need is urgent. So let's make it simple. Thank you very much, Madam Speaker. I look forward to questions and comments.
Questions and comments. The Honourable Member for Aurora, Oak Ridges, Richmond Hill.
Thank you very much, Madam Speaker. And thank you to my honorable colleague for a very comprehensive overview of some of the real opportunities but challenges within the current employment insurance system. And of course, the emergency benefits that with the CERB that were put in place to address some of those things. What he didn't touch on in terms of reform around the employment insurance program is regarding contract workers. We saw that there were mechanisms for CERB, but the EI program doesn't really address people who are precariously employed and contract workers. And yet we found, certainly in the pandemic, that they were in need of that kind of insurance backstop. I'm wondering if he could give us any thoughts on what or how, or if that's an aspect that EI should be looking at addressing. Thank you.
The Honourable Member for Elmwood Transcona.
Well, thank you very much to the member for raising this long-standing problem with the employment insurance system, which is that it doesn't recognize that more and more, and we can debate the reasons and the virtues, people in the Canadian workforce and in the global workforce more generally aren't working the kind of 9-to-5 jobs of the past. And we don't have an employment insurance system that recognizes that. I mean, I think one of the big solutions that's been put on the table, I know a conservative colleague of hers was quick to try and shoot it down earlier based on, I think, some misleading claims about how a guaranteed annual income might be funded and how it might be rolled out. But I mean, one of the ways that people are talking about addressing this issue is moving towards some kind of guaranteed annual income system. It would do a lot for many marginalized people, including people living with disabilities and seniors who have inadequate pension income. But it would also do a lot for Canadians that are participating whenever they can in a workforce that doesn't provide a lot of steady employment in the way that we're used to thinking of it as a 9-to-5 kind of 40-hour-a-week job, and that would help them take more risks. I mean, we've heard from advocates of guaranteed annual income some of the benefits to entrepreneurialism that exist when people know that within a certain limit they can try and fail without losing their shirt. And so, I mean, I think that's one of the directions that we need to be looking at quite seriously as we move into the future, to make sure that we have an income support program that can capture everyone, and so that we're not continually having the kinds of debates that we've been having all through the pandemic about all the different people who are falling through the cracks and really do need that assistance, and how we would all be better off if they got that assistance, because they're going to spend that money here in the local economy. And I think that's the direction we need to be looking at. Thank you.
The Honourable Parliamentary Secretary to the President of the Queen's Privy Council.
Yes, thank you, Madam Speaker. And, you know, I often listen to New Democratic members of Parliament provide comment in terms of that how government's just not doing enough, that we need to do more in every aspect of society, it would seem. And my question to him is that, you know, I suspect that some of these so-called permanent changes that he's advocating for would even have been that much more difficult in terms of passage in the House of Commons today. I would at least speculate as a possibility, and maybe he can provide some comment on regards to that. But my question to him is more, we have had, you know, NDP administration in the province of Manitoba, as the member knows, for 15 plus years in the last 20 or so years. And a lot of the changes that he is advocating for need to be put in place provincially to cover a larger percentage of the workforce. Why does he believe that the provincial governments in the past 20 years in Manitoba have let down our workers to the degree in which they have?
Member for Elmwood Transcona.
Well, it's a good question. I mean, no government is perfect, of course. I've long maintained that the NDP government of Manitoba under Dewar and then under Selinger ought to have passed anti-scab legislation. It was a disappointment to me that they didn't, and I look forward to a future NDP government in Manitoba doing that here, just as one example. And likewise on paid sick days, I'd like to see us get it there. But I do think it's better off when we can get there as a country, because let's not pretend that Canadian provinces don't compete for investment, and it would be better if we were to do this all together. And I think there's been a moment in the pandemic where, with appropriate federal leadership, we could have tried to move to a position where provinces were all instituting 10 legislated sick days at a time to prevent that kind of interprovincial competition that too often gets in the way of progress for workers in any one particular jurisdiction. So it was a real disappointment to me to see the federal government take a pass on that. Now, in respect of other measures, making it more difficult for this law to pass quickly, I frankly disagree. In fact, a majority of the House of Commons and then a unanimous House of Commons called for a 50-week EI sickness benefit. So there is no reason to think at all that changing the number in the legislation from 15 to 50 would have caused one iota of delay in respect of this legislation. It's a very simple change. It's been called for by the House unanimously, and I can't fathom why it's not in here.
The Honourable Member for South Okanagan West Kootenay.
Well, thank you, Madam Speaker. And I just want to thank my colleague from Elmwood Transcona for a really great speech that I think outlined a lot of the really important things that we should have learned during this pandemic, that we should be looking ahead to the future, not just within the pandemic. And, you know, he just talked about the government not putting the 50-week period for EI sickness in this legislation, about bringing forth a paid sick leave benefit that is very, very difficult to use and not useful. When we're in a pandemic, we want people who are sick to be able to stay home and not risk the lives of them and others. So I'm just wondering if he can expand on that, and perhaps he has some idea why the government has gone against the will of the House of Commons, why it has gone against its own election campaign promises and not brought in these measures.
Honourable Member for Elmwood Transcona.
Well, thank you very much for that question. I'd like to take the opportunity, if I could, to talk just a little bit about the folks that I've been hearing from across the country who are experiencing long COVID. And there's a lot of, I mean, this isn't unique to Canada. It's happening all over the world, where people who have appeared to have recovered from their COVID infection then get different kinds of recurring symptoms. and they can be quite debilitating. They're not very predictable. They get in the way of people holding down a job. In some other countries, they're starting to begin work. They're assembling professionals into clinics together to try and get a better handle on this condition, to understand better how it works, but also to legitimize the condition so it can be recognized by insurance companies, for instance, who have also been resisting recognition of this. The EI sick benefit right now is the best way to be able to accommodate these folks and make sure that their new novel and debilitating condition doesn't become the cause of their financial ruin. And as I say, I mean, I am mystified as to why that's not in here, given the widespread political support that measure already enjoys in the House of Commons.
The honourable member for Nanaimo Ladysmith.
Well, thank you, Madam Speaker, and I'd like to thank the honourable member from Elmwood for his speech. It was very, very comprehensive, and I agree with so many of his points, especially that this was a time when we could have been working on some permanent programs rather than this continued patchwork that we're dealing with. And so many people have fallen through the cracks during COVID-19, so many businesses as well. And I'm really happy to see the NDP and some Liberal members who are supporting guaranteed livable income now. This is something that we've been promoting with the Green Party since 2006. And economic studies show that it will actually increase employment and increase economic activity. And I think that it makes for a great sickness benefit program as well. If it's done properly, you have a system available so when people don't work, they still get their check. And I just wondered if the honourable member would comment on some of these things.
Honourable member for Elmwood Transcona, 30 seconds.
Sure. I mean, I look at all the debates that we've had in the House over the last year or so, and you think about when we talk about CERB and all of the constituencies that we've been trying to help. I mean, whether it's workers who are trying to get their access to their sub plan, whether it's moms who are struggling to access benefits for maternity, whether it's seniors who couldn't handle the additional costs of the pandemic, people living with disabilities, all the people falling through the cracks could have been captured by a more universal approach of the kind that we were advocating for early in the pandemic. And all the time that has been spent trying to close those cracks and not comprehensively, like we haven't succeeded, could have been spent fixing other problems.
Resuming debate, the Honourable Parliamentary Secretary to the President of the Queen's Privy Council.
Yes, thank you, Madam Speaker, and it's a pleasure to be able to speak to Bill C-24, yet another piece of important legislation that we have before us that is there and designed because as a direct result of the coronavirus. And I think that what I'd like to be able to do is kind of approach this debate in terms of from what I've been listening to throughout the afternoon. And, you know, it was my colleague from Kildonan that made reference to the idea of hope. It was other Conservative members that were quite harsh in their criticism in terms of where's the plan. And I wanted to be able to address both of those issues and how it is that this legislation that we have before us fits in so well, Madam Speaker. And if I may, you know, virtually from day one, the Prime Minister, Cabinet, and in fact, the government as a whole indicated that we were going to be there for Canadians and we would have their back. In a very real and tangible way, we wanted to support Canadians throughout our great nation in making sure that we could minimize the negative impact of the coronavirus. And that is something that we have been working on 7 days a week, 24 hours a day in one way or another, Madam Speaker. I'm sure I'm not alone, as members of Parliament from all sides of the House are deeply engaged, whether it's within our constituency, whether it's within our caucus circles, it might be, or the entire caucuses in regards to the coronavirus and what is taking place in our communities and what do we need to do as government in order to minimize that damage. Madam Speaker, the Conservative Party talks a lot about the plan. Where is the plan? And the issue of hope. And I like to believe that I've had the opportunity over the last number of months, the last 12 months, to be able to provide comment in regards to that plan that we talk about consistently. And just because, Madam Speaker, here's not a list of 1 to 1,050 of thoughts and ideas and dates and so forth, and that type of a document does not necessarily exist except in the fictional minds of maybe many of my conservative friends. At the end of the day, we have worked very closely with the many different stakeholders, provinces, Indigenous leaders, territories, different levels of government, school divisions, to municipalities, to unions, and so many others, businesses, both small, medium, and large alike, in terms of understanding the impact that the coronavirus is having on our society and our economy. And the programs that we have developed over this period of time has done an excellent job in making sure that we do minimize the negative impact of the coronavirus and puts Canada in a great position to ultimately, I would suggest you, to not only build back, but to build back better, as often many of my colleagues will talk about. Now, when you look at the legislation, for example, that we have today, legislation, and members will say, well, I'm a government member and I'm just saying good stuff because I'm somewhat obligated to say good stuff. And I'd like to provide a couple of quotes just specifically on this bill. The Canadian Labour Congress actually did release a statement, and here's what the Canadian Labour Congress had to say. Canada's unions welcome the extension to income supports announced by the federal government today as a necessary step towards providing further financial security to those who need it. The release also stated, Madam Speaker, it's good to see the federal government fulfill its promise to take care of workers with these measures, including extending the duration of the federal sickness benefit for those who aren't covered through their workplace. The provinces must step up and offer worker universal paid sick leave. And that's one of the reasons why what CLC has pointed out, and I put it to my friend from Transcona, that, look, we can talk all we want, and I hear so much. There is nothing that Ottawa could do that would meet the standards, the full standards of the NDP. If we extended something to 30 weeks, they'd say, well, do 35 weeks. If we did 35 weeks, they'd say, do 40 weeks. It's endless in terms of what it is that they would want to see. My colleague from Spadina, Fort York, could talk about housing and do a comparison between NDP policies and what it is that we have done as a government, and you will find that the government of Canada in the last 5 years has far exceeded anything that the NDP could have ever created, even in their minds, Madam Speaker. Yet they still say there's still not enough, even though it's kind of tenfold in terms of the types of numbers that they were talking about. And that's why I put to my friend the question. He himself recognized that when you talk about some of these permanent changes, and hopefully someday we will get to that point, but recognize the fact that governments of different levels all have an important place in this debate. And I believe that when we see what has taken place during the pandemic, that when we have the Minister of Labor sitting down with our provincial counterparts, that there is merit to have that debate continue on. And hopefully we will see provinces. Often it's a province that will take an action that will ultimately see other provinces and even the national government move forward. on the issue of sick leave, we are given somewhat temporarily taking action. It's being recognized, but it's a relatively small percentage of the workforce. I'm hopeful that provinces will see what it is that we're doing. And maybe this will assist us going forward when we talk about building back better. I would like to see our workers treated far better than what they are in the last 20, 30 years, Madam Speaker. And we need to see more cooperation amongst provinces. It was interesting, the National Council of the Unemployed, they also provided comment in regards to this bill. And they are calling on Parliament to swiftly pass the legislation. The council stated, and I quote, "This extension is important for the thousands of families struggling to get through this crisis. Their fate is now in the hands of parliamentarians. Our message to them is simple. Every citizen has the right to emerge from this crisis with dignity. All of us will be stronger and more united. We must therefore adopt this bill." You know, I asked a very simple question to the member from Kildonan. Will she support this legislation? What is the Conservative Party's position on this legislation? Read for yourself. There was an absolute no answer in regards to coming from the member. Yet the appeal to pass this goes beyond Liberal members of Parliament. Because at the end of the day, I would suggest to you, Madam Speaker, as I'm sure you know, that Liberal members of Parliament constantly are working with stakeholders, in particular their constituents, and taking ideas and bringing them back to Ottawa to help us deal with the policies that are necessary in order to implement that is going to help Canadians. We recognize that, and I believe other political entities inside the House also recognize the importance of passing it, as the National Council for Unemployed. You know, there was another union, Unifor. We're all familiar with Unifor. Well, Unifor Local 444 stated, "I would like to share the message that actually came from Dave Cassidy, the Unifor National Skilled Trades Chairperson, for Local 444. He wrote, and I quote, "The expansion of EI coverage is critical to the workers and families of Windsor, Essex, and I urge all parties to come together to ensure a swift passage of this important legislation." He called for, Madam Speaker, all parties to work together and move quickly to support and pass Bill C-24. Now, part of the problem is the legislative agenda is fairly substantial. There has been a great need because of the pandemic to bring forward legislation that's necessary in order for us to be able to support Canadians, individuals, and businesses. And as much as we bring in the legislation, and at times, especially earlier on during the pandemic, there was a higher sense of cooperation that was coming from opposition parties. When it comes to my Conservative friends today, nothing could be further from the reality of cooperation coming from the Conservatives. I would argue that they are playing a very destructive force on the floor of the House of Commons. They are going out of their way to prevent legislation from passing. The only time we can get something through the Conservatives if they are shamed to do that, Madam Speaker. I was disappointed earlier. You know how difficult it was for us to get the Conservatives to agree to have C-14 come to a vote? And C-14 was all about the pandemic and supporting small businesses. The amount of hours and days in terms that we actually had to call that in order to get it to a vote. What about the games that are being played inside the House? Again, mostly from the Conservative Party. Concurrence reports. points of order. Measures that are being taken in order to minimize the amount of debate time for the government, so then they can say, well, it can't be that important because the government hasn't actually called the legislation. So on the one hand, they're going out of their way to prevent legislation from passing, and then they criticize us for not getting legislation passed. How long will they hang on for C-24, Madam Speaker, before they will agree to ultimately pass it? This is for the workers. For businesses, we saw what they did. Ironically, they even voted against the legislation, which somewhat surprised me, Madam Speaker, I must say. But we still haven't got C-14 through the House yet. And what limited time that we have as a government House agenda, and we have tried to get some extended times on some of this debate. Even this morning or earlier today, we had a member from the New Democratic Caucus stand up and ask for additional time to see Bill C-5 addressed. But time and time and time again, the Conservatives are playing partisan politics inside the chamber over and above what I would suggest to you is a responsible approach at dealing with legislation that is there to support Canadians and the pandemic. And this is yet another good piece of legislation. And I don't know when it's going to pass, because I don't believe the Conservatives, unless something's happened very recently, has given any indication in terms of if they're going to want 3 hours of debate, 20 hours of debate. I know what they'll say is, well, we all have the right to debate. After all, I get the opportunity to debate. They all have the right to debate, and they want to be able to debate everything extensively. Well, Madam Speaker, they know full well that it doesn't take much. I could take, you allow me to take 12 students from Sisler High School in my area, and I could easily prevent government from passing legislation. It doesn't take that much to do it, because the only way you can get it through is if you're prepared to provide some form of time allocation, but in a minority situation, that can be very much a challenge. Even though on times we have seen even my New Democratic friends at times support the need for time allocation, where they've recognized important pieces of legislation. Madam Speaker, I'm telling you, and I'm suggesting to you, that the legislation that we have today is widely supported. It is of a progressive nature. The Conservatives have nothing to fear in terms of allowing it to go through, because many of the measures are temporary. So at the end of the day, if they want to support workers, I would strongly encourage them to get behind the legislation and allow the legislation to go to committee. After all, there are other things that the government wants to see additional debate time on. And I'm sure that at the end of the day, Madam Speaker, that many of the issues that the Conservatives might have could, in fact, be addressed at the committee level. When you take a look at the legislation and what it is that we've brought forward, we could talk about the Canada Emergency Response Benefit. I've referred to that as just an incredible program, virtually out of thin air, Madam Speaker, that appeared last year because of the incredible work of some of the finest civil servants in the world, where we, from nothing, created a program that close to 9 million Canadians ultimately accessed in some form or another. And then as it started to wind its way through, we developed 3 programs through the Canada Recovery Benefits Act. The Canada Recovery Benefit, the Canada Recovery Caregiving, benefit,
and the Canada Recovery Sickness benefit, all of which inferred to within this legislation. Within this legislation, we're seeing an extension of employment insurance. You know, in essence, amends the Employment Insurance Act so that it temporarily increases the maximum number of weeks for which an employment insurance regular benefits may be paid to 50 weeks. My New Democratic friend talked about everyone in the House unanimously supporting it. In fact, implied that it would unanimously support it being a permanent change. Well, Madam Speaker, let's see if we can get this to committee. One of the things that I have noted about the current minister responsible for the legislation is her openness to hear what opposition members have to say about legislation that she has brought through and introduced into the House. And there have been some incredible pieces of legislation through this particular minister, in particular in the area of disabilities, historical legislation, recognizing for the first time the significant issue of disabilities and bringing it and the need to address it in a much more formal fashion in terms of identification and more, which would ultimately lead to benefits. Madam Speaker, this legislation helps workers. And I would ask that my Conservative friends take that into consideration as a caucus and determine whether or not they're going to filibuster or attempt to prevent this bill from passing into committee. The government has been very much focused on Canadians since the beginning of the pandemic. We see that with the development of programs that I just finished reference. I could talk about those programs for small businesses, whether it was the emergency wage subsidy, the emergency rent subsidy, the emergency business account, and more to support small businesses, which indirectly support workers again. Millions of jobs that have actually been saved. Canada is in an excellent position to be able to build back better because we have a government that recognizes the need to be there for Canadians in a very real and tangible way. Thank you, Madam
Speaker. Questions and comments? The Honourable Member for Cloverdale, Langley City.
Yes, thank you, Madam Speaker. I cannot tell you how excited I am to hear this afternoon that the Liberals have a concrete plan to help us open back up again. This is really exciting. And I'm hoping that, because this is what businesses are asking for, they're asking for certainty, because that's how we can go forward. So I just have one concern. Earlier today, here in BC, first of all, we have vaccinations are beginning. And in order to have these vaccinations begin, we're actually having to delay second doses for some of our seniors. And earlier today, Pfizer was at Health Committee and said that is absolutely not recommended. And so what I would like to know is can my colleague can absolutely guarantee for me that this national experiment will not absolutely not create vaccine resistance going forward?
The Honourable Parliamentary Secretary.
Well, what I can absolutely guarantee, my friend, is that this Prime Minister and that this government will continue to listen to health experts. They will continue to work with provinces, territories, Indigenous leaders, as yes, Ottawa is responsible for getting vaccines into the country, and we are in fact meeting the plan that indicated that we would have 6 million by the end of March. And the good news is the Prime Minister has indicated, we will be getting closer to 8 million vaccine doses by the end of March. I have no problems whatsoever, Madam Speaker, if only time permitted, possibly in the Health Committee at some point in time, to be able to expand on why it is that I believe Canadians have good reason to be optimistic, to understand that the government of Canada has in fact done its job over the last 12 months, that there is hope around the corner. I do believe that we will meet the vaccination demands that are out there, and we will continue to work with provinces to make sure that it gets administered as much as possible, as quickly as possible.
Honourable Member for Vancouver Kingsway.
Thank you. Well, New Democrats are always pleased when we see any kind of legislation that is going to help working people in this country. And so we'll support this legislation. I found it passingly interesting to hear the honourable colleague say that he would like to see workers to have been better treated over the last 30 years, were his words. Now, of course, the Liberal Party's been in power for 21 of the last 30 years. In fact, they've been in power for 100 of the last 150 years. And in that time, while they've been in power, we've seen 6 out of 10 workers who pay into EI be unable to claim benefits. We've seen no minimum wage in the Canada Labour Code. We see no guaranteed paid sick time in the Canada Labour Code. There's not even a paid lunch break in the Canada Labour Code. So if there's a desire to see better treatment for workers, one would ask the Liberal Party why they have been so reluctant to make that happen. But my question to him is, if the Liberals truly want to pass this legislation quickly, why did they put up the parliamentary secretary to just spend 30 minutes of House time talking about this instead of just getting to the issue and getting to a vote so we can get this help out to Canadian workers as soon as possible? Is it not a little inconsistent for him to talk about other parties holding up this legislation when he just spent half an hour of valuable House time instead of just getting to the vote?
Honourable Parliamentary Secretary.
Well, Madam Speaker, if I believe for a moment that the Conservatives would pass it, if I didn't talk on the bill, I would do that. But I don't believe that to be the case. When I reflect on the 30 years, the member needs to be aware that 20 of those years were me in the Manitoba legislature in opposition, most of which when the NDP were the provincial government. And that's why when I talk about the disappointment in terms of labor, when there was a so-called party that was friendly to labor, I did not see the initiatives that are so important to labor being acted on. For example, those sick days, whether it was Premier Doer or Premier Selinger, they had the opportunity for many years. And I sat when Doer was in opposition, and we wanted to see more changes to support workers. I've walked picket lines when I was an MLA to see what kind of pensions were there. I believe, in comparison to my experience in provincial legislature, where I had NDP and Conservatives, and my experience with Stephen Harper in Ottawa, compared to what we've seen in the last 5 years in the treatment towards labor, I believe that we finally have a leader in Canada that understands the needs of labor and is actually taking tangible actions to support labor and workers in Canada.
The Honourable Member for Nanaimo Ladysmith.
Well, thank you, Madam Speaker. I look forward to getting this legislation passed through Parliament as quickly as possible as well. The question I have, we have a lot of workers who need help and needed help before we had the pandemic. And people have brought this up, the extension of EI support is important for people who have cancer, for example, or have a loved one that they need to take care of who's at the end of their life, or people in other difficult circumstances, or people who are self-employed. There are a number of different areas where we need to improve EI, and I'm wondering why we're not doing this on a permanent basis to help people after the pandemic as well.
Parliamentary Secretary.
Well, Madam Speaker, I wouldn't want to give a false impression in the sense that the only time that we're actually helping workers is during the pandemic. And a good example, the member makes reference to EI. Remember, we had CPP, where Ottawa worked with all the provinces after Stephen Harper for a decade did absolutely nothing, worked with all of the provinces, and we were able to get an agreement through the stakeholders to increase CPP. By doing that, that means that as workers retire into the future, that they'll have more disposable income. And remember, in the previous question, I made reference to a day in which I was out walking on a picket line with laborers talking about not having enough money for pensions when they retire. So these are the tangible examples that I could cite that predate the pandemic that this government and this prime minister has put into place. During the pandemic, well, Madam Speaker, I'm very limited because of time, but there are numerous measures that have been put into place to support Canada's middle class and the workers, people that are retired, people with disabilities, students, and I could go on in terms of expanding how it is that we've helped.
And we have more questions for the Parliamentary Secretary, the Honourable Member for Kingston and the Islands.
Thank you very much, Madam Speaker. And I really, in particular, appreciated the comments from the Parliamentary Secretary with respect to the delay tactics that we're seeing from the Conservatives. The truth is that whether it's pushing forward with a concurrence motion or whether it's stalling on points of order or putting up various different roadblocks, it's quite clear that the Conservatives are interested in slowing down the process of this legislative process as much as they possibly can. As a matter of fact, the Leader of the Opposition recently said in the National Post that he was willing to work day and night to get the job done. But then last sitting week, 4 days, I moved a unanimous consent motion to have the House sit till midnight so that we could do exactly what he said. But guess who voted against it every single time, Madam Speaker? Conservatives. Why does the Parliamentary Secretary think that the Conservatives want to slow down the legislative process?
Honourable Parliamentary Secretary.
Yes, thank you, Madam Speaker. And that's why I say the Conservative Party today is more of a destructive force within the House of Commons than I have ever seen, both in the Ottawa or in my years as being a parliamentarian in the province of Manitoba. And they do that by trying to frustrate the government in getting anything passed. Anything at all. He made reference to, well, why don't we extend hours? After all, it was on MAID legislation. It was literally a life and death piece of legislation. And the Conservatives said, no, we don't want to sit extra hours because that might mean that we have to ultimately see it pass. We want to continue to filibuster. Madam Speaker, the concurrence motion, I was actually supposed to be debating, I think it was either Thursday or Friday, C-19. And the Conservatives bring forward a concurrence motion so that bill would not be actually debated. That's for the election and making sure that Canadians are safe. There's all sorts of things that one could cite in terms of what it is that the Conservative Party is doing today in order to frustrate the House of Commons in being able to get the work that's so important done. And I would hope that the leadership of the Conservative Party would review the question that was just posed and maybe entertain some thoughts that I've expressed during my speech and change their ways.
Resuming debate, the Honourable Member for Dufferin-Caledon.
Well, thank you very much, Madam Speaker. And sometimes you've seen it all in politics. I've just listened to a 30-minute speech by the member from Winnipeg North to talk about how we should quickly pass legislation. The member who consistently gets the award for the most words spoken in Parliament. And yet, all of a sudden, it's time for no one else to speak. It's time to rush legislation through, and we should not debate anything. Some days, you've seen it all in the House of Commons. When we talk about C-24, we're looking at three important things that the government is trying to do here. And I will agree, they are important. They're trying to increase the number of weeks available to workers through EI. They're trying to make changes to rules for self-employed workers who have opted into the EI system. And of course, they're trying to fix their original blunder in the sickness recovery benefit that, because of their loophole, allowed leisure travelers to be able to come back to Canada and claim the recovery sickness benefit after their vacation when they were quarantining. So the question might be, You know, why did that happen? Well, maybe it's because exactly what the member from Winnipeg North was just requesting us to do is speedily pass legislation without review, without debate. When you do that, you end up 5 months later trying to patch the holes in your leaky ship. And that's what we're doing here today. So I want to talk about that a little bit, because the speech we just heard from the member for Winnipeg North is the epitome of what's happening in the House of Commons these days. What we have is legislation that gets dropped, and then we're told it's urgent and important legislation, and it shouldn't be debated, and it needs to be rushed through committee because we have to help Canadians. And of course we have to help Canadians. That's what we're all here for, and that's why we vote in favor of the majority of legislation for benefits for workers from the government. But the process is the problem. These bills could have been introduced at the start of Parliament. We've been here for 2 months when the session resumed. Where was this bill? Why wasn't it here? We've known of the problems with the Canada Sickness Recovery Benefit for 5 months. Why wasn't it introduced 5 months ago? We've known of the loophole. But instead what happens is this. We get a piece of legislation put forward to us, then all the proxies go out. Oh, the opposition, especially those terrible Conservatives, they're delaying this legislation. They're obstructing Parliament. When you fail to plan, you plan to fail. And that is repeatedly what this government does. They don't plan their legislative agenda properly. Then all of a sudden they wake up one day and say, oh my goodness, we need to introduce legislation on this. Let's get this passed quickly. Let's not review it. Oh, there's problems with it? Well, you know, we'll fix that someday. And this is not the way that things should be run. It's a cynical pattern, and it's a clear pattern. We've seen articles on this as recently as February 28th. Conservatives accused of playing politics in the House. Liberals are accusing Conservatives of systematically blocking the government's agenda. Nothing could be further from the truth. Bills are introduced, we have procedures to debate them, and in debate, you find problems with legislation, like the problems with the sickness recovery benefit. And for the members of this government to say debate has so little value that it shouldn't occur. They want this legislation to be debated for 2 hours. And the member for Winnipeg North just added his 30-minute contribution. A valuable contribution, of course, but he wants a quarter of the debate to be his. I'm not sure what we would say if we were in kindergarten, but we might say the member is trying to hog all the toys. You can look at February 24th, the same thing. Liberals go out to the press and say, unfortunately, the work of the House has been held up by Conservatives obstructing this legislation. We are calling on the Conservatives to put politics aside. Well, Madam Speaker, what I can tell you is I'm calling on the government to better manage their calendar, to better manage their legislation, introduce the legislation in a timely basis. We've been in the pandemic for a year. We know these things have to get done. We had a big break at Christmas. They probably could have done some work, prepared some legislation, so it's ready to go when we came back, instead of just dropping it on the order paper today and saying, we better pass it in 2 hours. That is not the way we should govern. And the question you might want to ask is, why do they do it this way? What's their end game? Well, one, it's political, because they want to blame the opposition parties, shamelessly blame them, for holding up benefits to Canadians, who of course need those benefits. But number two is, we also have issues with transparency with this government. It's a big problem. They don't want transparency because they don't want us to know what's actually going on with legislation, with other things as well. And this is very well documented. And you might recall, this government said we will be open by default. It was a signature promise by the Prime Minister, right? Back in 2015, I know it's 6 years ago, but this was his big thing. And guess what's happened since then? In an article in the Telegraph Journal, in its latest edition, Canada's Access to Information Act ranks 50th out of 128, behind the stalwarts of transparency such as Russia, number 43, Pakistan, number 32, and South Sudan, number 12. That's hardly a spot we want to find ourselves in, given how important a strong right to information is when it comes to holding our leaders accountable. In another article in February, it was quoted as, "Governments and this information should be open by default, as the Prime Minister promised. The data is paid for by Canadians and belongs to Canadians. We will restore trust in our democracy, and that begins with trusting Canadians." Now, who said that? That was the Prime Minister, a mere 6 years ago. But when do we get this transparency? For example, parties, all the opposition parties, have been calling on the government to release the vaccination contracts. Have we received those contracts? No, we have not, because there's an absolute lack of transparency. Now, why is this lack of transparency so important when we look at something like this? Well, they're making changes to the Canada Sickness Recovery Benefit. And they're making the changes because they rushed through legislation which allowed for people who are on a leisure vacation to come back, and during their mandatory quarantine, they could claim a sickness benefit, a recovery sickness benefit, which I can tell you, constituents in my riding of Dufferin-Caledon find absolutely outrageous. This was raised repeatedly with the government. It's taken them months and months and months to try and fix it. And here's my question. How much did this cost taxpayers? How many people have claimed this benefit? How many millions of dollars have been spent? Well, we know this government likes to filibuster things at committee. They accuse us of filibustering legislation, but boy, oh boy, we are rank amateurs when it comes to that. Look at any committee demanding information from this government. It's delay, it's obstruct, it is refuse to give the information. We've seen it from the We Charity scandal, from asking for vaccine contracts. The Health Committee has been filibustered for ages over that issue. Now, why do I think that's important? Because governments make choices during a pandemic. And during this pandemic, they've made a really big choice. And I've raised this question with the government many times. Why are you not providing any funding to new businesses and startups? They have clearly made the decision, we are not going to do it. Now, is it an economic reason? We don't know because they won't answer the question. But if it's an economic reason, they're saying we've made the economic choice to let these businesses fail. How much did you waste on giving vacation returnees access to this benefit? Because that money could have been given to support new businesses. And as I've said to the members opposite, when I spoke on this with respect to C14, I said, if you spent some time talking on the telephone with new businesses whose business is going bankrupt, they have invested their life savings, their family savings, they may have taken out a mortgage on their home to fund the business, and they are going to lose it all. And my pleas and my letters that I've written to the finance minister, to the prime minister, to the small business minister, none of those letters get answered, and nothing changes. We do not end up with any support for small business. I am betting they would be grateful for the $5 million, or the $10 million, or the $50 million that was spent on this benefit to people returning from vacations. Now, will we see that information? Will my colleagues on the other side of the House commit today? We will look into how much money was spent for returning vacationers on this benefit, and we will inform the House? I doubt it, because it's very difficult to get information from this government, whether it's vaccine contracts, whether it's How many people access this benefit who should not? So, for the members of the government to say that Parliament is so small that we do not need to debate legislation, I think is an insult to all parliamentarians that serve.
The honourable member will have 8 minutes and a half to resume debate once we take on this bill again. In accordance with Standing Order 38, a motion to adjourn the House is deemed to have been made and seconded at this time. Therefore, the question is that the House do now adjourn. The honourable member for Regina Leeuwin.
Thank you very much, Madam Speaker. It's a pleasure to be here this evening to talk about a question I asked to the Minister of Transport. And the question stated, NAV Canada is planning to close air traffic control towers across the country. One of those control towers is in Regina at the International Airport. I met with NAV Canada officials on December 4th to talk about the process to close these towers and how they would decide which ones would be shuttered. They said this process would take months. I have a question from the Minister of Transport. Why is it that the Regina Airport employees received vulnerability notices on January 14th if the report is not finished yet? The response I received from the Minister of Transport was less than satisfactory. He said NAV Canada is undertaking several studies to assess the level of service needed. No decision has been made. It is important to note that any changes in the level of service proposed by NAV Canada will be subject to a rigorous safety assessment by Transport Canada. The process provides for full consultation with all affected stakeholders. The problem I have with this answer, Madam Speaker, is that I believe the decision has been made already, and so do the workers at the air traffic control towers in the Regina International Airport. They're just trying to find out ways that the report confirms their biased decision to have these air traffic control towers closed. I've heard often now from members, including from the Kings Island and the member from Winnipeg North, and they talk about a Team Canada approach. So I want to bring up one thing that we should all have in common is a letter came from premiers from across the country where these air traffic control towers are going to be closed. Sandy Silver from the Yukon, John Horgan, BC, Jason Kenney, Alberta, Scott Moe, Quebec, Saskatchewan, Francis Legault in Quebec, and Doug Ford in Ontario. All of these premiers have asked, and I believe it's a reasonable ask, and a question I'd like to have answered from whoever will be representing the minister this evening is, with all the premiers of all political stripes coming forward and asking for a delay in this review until we can know what happens to air traffic and the air traffic complex flights and the flights that are going to return after COVID-19, is it not a reasonable request that these premiers and I are making to delay this review until we get to pre-COVID-19 flight status across the country to see which airports will be active and which won't? A second ask I have to whoever will be answering the question this evening is, 15 Wing Air Base in Moose Jaw is in the same flight zone as the Regina International Airport. I think it is imperative that National Defense, the Department of National Defense, takes into consideration what would happen if there's not an air traffic control tower in Regina, because there are complex flights going through there, and the safety of the trainees at the 15 Wing Air Base is of paramount importance, as safety for all air travelers should be important. And I'd ask that there not be a decision made until the Department of National Defense takes into consideration what the safety will be at 15 Wing Moose Jaw. Finally, the fact that the people of Regina think this air traffic control tower may be closing has already affected flights and possible flights. We have travel agents that say Air Canada has said there will not be some trips being taken, and it's affecting people throughout the city of Regina. I talked to travel agents Lauren Lawrence and
Parliamentary Secretary to the Minister of Transport.
Thank you very much, Madam Speaker. First of all, let me begin by reiterating that the safety of Canadians is Transport Canada's top priority, and no compromise to safety will be tolerated. The onset of the global pandemic has brought many challenges for all industries, and the air sector in particular has taken a grave hit. Transport Canada has been communicating with NAV Canada regarding their proposed level of service changes at select sites from the very beginning of this crisis. Prior to making any decision, their proposal will be thoroughly reviewed and all aspects of safety will be rigorously analyzed by civil aviation experts. I can assure you that the Minister will not hesitate to reject their proposal if deemed that the changes would result in an unacceptable risk to aviation safety. Although Regina is in fact one of the sites that are being considered for a service change, there were no layoffs that occurred on January 14th. Some employees were provided with notices indicating that their position may be impacted as a result of the aeronautical study. NAV Canada is actively engaged in a consultation process where stakeholders are invited to share their concerns, and NAV Canada will present their aeronautical studies and conclusions to Transport Canada, who will review them in detail. In light of the ongoing pandemic, Canadians continue to be advised against traveling abroad and face mandatory quarantine for 14 days upon returning. Since January 6, 2021, travelers aged 5 and above arriving in Canada must provide proof of a negative COVID-19 molecular test prior to boarding a flight to Canada. In addition, new travel restrictions and additional measures were recently announced to help limit the spread of COVID-19, including the suspension of all flights to sun destinations until April 30th, and restricting the point of entry for inbound aircraft flying to Canada to 4 major airports. In the coming weeks, all air travelers arriving in Canada will be required to reserve a room. Actually, sorry, Madam Speaker, that's already happened. The individuals coming will be required to reserve a room in a Government of Canada approved hotel for up to 3 nights at their own cost and take a COVID-19 molecular test upon arrival. It is no surprise that all these measures, while necessary to limit the spread of the virus and to maintain the safety of the traveling public, have resulted in reductions in passenger volumes by almost 90% and major reductions in both air traffic internationally and domestically. These reductions have a direct impact on NAV Canada's revenue, and new measures continue to roll out. They will likely bring further financial losses to the air navigation service provider. As an attempt to mitigate losses, NAV Canada has already conducted staffing cuts, increased their fees, and borrowed money, and will likely need to implement additional measures and strategies as they forecast further losses in the current fiscal year. Transport Canada will continue to work closely with NAV Canada to ensure the safety of air transportation in Canada as NAV Canada works to implement any proposed changes. Thank you, Madam Speaker.
Honourable Member for Regina Luwan.
Thank you very much for reading those speaking points. I just have 2 quick questions. One, will the Parliamentary Secretary take into consideration the request from 6 premiers from across Canada in a Team Canada approach to delay this review and ask the Minister to do that? And to my constituents, Laura Lawrence and Audra Langton, who are travel agents who depend on flights coming in and out of Regina, what do you say to them when their business is at risk because decisions made that are in this government's hands by closing the air traffic control tower so they do not have the services and they cannot provide those services to their clients? These are women who have risked everything to start businesses, and one as recently just started in September 2019. She's looking to this government for support, to this government to maintain the quality and safety in the Regina International Airport so that she can support her family, support her kids, and have a business.
The Honourable Parliamentary Secretary.
It's fascinating, Madam Speaker, that the honourable member is accusing me of reading notes when he had to look down to check the names of his own constituents. As I said, Madam Speaker, the primary objective as Transport Canada is safety. This is a crisis that has been brought on by a virus, is brought on by COVID-19 that has caused devastation. The air traveling public and their safety is the primary concern of the Minister. And as I said, Madam Speaker, we will not hesitate to take any action required to ensure their safety going forward. Thank you so much.
The Honourable Member for, Leeds, Grenville, Thousand Lakes and Rideau Islands.
Well, thanks very much, Madam Speaker. It is a pleasure to join the adjournment proceedings this evening. And I want to talk about the issue that I raised in the House and heard from the Parliamentary Secretary on, and that, of course, is access to reliable high-speed internet. And now more than ever, Canadians are counting on having access to that reliable, high-speed internet. The strain of the pandemic has forced many people to work from home, for students to learn from home. And this is already, particularly in rural areas like in Eastern Ontario and in my riding of Leeds, Grenville, Thousand Islands, and Rideau Lakes, caused an issue with respect to the amount of bandwidth that's available for folks who were running their businesses on already very limited options with getting their internet over the air, for example. Small business owners need to be able to connect to the virtual marketplace, and lockdowns have really exacerbated that problem and created a much bigger need than we had before. Farmers who are on the cutting edge of sustainability need to be able to connect for crop, herd, and soil management. And that really is essential so that they can continue to feed our families with the highest quality product in the most effective way possible. We've also seen during COVID-19 the need for seniors to be able to connect for access to their healthcare services. We're seeing more and more an increase in the use of telemedicine services, which is fantastic. And in more urban areas where high-speed internet is the rule and not the exception, that's a wonderful thing. But here in Eastern Ontario, as an example, in many places across rural Canada, it is a tremendous challenge and greatly reduces access to care. Especially when people are very concerned about their health, unable to travel to medical appointments.
I'm just listening to this to see.
So. Families have been forced to be apart from each other for a year now, and we expect that we're going to continue to be apart for more months to come. And for many people, connecting virtually, using their using FaceTime or Skype or Zoom, that's their lifeline. That's how they're seeing the updates, whether it's with their loved ones who may be in quarantine or self-isolation, or even just grandparents getting an update with their grandkids. The need for high-speed internet is pronounced, and we've really seen an increase in that over the past year. The Universal Broadband Fund was announced well over 700 days ago, and people in my community and across Eastern Ontario are still struggling to connect. And we heard, following the announcement of the Universal Broadband Fund, a subsequent announcement, and then again in late 2020, we heard a further announcement of that fund. What we need from this government is action. We've heard the talk. We've heard that they want to do it, and they're very eager to compare their record for connecting Canadians against previous governments. Well, Madam Speaker, I think that it's pretty clear that the need for high-speed internet has only increased, and the need for action has increased. So comparing the record on high-speed internet connectivity between this government and anyone before it is not really an apples-to-apples comparison. When will this government take the steps that are needed to find
the Honourable Parliamentary Secretary to the Minister of Rural Economic Development?
And thank you, Madam Speaker. And I'd just like to take this minute on International Women's Day to, on behalf of all of us in the House, I'm sure, to thank you for your leadership and support and wish you all the best, and all my female colleagues. I'm sure I can speak for all of us in the House on that. And Madam Speaker, I am delighted to stand up and chat about our government's progress into improving connectivity for all Canadians for the member of Leeds Grenville. Madam Speaker, as we know, and as the member opposite says, I agree with him. High-speed internet accessibility is essential for all Canadians, no matter where you live, from coast to coast to coast. And I agree with him that the COVID-19 pandemic has further highlighted the importance of connectivity, and it's accelerated the need to connect all Canadians. And I'm delighted to tell him that we are on track to meeting our goals of connecting 98% of homes with high-speed internet by 2026 and 100% of Canadians by the year 2030, years earlier than previously thought. Our connectivity strategy, and we do have a connectivity strategy, includes several coordinated initiatives, including the Connect to Innovate Fund and the UBF, the Universal Broadband Fund. By the end of the Connect to Innovate program in 2023, nearly 400,000 households will have the potential to benefit from improved internet access. Over the last month alone, we have announced over 11 communities in Quebec that have benefited from investments, and they are now connected to high-speed internet. The $1.75 billion Universal Broadband Fund, or the UBF, is the program that Canadians asked us for. It was enhanced and scaled up to meet the challenges that everybody is facing. It was designed with partners, with colleagues, with small businesses, with farmers and experts to ensure it's flexible and addresses the needs of all communities all across the country, whether it's through mobile connections, fiber connections, or satellite connections. It includes tools and services to help better plan projects and, more importantly, track the impacts while addressing challenges that can happen to delay progress. As we all know, Canada is a wild and wonderful country. The UBF is going to be used to fund broadband infrastructure projects that will provide rural and remote communities with access to high-speed internet services to connect with loved ones, use virtual healthcare services, as the member opposite referred to, which is huge in my riding, to use it to manage a farm or help you with your children's homework, or frankly, just stay connected. It's going to support the required network infrastructure, whether backbone or last mile, to better meet the geographical needs and regional connectivity needs throughout the country. I'm pleased to say we've begun announcing projects under the Rapid Response Stream. These projects are going to connect households by November of this year. Earlier this year, Minister Monsef announced $6.7 million to connect 1,977 homes in communities in rural BC. They were in Pemberton, Steelhead, Ryder Lake, northwest of Princeton, and the North Sunshine Coast. In Starland County and Settler County in Alberta, 7,179 underserved households are going to be connected. And northeast of Sudbury, 74 underserved households, which includes 68 Indigenous households, will be connected. Furthermore, 190 households in Perth-Wellington region, 120 households in the Niagara region will be connected. And there will be more coming soon, Madam Speaker. These are exactly the types of projects this stream was intended for and intended to fund, small local projects that will make an immediate impact. Madam Speaker, we know there is so much more to do, but we have a strategy and a plan to make sure that every Canadian will be connected. Thank you.
The Honourable Member for Leeds, Granville, Thousand Islands, Rideau Lakes.
Thank you, Madam Speaker, and thanks to the Parliamentary Secretary for that response. And so I have heard about some of those projects that the Parliamentary Secretary has mentioned, and I would like to draw her attention and the attention of the Minister to the Eastern Ontario Regional Networks application under the Universal Broadband Fund. And I want to flag that for the Parliamentary Secretary. This program would allow 95% of the homes in the region, or more than 550,000 premises, to have gig service by 2025 if fully funded. So I would ask for right now the Parliamentary Secretary to commit to me and to all the residents in Eastern Ontario that she will undertake to review that application, to flag it for the Minister so that we can be assured that it has the government's consideration. Thank you, Madam Speaker.
The Honourable Parliamentary Secretary.
Thank you, Madam Speaker. And to my colleague opposite, I look forward to finding out. I will contact the department, again, an update for you on that, and reach out to you directly. And I just want to ensure that we launch the Universal Broadband Fund to provide Canadians with high-speed internet. We accelerated our targets to connect them even faster. That was a rapid response stream. And that is going to allow us to move quickly with projects that are already well advanced. And as a result of these projects, many Canadians will have improved access by November of 2021. And the impact of these projects are going to be felt far and wide by rural and remote communities that have limited or no access now. I want the Honourable Member to know, I really understand this. I come from a very large rural riding. My landmass is bigger than Switzerland. I have over 200 beautiful little towns. Many of them don't have connectivity, and they're excited about it. I'm excited about the Pathfinder service with the rapid response stream because that allows small communities and small internet service providers to call in and have their questions answered. And it's a 2-day maximum turnaround.
And with that, we are done. And happy Women's Day to you, the Honourable Parliamentary Secretary. L'Honourable.
The Honourable Member from Mégantic-L'Érable, he's not present in the House to raise his adjournment debate. Therefore, his name was removed.
La motion portant.
The motion to adjourn the House is now deemed to have been adopted. Accordingly, this House stands adjourned until tomorrow at 10 a.m. pursuant to Standing Order 24-1.
No.